Order. Questions for oral answer, Mr. Dennis Tan.
Question 1, sir.
Mr. Speaker, sir, may I have your permission to take questions 1 to 3 on today's order paper together?
Please proceed.
Thank you, sir. Sir, the Ministry of Home Affairs is aware of a foreign news report stating that 2 Singaporeans were among those who fought for the Israeli Defense Forces during the conflict in Gaza. The ministry has no substantiated information confirming that any Singaporean has served or is serving in the IDF. Our position has always been quite clear and publicly stated. Singaporeans should not participate in any foreign armed conflict not involving Singapore. Our loyalties as Singaporeans should only be to Singapore, and we should only ever engage in military action in defense of Singapore. If Singaporeans are found to be fighting or even planning to fight in foreign armed conflicts, these persons will be dealt with in accordance with our laws, and we have stated that and have detained people in the past for that reason, and they can be dealt with under the Internal Security Act if they are found to be a threat to our national security. And those who are found to be holding multiple citizenships may also be deprived of their Singapore citizenship. Thank you, sir.
Ms. Haslina.
Thank you, Coordinating Minister. 2 SQs for me. One is, in the event that these conflicts occur, as you mentioned that they do, how are the nationality obligations dealt with the other state? And what other upstream measures would the ministry be considering to tighten the issuance of guidelines for clarity as to Singapore's stand? Thank you.
Minister Shanmugam.
Sorry, can I ask the MP to again repeat her first part of the question?
Ms. Haslina.
Minister, I was hoping to better understand, in the event that it is found that a Singaporean is involved in this case, how would Singapore be speaking with the other country of which there is involvement, and what is the approach to that?
Minister.
Anyone with a Singapore citizen who is found to be engaging in a foreign armed conflict, as I've said earlier, and I've said previously publicly, and my ministry has also stated, will be dealt with in accordance with our laws. That could include being charged, and that could certainly include being detained under the Internal Security Act if they are considered to be a threat to national security, and many have been detained on those grounds in the past, and we have publicized them. If we come across credible evidence of such persons, we will normally engage with foreign counterparties to try and get such persons to Singapore, but people can appreciate that has its own challenges. If they are within Singapore, there is no issue. We will deal with them as we have dealt with in the past. On the second part of the question, how can we make it clearer? I think we have made it very clear. The simple answer is, don't do it, and there is zero tolerance for it.
Mr. Fadli Fauzi.
Thank you, Minister, for the answer. My question, I have two SQs. First SQ is Section 125 of the Penal Code relevant and applicable against Singapore citizens who serve in the IDF and other foreign militaries? And if not, what amendments are necessary to render Section 125 relevant to penalize the act of serving in a foreign military? Thank you.
Minister.
The member said that he had two SQs. I assume that question comprises both questions, does it? Well, whether Section 125 applies really depends on the facts, and that would require investigation. In the past, we have often used the Internal Security Act as well. In our view, given the positions we have stated, the current legal framework, including the Internal Security Act, is adequate.
Mr. Dennis Tan.
I thank the Minister for his reply. I just have one SQ. Would the government be seeking clarification with the Israeli counterparts to verify the allegations as reported in the press? Thank you.
Minister Shanmugam.
The government has asked the Israeli government. We have not received a response. And one must understand that there are obviously difficulties that other governments may face in complying with this request. We have made these sorts of requests and other sorts of requests to various governments. Sometimes we get answers, sometimes we don't get answers, because while it's an offense under Singapore law, and we consider it to be contrary to our national interest, it may not be an offense in Israel, nor may be it an offense in other countries. And persons who may be, doing these things in other countries, whether in Ukraine or in Russia or, in the Middle East elsewhere, or for Israel, may not be under any legal obligation to declare either their dual citizenship or, any other fact relating to themselves. And in such situations, those governments will not be able to even force them to give answers. They may well know that they are citizens, or they may not even know, because even the dual citizenship need not be reported. So the Israeli government, or for that matter, the Ukrainian government or the Russian government, or other governments may not even know that these people hold a dual citizenship, and any request would then have to be made to all their soldiers, let us know all your dual citizenships. And such a request is probably not enforceable. I'm just sketching out to the member the difficulties that foreign governments will have in complying with any such request. It is fairly credibly reported that a lot of American citizens fight for Israel, and that's not contrary to either American law or Israeli law. So I assume that under Israeli law, people with dual citizenship can fight for Israel, which means that if Israeli government seeks to find out such information, the soldiers may not be obliged to give that information. I don't know, I'm speculating. And if so, then there will be difficulties in getting the information, not just by the Israeli government, other governments too. But we have reached out, we haven't gotten a response, and if we get any credible information, we will take action. It doesn't matter to us whether you're fighting for Israel or Ukraine or Russia or some other Middle Eastern country or a terrorist organization. It's not acceptable, and we will take action if we find you. Thank you.
Mr. Hong Wing.
The Ministry of Social and Family Development is pleased to announce that we will make lasting power of attorney, LPA Form 1 applications free of charge for all Singapore citizens, even after the current fee waiver ends. This is to encourage more Singaporeans to plan early for their future. As of 20th February 2026, 404,000, or about 1 in 7 Singapore citizens, have made an LPA. Amongst those aged above 65 years old, 197,000, or about 1 in 4, have done so. In the last few years, with the launch of the OPG online portal and more visible legacy planning campaigns island-wide, we have seen a healthy uptake of LPA applications, but many still have not made an LPA. Therefore, we want to continue to urge Singaporeans to make the LPA. Best to do so while we are still fit and healthy, and even more so as we know our population is aging. Having an LPA in place will allow Singaporeans and our loved ones to have peace of mind, knowing that there's someone that we can trust, who have the legal authority to make decisions on our behalf when we no longer can.
Mr. Yip.
Thank you, Mr. Speaker. I thank the MOS for the very good news that it's going to be free. And besides reducing the cost barrier, some members of public, especially seniors who still find it difficult to understand what an LPA is and why it is important to make an LPA. Can MSF do more in terms of stepping up public education and awareness of LPA, as well as perhaps making the process easier by having it in different languages and having more support to help seniors? Thank you.
MOS go.
Mr. Speaker, we agree with the member that public education is important, and we have been doing that consistently and will continue to step up on it. We've been working very closely with various agencies, including AIC, including CPF Board, MOH. In terms of running interagency campaigns, we're also working very closely with People's Association and various grassroots organizations on the ground, tapping on their various target audiences and their own lists, their own contacts, to make sure that we're able to get messages to as many Singaporeans as possible. And we will continue to double down on those efforts. As the member mentioned, we're also working on making sure that in terms of the languages, we are able to reach out to all our target audiences. We're also working on simplifying the messaging of our campaigns. Sometimes in the LPA process, there can be some legal terms, medical terms. So we're trying to simplify those so that we are able to help make sure Singaporeans understand the importance and the urgency of making the LPA. Of course, I'll make this call in this House as well, wishing all our members of Parliament to support this effort and help carry the messages down to their own constituencies too. Thank you.
Associate Professor James Lim.
Thank you, Speaker. My question has to do with the LPA process as structured by the Office of the Public Guardian. One of the difficulties that we had faced in this last-minute rush to the prior deadline was that when residents tried to when we organize LPA sessions for residents, we face difficulties with the site being very draggy. Now, I understand that this may be a question that perhaps is better directed toward GovTech, but we are wondering whether there are, on the side of the Office of Public Guardian, whether there has been any indication that the site has encountered difficulties, and if so, whether there are plans to upgrade the capacity of the site going forward.
MOS go.
Mr. Speaker, maybe I'd like to ask the member to clarify, because when we definitely want to improve the website to make sure that it's a lot more user-friendly and intuitive. So if the website is draggy, there can be a few reasons why it may be so. It may be a function of trying to recall from a database, pulling from other government agencies' database to complete the form filling. It may also be because of other reasons, including the applicant's computer system. So useful to know where exactly is the observation, and we can follow up on that.
If I may suggest, the details can be given to MOSGO subsequently. MOSGO, my wife and I have done our LPA. Mr. Saktiandi Supat.
Mr. Speaker, I've also done my LPA. May I have your permission to answer oral questions number 5 to 7 by Mr. Saktiandi Supat and Dr. Chu Pei Ling, as well as the written question number 1212 filed by Associate Professor Terence Ho for the 10th March 2026 sitting, as they all relate to the US tariffs.
Please proceed.
Mr. Speaker, on 20th February 2026, the Supreme Court of the United States struck down the U.S. reciprocal tariffs that were imposed on the U.S. trading partners under the International Emergency Economic Powers Act, IEEPA. On the same day, the U.S. announced a tariff of 10% under Section 122 of the Trade Act of 1974 on all U.S. imports for 150 days. The U.S. Customs and Border Protection started collecting this 10% tariff from 12:01 a.m. on 24th February 2026 U.S. time. While U.S. President Donald Trump announced via a Truth Social post on 21st February 2026 that the tariff rate would be raised to 15%, the U.S. has yet to issue an official directive on this increase. The immediate direct impact of these tariff developments on Singapore's economy is not expected to be significant, given that the current Section 122 tariff of 10% is broadly unchanged from the previous 10% reciprocal tariff that had been imposed on Singapore's exports to the US since April 2025. Those sectors with a greater dependence on the US for final demand and whose exports are covered by the Section 122 tariff, such as the precision engineering cluster and some segments under general manufacturing cluster, could see a greater impact from any tariff increase. There remains considerable uncertainty. It is unclear if the current 10% Section 122 tariff will be raised to 15%. It is also unclear what the overall tariff landscape will be after the current 150-day timeline. At the same time, we may see sectoral tariffs under Section 232, as well as tariffs imposed other different legal authorities in due course. We will continue to monitor such developments closely and engage our US counterparts to ensure that our economic interests are safeguarded. We will also continue to work with our tripartite and industry partners through the Singapore Economic Resilience Task Force, CERT, to gather feedback on how businesses and workers are affected. For instance, CERT convened last week to discuss the tariff developments and preliminary sentiments of businesses and workers. The government is committed to helping our businesses and workers navigate the changes arising from these tariff developments. In October 2025, CERT launched the Business Adaptation Grant, BizAdapt, to help businesses affected by the tariffs to evaluate the impact, optimize their supply chains, and reconfigure their operations. The Graduate Industry Traineeship GRID was also launched as a temporary scheme to help fresh graduates gain industry-relevant experience and skills amid economic uncertainty so that they are better equipped to transition into full-time employment subsequently. At Budget 2026, the Prime Minister and Minister for Finance announced that support levels under BizAdapt would be raised from up to 50% to up to 70%. We stand ready to provide further support as needed.
Mr. Saktiandi Supat.
Mr. Speaker, I'd like to thank MOS for her answers. I have one clarification, supplementary question. Usually, after Section 122, it usually precedes with a Section 301 to 32 investigations, and bigger tariffs. The concern is whether bigger tariffs may come in later. So the question I have is, given that sort of situation, that Section 122 is temporary and may be followed by further investigations or additional trade measures, as President Trump has indicated, to 15%, could the Minister elaborate on how the government is preparing Singapore businesses for the possibility of more persistent tariffs or sector-specific measures, which I've raised many times, my concerns about sector-specific tariffs or measures, and whether Singapore has a clear contingency playbook. I know MOS has mentioned about the CERT and BizAdapt, which is very good, and I hope we can do even more to help our businesses. But the question is, on a broad level, macro level, whether Singapore has a clear contingency playbook should global trade conditions deteriorate further, and on top of that, the additional concern that we're facing out of Middle East and with the Strait of Hormuz and other possibilities that may arise. Thank you.
MOS Khan.
Mr. Speaker, we are watching the situation closely, and through CERT, we are keeping close touch with businesses and the workers and industry partners of various sectors to understand the impact and the implications of the tariffs and the great uncertainties. Indeed, like Mr. Satyandi said, there could be further changes to the tariff landscape. Now, just let me highlight that thus far, the tariffs' impact on Singapore's economy we assess it to be rather limited. And I think we are very thankful that there have been measures put in place and there's some resilience in various sectors. Now, SBF is also doing its part in partnership with the government to advise companies. For example, SBF has published a playbook to guide companies on key actions to take, such as how to sense-make the impact through risk mapping, take action such as reconfiguring their supply chains, and also planning ahead by digitalizing and innovating to build long-term resilience. We stand ready to roll out further measures to support sectors that are affected where necessary.
Dr. Chu Pei-Ling.
Thank you, Mr. Speaker, and thank you, MOS, for your reply. Now, beyond seeking exemptions and supporting affected businesses, how is Singapore strengthening the resilience of our trade model in light of these new US tariff measures? And additionally, how can Singapore continue to position ourselves as a trusted and reliable economic partner amid rising trade tensions? Thank you.
MOS Khan.
Mr. Speaker, Dr. Chu Pei-Ling's questions require very long answers, but I know that we're short of time. I actually suggest that she refer to my speech in MTI COS, but just to highlight a few key points. Singapore will continue to safeguard and expand our economic space by deepening, diversifying, and also defending our economic interests and also our trade linkages with all our trading partners. We have a robust network of partnerships with like-minded countries that share our commitment to free, fair, and open trade, and we will continue to deepen our collaborations with them. And in addition to strengthening trade links with key trading partners, we are also pursuing closer trade relations with emerging markets such as Latin America, South Asia, Middle East, and Africa, and also furthering our cooperation in growth areas through digital and green economy agreements such as the EU-Singapore Digital Trade Agreement. Now, we encourage businesses to continue tapping on our 29 free trade agreements, including the CPTPP and the RCEP. And of course, as I mentioned, at the MTI COS, we are strengthening our regional block-to-block engagements. These are all done very deliberately with the long-term interest of diversifying and deepening Singapore's network of trade relations.
Mr. Fadli Fauzi.
Question 8.
Mr. Speaker, for the ongoing service adjustments along the Circle Line for tunnel strengthening works, LTA has kept commuters informed well in advance through publicity and community engagement efforts. At the affected stations, crowd marshals were also deployed to guide commuters and manage the crowds. We also started the replacement shuttle bus services 2 weeks early to allow commuters to familiarize themselves with alternative routes before the service adjustments, which improved the situation significantly in the initial period. With these measures in place, we have kept wait times and loading for trains manageable. Most commuters continue to be able to board the first train, other than at certain busy stretches where higher crowding is observed even without the planned closures. We have not decided yet if scheduled closures are going to be needed for the North East Line improvement works, but we will incorporate these lessons and feedback from commuters in refining our provision of alternative travel options for future service adjustments. Thank you.
Mr. Fadli Fauzi.
Thank you, Minister, for the answer. Will the Ministry consider having shuttle buses that go beyond the impacted section of the MRT line? For example, if Kovan to Hougang was closed, can we have shuttle buses that go from Kovan to Punggol Coast to make it more convenient for commuters? Or maybe increasing the frequency of trains on the other impacted sections of the other non-impacted sections of the line, so that we can reduce the waiting time and inconvenience costs to the commuters. Thank you.
Acting Minister Seah.
Mr. Speaker, I thank the member for his suggestions. I think when the time comes for us to look at what are supporting services that we will put in place for the North East Line's work, we will certainly consider those suggestions that he has given us. Thank you.
Mr. Jaragiam.
Mr. Speaker, the tunnel strengthening works for the Circle Line are progressing as planned. As at end February 2026, about 50% of the required steel rings have been installed. Works are being carried out at a pace that will ensure the safety of our workers and commuters, and we remain on schedule to complete them by 19th April 2026, which is what we have committed. We will continue to monitor and adjust our train and shuttle bus services to minimize inconvenience to commuters. Thank you.
Mr. Giam.
Thank the Acting Minister for the reply. Just two questions. First, is there any chance that it can be brought forward so that commuters don't have to be inconvenienced for so long? Secondly, a 10 to 20-minute delay in a trip translates to about 2.5 hours of extra travel time per week for commuters along the Circle Line who go to and from work. And in view of this time loss and the extra distance traveled in fares for alternative routes, has the Ministry considered requiring operators to provide fare rebates or discounts for commuters affected by these service adjustments as a form of accountability for the inconvenience caused and reimbursement for the extra costs incurred for this and also for future MRT rail renewal works? Thank you.
Acting Minister Seah.
Mr. Speaker, I thank the member for his question. We are trying our best to keep to the project timelines. At the moment, our assessment is that it remains on track, that it's not possible for us to bring the project timelines forward. And this is really because the works are complex, and we want to ensure that the safety of the workers and the people involved are prioritized. So we are not rushing the project, we are on time to do so. On his second question, I think what we have done is to provide alternatives for our commuters as far as we can. There is adjustments that commuters will have to make in terms of their travel routes, but there are alternatives on both the train and the buses, and these are, I think, sufficient for us to accommodate the alternative travel plans that commuters need to make whenever we have to do these works. Going forward, we'll have to do these works across the board for the network in a more intensive and widespread fashion, because our train network is aging. And so we seek the commuters' support and understanding that this is quite normal. I think no other train system in the world offers travel rebates when doing such maintenance works, and I think it's commonly accepted that this is part of the way we try to do our best to sustain both the efficiency, the reliability, as well as the financial sustainability of the public transport system. Thank you.
Ms. Cassandra Lee.
Question 10.
From 2023 to 2025, the proportion of fires attributable to unattended cooking or electrical origin in residential premises was 68%, 65%, and 59% respectively. The corresponding figures in commercial premises were 66%, 72%, and 67% respectively. Over the same period, 5 fires in residential premises and 11 fires in commercial premises involved breaches of the fire code. For fires involving batteries, SCDF does not track whether the batteries were compliant with the prevailing regulatory requirements. The member may wish to refer to MHA's response to the adjournment motion on fire safety in our homes on 12th of January 2026 regarding our approach towards fire safety in homes and tackling fire safety risks in general.
Ms. Lee, I'll allow a short clarification.
Thank you, Speaker. I just asked because I encounter fire safety issues in my constituency. Batteries will become more prevalent. The ministry has said in your budget that you will step up on public education as well as strengthening the regulations on online sale and advertisement of AMDs. I asked the ministry what is the ministry's strategies vis-a-vis fires involving compliant batteries. Is the government considering strengthening regulations like more stringent mandatory battery certification framework, regardless of its application? Secondly, are there plans to strengthen cross-agency efforts to raise awareness of fire safety in homes and housing estates, including common corridors? Thank you.
MOS go.
Mr. Speaker, I'd like to make a differentiation in response to the member's question. When we mention batteries, compliant or non-compliant batteries, I'm referring generally to, in my earlier reply, to power banks, for example. Those we do not track. And I think the House can appreciate why it's very difficult and perhaps not cost efficient for SCDF to track those cases. It's also sometimes very difficult to ascertain after the fire has taken place whether the particular item is compliant or not. But if we are talking about AMD batteries, then those are tracked. And I think previously we have mentioned that AMD fires account for less than 5% of all fires, but the impact, be it in terms of injuries and fatalities, are disproportionately higher, and therefore is something that is of concern, and I think recently MOT has moved the bill to that regard. In terms of cross-agency efforts, I again refer to the adjournment motion. I've spoken quite extensively previously in terms of how MHA SCDF works very closely with all our counterparts, including People's Association in terms of community outreach, in terms of working even with schools, for example, as well as town councils in terms of some of the real actions on the ground in terms of enforcement and regulation. Thank you.
Order. End of question time. The clerk will now proceed to read the order of the day.
Item 1. Estimates for the financial year 1st April 2026 to 31st March 2027. Committee of Supply, 6th allotted day.
Head O, Ministry of Health. The question is that the total sum to be allocated for Head O of the estimates be reduced by $100. MOS, Rahayu, Mazam.
Mr. Chairman, my speech covers the Ministry's initiatives to bring care closer to the community, how we are strengthening our environment and ecosystem for healthy living, and our efforts to improve our population's health. As our society ages, improving our population's health and preventive care is critical for longer, healthier lives. We have embedded preventive healthcare into the community through Healthier SG and AgeWell SG to support residents while they're still relatively young and healthy and as they age. Mr. Alex Yeo and Dr. Hamid Razak would be pleased to know that the development of Healthier SG care protocols related to frailty and functional health, such as for osteoporosis and dementia, are progressing well and would be rolled out in 2028. These care protocols will ensure evidence-based care is provided more consistently through Healthier SG general practitioners, GPs. Ms. Mariam Jaafar also spoke about improving community health, in particular the North region. Our data shows that in the North, the prevalence of diabetes and hypertension is above the national average, and residents engage in less physical activity. While we continue to review the reasons for these trends, we are simultaneously stepping up our preventive care efforts in the region. We will start off with Woodlands Town first. We will enhance the community health posts in the town. Secondly, we will improve access to specialist-supported care in the community. Thirdly, we will support residents to engage in healthy living activities by opening up community spaces for exercise programs, introducing digital wayfinding in Healthy 365, and empowering local community health advocates. As seniors age, visiting polyclinics and hospitals can be difficult due to mobility issues. Many also ignore symptoms that are not yet serious or urgent. Consulting a healthcare professional early can lead to early identification of issues, which in turn leads to earlier intervention and better health outcomes. We agree with Dr. Harish Singaraju's view that it is important to connect patients to community resources, and we are enhancing accessibility of health services by bringing care directly into the community. I'm pleased to announce that NHG Health has been progressively enhancing 11 community health posts, CHPs, across Woodlands Town since the start of this year. These enhanced CHPs, which are located within active aging centres, AACs, will be open once a week. All residents, including non-seniors, can walk in to these enhanced CHPs to access services such as general health advice, basic health assessments, and social prescriptions, which include linking up residents with community programs and resources, support for preventive health and disease management, including health coaching, medication review, and chronic disease and frailty management programs, and support for caregivers and post-discharge follow-ups for patients returning home from hospitals. These services are provided by NHG Health's community health teams, comprising community nurses and health coaches who will bring in pharmacists, dietitians, and therapists based on residents' needs. They also work closely with GPs in the region and healthcare professionals in hospitals to provide coordinated care for residents with chronic diseases and frailty. For example, residents with diabetes receive ongoing support at enhanced CHPs through glucose monitoring and personalized health counseling, with the community health teams regularly updating the residents' specialist doctor on their progress and any changes in their condition. This ensures interventions can be made early if needed. For seniors who are already at the AACs for programs, they can also consult healthcare staff easily without needing to make a separate visit. We have also noticed that some patients miss specialist appointments due to work schedules or limited mobility. To address this, Woodlands Hospital will launch a new initiative starting end of this month to provide specialist-supported care for patients in the community through the enhanced CHPs in Woodlands and direct teleconsultations with individuals. Starting with diabetes and asthma, selected patients can choose to receive specialist-supported outpatient care at an enhanced CHP through teleconsultation with the hospital care team. Instead of travelling to Woodlands Hospital for their appointment, they will be able to see a health coach or nurse at the enhanced CHP to manage their condition and will receive support from the specialist doctor through teleconsultation. With regular monitoring of health conditions, nurses are able to pick up early signs of poor control and work with specialist doctors for early treatment and help patients avoid unnecessary hospital admissions. Woodlands Health has also started rolling out teleconsultation for selected patients who have undergone colonoscopy screening with low-risk screening results. Instead of making a trip to Woodlands Hospital, patients can choose to teleconsult their specialist doctor from anywhere, including at the CHP if they need help. This option will be further expanded to other specialities and procedures in Woodlands Hospital. With these services, patients will be better supported by the community care teams in their neighbourhood while requiring fewer visits to Woodlands Hospital. This will help patient access required care in a more flexible way while working around other commitments. NHG Health estimates this will save about 500 physical specialist outpatient clinic visits. This is expected to increase further as the initiative expands. Even as we are bringing healthcare services closer to the community for greater accessibility, we agree with Ms. Mariam Jaafar that health begins with individual choices, and we can design a healthier ecosystem to support individuals to make better personal health choices in different settings. One key setting is the immediate neighbourhood that residents live in. The Health Promotion Board conducted a study and found that residents are more likely to participate in health activities held in everyday surroundings that are accessible, green, and fit seamlessly into their busy lives. They also value social experiences that are fun and community-driven. These insights point to the need for a collaborative, ground-up approach with local community partners. They understand both residents' needs and preferences and the community spaces within the neighbourhood. They also play critical roles in facilitating access to neighbourhood facilities and spaces, encouraging participation in activities, and building social connections that will make healthy living appealing and sustainable. Thus, HPB will work with local community partners so that residents will find it easier to access and participate in healthy living activities. From April 2026 onwards, more residents will be able to join workout and exercise sessions in familiar, convenient and spacious locations, including community halls, plazas and malls near their homes, such as 888 Plaza and Fuchun Community Centre. In tandem with holding more activities in the community, we will help residents explore and make greater use of existing neighbourhood amenities themselves. HPB will enhance the Healthy 365 mobile app with wayfinding and gamification features to connect residents to nearby opportunities to stay healthy and active in their everyday environment. For example, residents may be prompted to complete a brisk walk along park connectors or trails within their neighbourhood and complete digital check-ins at designated points. This feature will roll out progressively from June 2026. Residents can continue to receive rewards when they track their participation via the Healthy 365 app. Beyond infrastructure, what will be key is the software, the networks and the bond of the community. We want residents to look out for one another and encourage relatives, neighbours and friends to participate in healthier lifestyles that will build healthier people and healthier towns. HPB will support local community stakeholders who have deep understanding of residents' needs and community resources to co-design healthy lifestyle programs. This includes developing a citizen-centric playbook from June 2026 to help partners effectively plan relevant activities for residents. Through collective ownership, residents will benefit from healthy lifestyle programs and activities that are tailored to them. We will also jointly monitor progress to continually refine and improve on the initiatives. HPB will explore how to expand successful elements to other towns. Besides ground-up, community-led initiatives, we are looking at ways to mitigate lifestyle risk factors to improve the health of our people. One example is a cohort smoking ban or tobacco-free generation policy as mentioned by Ms. Herting Roo. This means to restrict access to all tobacco products for a specific birth cohort onwards. Through our current multi-pronged approach of policy measures, public education and cessation support, we are making good progress in reducing the prevalence of smoking. Prevalence has declined over the years to 8.4% in 2024 and even lower in young adults aged 18 to 29 years at about 5%. We are also continually reviewing our tobacco control policies, including the tobacco-free generation policy, which some other countries are exploring. Adopting a cohort smoking ban requires serious consideration. We remain open to the policy and will study its effectiveness, impact, and how it may be implemented in Singapore's context. MOH is focusing our attention on combating the scourge of vaping. Hence, for now, we will continue to monitor international developments and learn from the experiences of other countries in how they implement a cohort smoking ban. Mr. Chairman, allow me to say a few words in Malay. Pengamalan.
Adopting healthier lifestyles is something that we need to work towards collectively in our community. The National Population Health Survey 2024 showed that our Malay Muslim community has some areas to improve on. First, on screening. Chronic disease screening among Malay residents dropped nearly 10 percentage points from 64% in 2019 to 55% in 2024. Breast cancer screening rates have fallen from 29% in 2019 to just 18% in 2024. When chronic conditions and cancer are not detected early, serious complications may arise which will require more intensive and costly treatment. I understand that topics on health such as screening can be daunting. Therefore, it helps to be able to speak to trusted healthcare workers in a familiar setting to guide us along. For many in our community, the mosque is a good setting that provides this kind of support. Therefore, I am pleased to announce that 2 mosques in Woodlands, An-Nur Mosque and Yusof Ishak Mosque, will be partnering with NHG Health to provide community health post services by September 2026. A range of services from general health advice and basic health assessments to support for preventive health, disease management, and post-discharge follow-up will be provided. We will tailor these services to our community's needs. For example, consultations can be conducted by community nurses and health coaches who are fluent in Malay to help minimize communication barriers, especially for seniors. NHG Health will also seek feedback from asatizas to include faith-based guidance into health workshops. By bringing healthcare services to familiar settings frequented by our community and partnering with religious and community leaders, healthcare will become more accessible to our community. To further encourage health screening among our Malay Muslim community, since May 2025, the Health Promotion Board, or HPB, has trialled the Jom Check, or Let's Check program. This program provides individual support in small group settings to help residents enroll in Healthier SG and book health screening appointments. This is done in collaboration with many healthcare partners. So far, 16 sessions have been organized island-wide, reaching more than 300 residents. We have received positive feedback. Thus, HPB will scale up Jom Check to reach out and benefit more residents. Taking small steps like going for regular health screenings now can help avoid bigger problems in future. This is easier to do with Healthier SG, as eligible enrollees can enjoy special subsidies for Healthier SG screening tests. Today, about 57% of eligible residents have enrolled into Healthier SG. This percentage is higher for those aged 60 and above, at approximately 70%. Our community also registered the highest growth in enrollment over the past year. This is very encouraging. For those who have not yet enrolled, I highly encourage you to take that crucial step and enroll today. The second issue is obesity. 32%, or about 1 in 3 people in our community, is obese, a rise of nearly 10 percentage points from 24% in 2020. This is a major concern as obesity increases our risk for developing multiple chronic conditions. The National Nutrition Survey shows that calorie intake as well as consumption of sweet foods and drinks is highest among our community. We also consume a high amount of saturated fat. This could be due to the excessive use of cooking oil. However, I am confident that we can make small, sustainable changes that is in line with our lifestyle and culture. Indeed, in our culture and religion, balance is important. Taking care of our body is a sacred responsibility. Let us reduce our intake of sugar, sodium, and saturated fat and eat a healthy, balanced meal. The government, together with MUIS, Mendaki, and PA Mesra under M-Cube and partners from Jaga Kesihatan, Jaga Ummah Network, JKJU, will continue to support efforts to enhance our community's health and well-being. It warms my heart when I see our community making steady progress. Through the efforts of Focus Area 5 or FA5, more than 90,000 people have participated in various programs in 2025. We are now in the holy month of Ramadan, and it is an ideal opportunity for our community to resolve to lead a healthier lifestyle. We will continue to work with our partners to reach out to the community. Come, let us all take the first step today and enroll in a health program.
The path to a healthier life is wide enough for everyone to walk on. Through our initiatives, no one has to navigate the health journey alone. By working hand in hand with our community partners and residents, we can build a Singapore where healthy living is inclusive, accessible, and a lived reality for every one of us. Thank you.
Minister Ong Ye Kung.
Mr. Chairman, 3 years ago in April 2023, I informed the House that Singapore will become a super-aged society in 2026. This year, this is when 21% or more of our population will be 65 and above. So you consider in June 2025 last year, already 20.7% of our population was 65 and above. And that percentage has been going up by about 1 percentage point every year. So we should have crossed 21% by now. So as I speak, Singapore is a super-aged society. So welcome to super-aged Singapore. When was the exact point of transition? Actually, I don't think anybody knows. We can do an estimation. What happened at the exact moment? Nothing dramatic. There wasn't a SCDF siren or anything. It came and gone. Aging does not arrive with a bang. Neither is it a whimper. It progresses quietly with a real and profound impact. And at MOH, we feel it very strongly in the hospitals, in the emergency department, in nursing homes, and we are doing our best to manage the workload and care for all our patients. More importantly, we foresaw this demographic transition years ago and took as many early action as we can. This includes raising the GST to strengthen our fiscal position, increase the retirement and re-employment ages, build many more age-friendly streets and two-room flexi and senior apartments, bolstered financial security for seniors through Silver Support, CPF Life, MediShield Life. And these policies are long in the making. They have helped cushion the impact of this very profound demographic transition. But arguably the most complex task is to prepare for an older population is to sustain and to transform the healthcare system. These are the two topics I want to talk about today, sustain and transform. Let me first touch on sustaining the healthcare system. Rising demand and care means the healthcare system must expand. It will become bigger, which we are doing. At the opening of this term of Parliament, the MOH addendum set out the target of adding 2,800 more public acute and community hospital beds between 2025 and 2030. We are on track. However, meeting rising demand and running a larger system will cost more. And if we do not manage this carefully, rising healthcare spending can strain public finances and household budgets alike. In fact, if we are really extravagant, we are not careful about it, it can even cripple our system. How do we ensure healthcare remains affordable? I think we need to start at the very top to ensure that the national healthcare bill is under control. Otherwise, it's like the Titanic sinking and you are pouring water out of the deck. It must be floating. National healthcare expenditure, and that is the hospital bill of the nation. And that bill, remember this, is always and is ultimately paid by the people, whether through healthcare charges, through taxes, through insurance premiums, through medical security contributions, ultimately is always paid by the people. So a government can claim we provide cheap or even free healthcare. It's actually not very true. The truth is healthcare is never really free. Even if patients do not pay anything at the point of delivery, they will just pay in some other ways. A sick nation that consumes healthcare indiscriminately will incur a large and wasteful bill, and it will be very costly to the population, to the households, to the patients, to the people. So with your permission, Mr. Chairman, may I display a couple of slides on screens, please?
Go ahead.
Thank you. This is a scatter chart, different countries, and you can see Singapore is an outlier in the bottom right corner. Let me interpret this chart. The vertical axis measures how much the population spends on healthcare. Developed economies, shown by the different dots on screen, typically spend about 9 to 12% of GDP on healthcare, with the US outlier in the other direction spending 17%. Singapore spends below 5%. The horizontal axis is average lifespan. This is an internationally accepted and generic measure of health outcomes. And Singapore has one of the highest lifespans in the world. But of course, beyond lifespan, there are many other measures of health outcomes. And across all these measures, Singapore are comparable or even better than many developed economies. So how did we become an outlier like this? I think it has a lot to do with our S+3M healthcare financing system that members are familiar with. And MediSave is the linchpin of that system. Singaporeans and our employers set aside part of our monthly income into MediSave. The government also provides top-ups from time to time for various segments of the population, and we did that again this budget. And we then use MediSave to co-pay directly for a small part for the cost of healthcare. So even a modest co-payment, it goes a long way to instill discipline and reduce unnecessary consumption on both the supply as well as the demand sides. And we do not have to look very far to imagine what happened when that discipline is eroded. You just look at private healthcare in Singapore. The discipline of co-payment was weakened because of overly generous insurance, including the IP riders. And as a result, private hospital bill sizes have been rising rapidly. Private insurance premiums have been escalating very quickly. So once that genie is out of the bottle, it is difficult to put it back. But we will try. It will not stop us from trying. In our S+3M system, multiple payers, they pull their weight to pay for this national healthcare bill. Apart from co-payment, we have insurance schemes like MediShield Life. It plays a sizable role. A big part of it is also paid by charity dollars. We thank all the donors and philanthropic organizations. But the biggest proportion, about half, of the national healthcare bill is paid through tax revenues, redistributed as government healthcare subsidies. The government health budget today is about 2.7% of GDP this year. And it is expected to rise to about 3.5% GDP by 2030. This 0.8 percentage point increase is actually very significant. It means increasing government health budget from about 22.5 billion this year to about 30 billion by 2030, or in 2030. And beyond 2030, the government health budget will likely continue to grow. And we must ensure that the increase can be supported by economic growth and by rising tax revenues. And at the same time, we must continue to maintain that discipline and avoid unsustainable level of healthcare spending that we see elsewhere. So the next topic I want to talk about is to transform the healthcare system. A healthcare system for a young population is very different from one for an older population, for a super aged society. Because you imagine for a young person, sickness tend to be episodic. You are admitted to hospital, you got treatment, you get discharged, and then you recover. Good health is the default. On the other hand, an older person's care journey is complicated and continuous. When well, they need preventive care. When sick, they need coordinated care because they tend to have multiple conditions. Post-discharge, they need rehabilitative care and follow-up care in a community. Good health is not a default, it's a continuous quest for an old person. So from episodic hospital care, we now need continuous multidisciplinary care across settings. And this shift is reflected in how we have allocated healthcare funding over time. Let me show another chart on the screen. Left chart is the height of the chart is our government healthcare budget, 2021. Right bar is 2024. You can see that overall budget has increased by 1.5 times. But I want to draw members' attention to the composition. At the start of this decade, 2021, about 3/4 of our operational funding for the healthcare sector went towards acute hospital care. That's the white portion of the bar. The remaining 1/4 was spent on aged care and population health, including preventive and primary care. Today, we move to the right, 2024, the budget is 1.5 times higher, but the share of acute hospital care has fallen from 3/4 to almost 2/3, and the remaining 1/3 goes to aged care and population health. Specifically, the share of funding for aged care rose from 11% to 13%, that's the green portion, between 2021 and 2024. And over the same period, the share for population health grew from 14% to 19%. And these shifts are largely driven by our national programs, Healthier SG and Age Well SG. And looking ahead, how would this chart go? I think almost certainly the share of spending on aged care will grow further because we need more nursing homes, senior care centers, rehab services, hospice care. As for population health, we do our best to maintain this share at around 19%. With total spending rising, maintaining the share alone requires a strong commitment to continue to invest in population health. Mr. Chairman, today my MOH colleagues and I will be speaking on further steps to transform healthcare and get ready for the future. SMS Co will speak about manpower. It is a key agenda, including how we will significantly shorten the time to train clinical psychologists. We are taking 7 to 8 years currently. We will reduce it to about 5 years. SMS Tan will speak about anchoring care in the community through technology. And you heard MOS Rohayu speaking about population health and preventive care, including what we are doing in the north, where prevalence of chronic diseases are higher. There was a question by Ms. Mariam Jafar. You missed that part of the speech. Yeah. I should emphasize, this is in case she asks many clarifications later. I should emphasize, preventive care and population health remain the overarching strategic thrust of what we are doing, anchored by Healthier SG and Age Well SG. I thank Ms. Mariam Jafar, Dr. Haresh, for speaking about this. This is at the core of healthcare transformation, and MOH agrees with many of the points you have raised. I will now speak about 3 new initiatives to support healthcare transformation. The first common topic, this whole COS and budget debate, AI once again. Ms. Mariam Jafar and Dr. Chu Pei-Ling spoke about how AI can strengthen healthcare delivery, and we agree. So when it comes to AI in healthcare, we are guided by 2 principles. Number 1, care should be AI enhanced, not AI decided. Clinicians remain in the loop, and healthcare remains a profoundly human endeavor. Number 2, we take a practical use case approach. AI should not be a hammer looking for a nail, a solution looking for a problem. We deploy AI where we know it will improve patient outcomes or the delivery of care, and it can do so cost effectively. And one such use case is in health screening. Around the world, many AI models have been trained to predict if a well person is likely to develop severe diseases in the near future. And if you use it appropriately and responsibly, such tools are very useful. It helps the clinicians intervene early. It can delay or even prevent the onset of serious diseases. MOH has developed such a model for our local context using anonymized patient data. With this model, by reviewing an individual's current health status, it can identify if he has a high risk defined by 75% or above, of developing chronic diseases such as diabetes or high cholesterol within the next 3 years. We chose diabetes and high cholesterol because they are the key drivers of strokes and heart attacks, which affect 60 Singaporeans every day. Every day, 60 Singaporeans either have a heart attack or stroke. Many of these cases can be prevented if early actions were taken, such as through lifestyle adjustments and medication. This AI risk assessment tool will be rolled out to doctors for all Healthier SG enrollees from early 2027. If the tool flags a patient as high risk, the doctors may recommend more significant lifestyle adjustments, and instead of 3 yearly checkups, maybe annual checkups. And these additional screenings will continue to be subsidized under Healthier SG. The second initiative, I think, is an exciting and significant one, and a breakthrough, which is to use genomics to strengthen preventive care. Dr. Hamid Razak asked about this. We are born with our genes. They shape our biological blueprint, and indeed, many diseases are linked to our genetic characteristics. But we need not be fatalistic about it. Genes are not our destiny. How we live, how we manage risk matters a lot. So we do not go fumbling through our genetic blueprint, hunting for blemishes and possible mutations that we know little about. It will create a lot of anxiety, and all of us will become a nation of hypochondriacs. So instead of shooting in the dark, we should focus on the parts of the blueprints that are illuminated by science. This means taking a disease-specific approach, identifying genetic characteristics that we know drive certain diseases, and for which we know there are established preventive interventions and treatment pathways. And this is what we did for FH, familial hypercholesterolemia. And we did that last year. And FH is a genetic condition that increases the risk of heart attacks, even amongst young people. The FH genetic testing program offers subsidized genetic testing for individuals with abnormally high cholesterol levels. And if they are tested positive, we will offer the same test to their immediate family members. This is what we call cascade testing. And by doing so, we try to identify as many individuals as we can in Singapore with the FH genetic mutation. And then we take steps to reduce their risk of future heart attacks and strokes. And we will now move on to our next genetic condition, which is HBOC, hereditary breast and ovarian cancer. In Singapore, it is estimated that 1 in 150 individuals carry a mutation in genes, such as the BRCA1 or BRCA2, that are associated with HBOC. Such a mutation substantially increases a woman's lifetime risk of developing breast and ovarian cancer. From December this year, we will offer subsidized genetic testing to at-risk individuals for HBOC, such as individuals with a family history of HBOC or breast and ovarian cancer. They will undergo genetic counseling before and after the test, and if they test positive, we will also offer the test to their immediate family members, cascade testing. We expect over 2,000 individuals to be eligible for the test annually. We will make the test affordable. In addition to subsidies, the cost of the test can also be offset using MediSave. For those found to have the mutation, they will be offered suitable preventive interventions. Typically, this means more frequent breast MRIs or mammograms or oral medication. Patients will ultimately decide, in consultation with their doctors, which intervention is appropriate. A minority may opt for surgical interventions, Members may recall celebrity actress Angelina Jolie. After she discovered she had the BRCA1 gene mutation, she underwent a double preventive mastectomy. I came across women in Singapore who chose to undergo preventive mastectomy to reduce their risk of breast cancer, such as Ms. Gwendolyn To. And these women have demonstrated great courage. Unfortunately, they lament that they cannot claim insurance for such surgeries because MediShield Life generally does not cover prevention. And it is designed to be so for a good reason. It is to keep coverage focused and premiums affordable. Then private insurance take dressing from MediShield Life. Dr. Hamid Razak and Ms. Sylvia Lim asked about this. In fact, Ms. Stephanie Teo, she's the founder of the non-profit organization She, SG Her Empowerment, has raised this issue with me several times. I share your concerns. With advances in medical science, the boundary between preventive and curative care is increasingly blurred. If a high-risk individual is unable to undergo preventive mastectomy, she has a high chance of eventually needing cancer treatments, including a curative mastectomy to remove cancerous cells in her breast or cancerous tissue in her breast. There is hence a case for MediShield Life to be judiciously extended to cover certain selected preventive surgeries. We are prepared to do so when there's a clear clinical need, minimal risk of abuse, the procedure is suitable for risk pooling through insurance, and it does not financially burden the MediShield Life scheme. Risk-reducing mastectomies for breast cancer prevention and the removal of both fallopian tubes and ovaries for ovarian cancer prevention fall within these criteria. We will therefore extend MediShield Life and MediSave to cover preventive surgeries for HBOC later this year. I should add that breast reconstruction is also covered, no different from today. And this will better support women to harness genomics to better take care of their health. I think this is a meaningful policy change ahead of International Women's Day on the 8th of March. The third initiative is to inject more flexibility in the use of MediSave to encourage early intervention and reduce downstream complications. Associate Professor James Lim was right to describe medical expenses as lumpy. Indeed, it is very well documented that hospital expenses escalate almost like a vertical wall towards the end of life. And so even after accounting for inflation, the average Singaporean living up to their mid-80s spends almost 4 times as much on hospital expenses in the last 10 years of their life compared to the previous 10 years. But that explains the existing design of the MediSave withdrawal system and why the system is designed like that, why the scheme is designed like that. It has higher limits for more complex treatments and longer hospital stays, and you can draw on it as and when you need it. This meets the original objective of MediSave, which is to co-pay for major inpatient episodes, whether they happen unexpectedly or in old age. With this design, after subsidies, MediShield Life and MediSave, 9 in 10 Singaporeans pay less than $500 out of pocket for their subsidized inpatient bills. However, it is human nature to worry about present medical expenses rather than lumpy potential unexpected or future hospital bills. Hence, as a relief valve, we have schemes like Flexi MediSave and MediSave 500-700 to provide flexibility for chronic disease management, for scans, for dentist visits, etc., without overly diluting MediSave's original objective of catering for these big, lumpy hospital bills in old age or during emergencies. But the situation has changed since MediSave was implemented in 1984. At that time, people in Singapore lived to about 73 on average. Today, we live to 85 and beyond. On one hand, it continues to be important to preserve MediSave for big hospital bills. On the other hand, as people live longer, the need to spend on preventive care and chronic disease management also go up. Hence, I can appreciate the repeated and various calls by members to allow MediSave to be used more flexibly to cover more chronic diseases, or as Mr. Pritam Singh suggested, to pay for higher private insurance premiums. But I also hold the realistic view that no matter how frequently MOH reviews the MediSave scheme, how much we liberalize and expand its usage, the public and members of this House will continue to press me and MOH to liberalize the scheme every year during the COS and probably outside of the COS. It is the karma of this scheme, because it is designed to be the linchpin of the healthcare financing system. It must always navigate between present and future healthcare needs, between recurring disease management and the major hospitalization episodes. Trade-offs are inherent in the MediSave scheme. It is zero-sum. Using more balances for recurrent medical expenses means having less in the future when we are hospitalized, and vice versa. And when the tension becomes too severe, we will have to consider raising contribution rates so that you have a bigger pot to spend. The tension is therefore deliberate and a design feature. It is a balance we must constantly and carefully manage to ensure the system of co-payment is held together while ensuring affordability and keeping CPF contribution rates reasonable for everybody. Hence, we continue to have ongoing regular reviews to study where we can expand the use of MediSave and provide more flexible withdrawals. For example, we recently increased the Flexi MediSave limit for seniors, and we doubled the annual limit for diagnostic scans. This time, we will make further changes to the MediSave 500-700 scheme. This scheme helps patients pay for the recurring costs of managing conditions on the Chronic Disease Management Program, or CDMP. Mr. Chai Ying-zhou, Mr. Jaragiam asked about this. So today, individuals with a simple chronic condition can use up to $500 a year, while those with complex chronic conditions can withdraw up to $700 per year. To provide more support for preventive and chronic care in the community, we will raise MediSave limits from $500, $700 to $700, $1,000. This will benefit over 910,000 patients who currently tap on the scheme, roughly 20% of whom have annual bills exceeding the withdrawal limit. We will also expand the list of conditions covered under the CDMP to include hyperthyroidism and hypothyroidism. In addition, we are studying whether we can include other chronic conditions such as eczema in the CDMP. With the above enhancements, we will rename MediSave 500-700. It's actually a cumbersome name. Every time you change the limit, you change the name. We will rename it to MediSave Chronic and Preventive Care Scheme to reflect the scope of coverage. The changes will be effective January 2027. Before I end this section, let me address the question posed by Ms. Sylvia Lim. Ms. Lim, I thank her for watching my TikTok videos. She mentioned the role of riders in providing additional coverage for cancer patients not on the cancer drug list. The objective of the recent changes to the IP riders is to prevent the over-erosion of co-payment, because that sets off a buffet syndrome, and then that leads to rapid escalation of private hospital bills. IP riders covering non-CDL drugs for outpatient treatment do not contribute to this erosion, and therefore this feature will not be affected by the changes. I should also point out that the changes to IP riders affect only new policyholders, but not existing policyholders. We will always watch out for the cancer patient when we make changes to IP riders. Mr. Chairman, in Mandarin, please.
This year is 2026, and it marks the year where Singapore society has entered the super-aged phase. We should view this with a level-headedness and a calm mind, just like celebrating a birthday. Although we are all a year older, life goes on as usual, and there are no sudden changes. Singapore has always been preparing for rainy days, and we have long been prepared for an aging society. Over the past 10 years, the government has progressively adjusted policies across various domains to ensure that every Singaporean can have a support in old age, medical care when ill, and a home to live in. The most important point is to ensure that our people continue to maintain the mindset of young at heart despite growing old physically. Therefore, preventive healthcare has become MOH's core policy. So speaking of the Ministry of Health, or 卫生部 in Chinese name, I do have some thoughts on the Chinese name of this 卫生部. Strictly speaking, 卫生 is more associated with hygiene. So strictly speaking, Ministry of Health does not manage hygiene. Hygiene is managed by the MSE, or the Ministry of Sustainability and Environment, which is helmed by Minister Grace Fu, but she's not here. But from a medical perspective, everybody understands that the so-called hygiene is about preventing, fighting, and treating various infectious diseases. This remains our important mission. However, the medical challenges of modern society are different from the past. Non-communicable diseases such as cancer and heart disease and diabetes will cause far more harm than infectious diseases. In order to better reflect the core policies of the Ministry of Health, we will change the Chinese name of the ministry into 保健卫生部, which is to add a healthcare into the name. So when the name is correct, the words and actions of the ministry will naturally follow suit. Some may ask whether changing the Chinese name of the Ministry of Health will it cost a lot of money? Please rest assured. Almost all of our logos, legislation, documents, websites, etc. are using our English name, which is the Ministry of Health. This is another problem. So the name change is mainly affecting future media reports. So the expenditure will be minimal or virtually none, but the meaning that it conveys is very important. I've also just announced several new policies. First, to make medical expenses for chronic diseases more affordable, we will raise the annual limit for Medisave withdrawal from $500 to $700 starting next year, while annual limit for chronic disease patients with more complex conditions will be able to, the withdrawal limit will be raised from $700 to $1,000. Second, we will begin providing subsidized genetic testing for hereditary breast and ovarian cancer for higher risk women from the end of this year. Third, we will use AI to assist doctors in predicting the risk of Singaporeans in developing chronic diseases such as high cholesterol and diabetes. For high-risk Singaporeans, we will encourage them to take preventive measures through Healthier SG. Speaking of AI, over the past year, I have visited the United States and China with the MOH team to study their experiences and practices in the application of technology. In the United States, we have visited several very good hospitals, very famous hospitals. When I asked them, among all the application scenarios for AI, which one is the most effective, they unanimously said that using AI to record patients' medical histories saves both time and effort. It is the best application scenario. I agree with this approach very much. Although the use case seems very simple, but it allows everyone to benefit from it. It encourages everyone to accept new technology and understand that the new technology can help us, but not necessarily threaten us. In public hospitals in Singapore, we have already started using AI to document medical history. Our AI understands English, Mandarin, Malay, Tamil, and Cantonese. But I don't know why it only understands Cantonese. Our AI is currently working hard to learn other dialects. Someone once joked with me, the most experienced doctors will look at the person or the patient. Experienced doctors will look at the illness. Less experienced doctors will look at the computers. I believe in the near future, most doctors will, with the help of AI, will be able to look at the person and not only look at the computers. This year, I also visited China and toured some hospitals and technology companies. I found that Chinese hospitals are also boldly trying out new technologies. The spirit of daring to try is worth something that is worth learning from. However, we must also recognize that there are differences between China and Singapore. For example, in the Chinese hospitals I visited, some traditional surgeries have already been replaced by robotic surgery. However, robotic surgery is very costly, and these expenses are often borne by the patients themselves, or maybe have medical insurance. The medical insurance premium will increase. Therefore, in Singapore, we are very cautious when promoting robotic surgery or any other technology. We will consider the cost effectiveness and also affordability of the patients. From Hippocrates to Hua Tuo, a Chinese physician, to AI and to robotic surgery, the medical field has been advancing rapidly. We will take a multi-pronged approach to adopt the long-term policies and make use of high-quality medical teams and cost-effective technology to bring better medical services to our people.
Mr. Chairman, when I informed the House 3 years ago that we'll be a super-aged society this year, it was not to instill fear, but to prepare ourselves. Our transition to a super-aged society has been steady rather than dramatic. It reflects deliberate, long-term planning, including transforming the healthcare system. Indeed, healthcare transformation is fundamentally a long-term endeavor, not one sweeping reform. It is the accumulation of numerous small steps, each taken with judgment and purpose, each carefully planned and executed, and today we announced further deliberate steps. Mr. Chairman, it is my hope that this House continues to support our approach of long-term planning, long-term governance, to anticipate future challenges early and act before they overwhelm us. If we do so, we need not fear being a super-aged society. We can embrace it and we can make the best of it. Ultimately, it is not the percentage of Singaporeans above 65 that defines us. We can exercise our wiser minds to mourn less for what age takes away from us than what it leaves behind. What matters is that Singaporeans are not just living for longer. We are living healthier for longer. We are not just a super-aged society, but we are striving to be a super healthy one as well. Thank you, Mr. Chairman.
SMS Co. Bokun.
Mr. Chairman, when Minister spoke about our journey towards becoming a super-aged nation, he highlighted something fundamental, that our people are at the heart of healthcare transformation. I will speak on our approach to workforce and care transformation in healthcare, which is carried out via 3 pillars. First, we will redesign roles and right-side care. Second, we build pipelines to ensure manpower sustainability. And third, we are adopting a flexible and agile healthcare system. Now picture this, a patient with diabetes, heart conditions, and mobility challenges, juggling multiple appointments across different clinics, each visit requiring time off work, not just for the patient, but for the caregivers sometimes, special transport arrangements, and often a caregiver support to accompany them for these visits. This fragmented exercise and experience isn't just inconvenient, it is unsustainable as our population ages and our healthcare needs become more complex. How can we meet the rising healthcare needs of an aging population, improve the care experience while maintaining the quality and standards of care? First, we redesign roles and right-side care. Today in a hospital ward, a patient receives coordinated care through a team led by a principal doctor, or PD, who is accountable for the patient's overall care plan. Under the new team care model, a PD need not be a specialist. Once they are trained and assessed to be competent, a hospital clinician may take on the role of a PD to supervise, oversee, and coordinate care, incorporating the inputs of various healthcare professionals. Patients need not be seen by different doctors for each condition, thus reducing the number of referrals to other specialists during their stay. And upon discharge, the care of such a patient could then be handed over to their family physician, some of whom are now trained as family medicine specialists to manage patients with more complex medical conditions. Likewise, team-based care has been introduced in the polyclinics and primary care networks, or PCNs, since 2015 and 2018, respectively. Under such a model, patients with chronic diseases are managed by multidisciplinary care teams, comprising doctors, nurses, and care coordinators. This ensures care continuity and builds the trust between patients and their care teams. In response to Mr. Chai Ing-chou's query on the provision of specialist dental, audiology, and podiatry services in the heartlands, we recently enhanced CHAR subsidies for dental care and are expanding dental services at polyclinics and strengthening partnerships with community dental providers, moves that will bring affordable dental care closer to where our seniors live. Most geriatric dental needs can be managed by polyclinics and CHAR's dental clinics. Specialist care is available for more complex conditions at our hospital dental clinics, as well as 2 national specialty dental centers, the National Dental Centre Singapore and the National University Centre for Oral Health. Additionally, while podiatry services are available at selected polyclinics, food screening services for patients with diabetes are available at all polyclinics, as well as Healthier SG general practitioners through their respective PCNs. Besides transforming our care team in the hospitals and right-siting care in the community, we also want to empower our people to take ownership of their health. We agree with the vision shared by Dr. Harish Singaraju on how social prescription is integral to preventive care and Healthier SG. That is why the health plan in Healthier SG includes encouraging patients to adopt lifestyle changes, more exercise, and less unhealthy food. However, we acknowledge that social prescription is still not commonly adopted, and there are more that we can do together to encourage that. We will work with community partners to make these interventions available to residents. In particular for seniors, the network of AACs, Active Aging Centers, will support them in this. Mos Rahayu has elaborated this earlier in her speech. In addition, the hospitals also have their respective initiatives in social prescriptions. I also want to assure Mr. Pritam Singh that our public hospitals have in place protocols to expedite urgent cases in the emergency departments and urgent referrals from primary care to specialist outpatient clinics. Waiting time alone is not indicative of the quality of medical services. Patients present with varying degrees of severity. And in all the top hospitals of the world, patients with more urgent and severe conditions are up-triaged and seen earlier and given necessary resuscitation. That is how healthcare systems function. Based on several sources, which the members can also Google, Singapore's healthcare system is consistently ranked within the top 20. In 2000, the World Health Organization ranked Singapore 6th best in the world. Our public health institutions have also consistently been recognized as being one of the best in the world. In 2026, Newsweek and Statista, a global data platform, ranked SGH 10th, while NUH and TTSH are also in the top 100. Singapore's healthcare system has delivered good health outcomes at an affordable level. Our life expectancy is at about 86 years, as reported by the Institute for Metrics and Evaluation, ahead of many other countries, such as Japan, Switzerland, Australia, South Korea, UK, and USA. On the other hand, our national healthcare expenditure is at 4.4% of our GDP, which is less than half of what other countries spent. This was reported by the World Bank data in 2019, and you saw earlier from the charts that Minister has shown that indeed we're able to achieve good health outcomes at a fraction of the cost that other countries have plowed in. Now, in addition, our hospitals have contingency measures to respond to surge in bed demand. These include adding beds, expediting clinically appropriate discharges, and deferring non-urgent electives to free up acute capacity for incoming patients. If required, hospitals can also tap on facilities like the transitional care facilities and the mobile inpatient care at home to augment overall capacity. Even as we augment capacity, our people are at the heart of the healthcare system. Public healthcare institutions roster staff to ensure adequate rest in between shifts and also monitor the well-being of our staff as they care for our people. These are experiences we learned also from the recent COVID-19 pandemic. With the increased demand in mental health services, the Institute of Mental Health, IMH, will continue to serve as National Center for Psychiatric Services and focus on providing quaternary care to patients with more complex mental health needs. Mr. Patrick Tay will be pleased to know that MOH has been giving IMH additional funding to enhance its psychiatric services and upgrade its infrastructure for better patient care, to be a leading hub for mental health training and education, and establish its position in tertiary and quaternary mental health research. There are also ongoing efforts to enhance psychiatric inpatient, outpatient, and crisis care capabilities across our public healthcare institutions to support individuals with both physical and mental health services in the same hospital. Now, in each of these, care team transformation provides integrated care for patients, promoting team-based care, right-siting of care to the community so that it is more accessible and affordable for our people, and redesigning roles so that professionals are allowed to advance and perform at the apex roles in a safe manner. The second pillar is to build a sustainable manpower pipeline. Our current healthcare workforce is broadly adequate for the population's healthcare demand. We will need to grow our healthcare workforce by 20% by 2030 to meet the projected manpower demand. We are working closely with institutes of higher learning to introduce more training pathways to build up a strong local pipeline through pre-employment training. Mr. Chai Ying-zhou will be pleased to know that the graduate entry Master of Science Audiology program at NUS runs biannually and has an average of 13 graduates per cohort. For podiatrists, demand is being met through scholarships for local talents to pursue podiatry studies overseas and recruitment of overseas trained podiatrists. To Dr. Wan Rizal's query on strengthening the local pipeline of clinical psychologists while maintaining professional standards, we have worked with the Ministry of Education and the National University of Singapore to offer eligible undergraduate students an accelerated pathway to specialize in clinical psychology at master's level with the first intake in 2026. Unlike the current training model, where an undergraduate needs at least 7 years to be qualified as a clinical psychologist, this includes 4 years for their bachelor's degree in psychology, followed by 1 or 2 years of work experience before enrolling in the 2 years Master of Psychology clinical program. This new accelerated pathway for undergraduate to master's pathway can be completed in 5 years. It would enable aspiring undergraduates who set their minds fairly early to train as clinical psychologists, to be trained as clinical psychologists through a carefully curated curriculum. This curriculum comprises didactic learning and clinical training during undergraduate years, developing practitioners with knowledge and skills to care for their patients. Graduates of this 5-year program will receive both a bachelor's degree with honors and a master's degree. NUS's new accelerated undergraduate to master's pathway will complement existing postgraduate training pipelines, including its existing standalone 2-year Master of Psychology clinical program for those relevant clinical work experience. Together, these programs expand our clinical psychologist manpower pipeline to meet increasing mental health needs. Healthcare workers remain the bedrock of our healthcare system. Even as we create new training pathways, we have also implemented strategies to improve retention of our healthcare workers. We have spoken in this House before about the challenges in attracting and recruiting nurses, especially during the COVID-19 pandemic. While the attrition of our nurses has since fallen back to pre-COVID levels of around 7%, we will continue our efforts to encourage more nurses to stay and contribute to the public healthcare system, as well as attract aspiring individuals to build a career in this sector. In 2024, we rolled out the Award for Nurses, Grace, Excellence and Loyalty, or the ANGEL scheme, and reviewed and adjusted nursing salaries in 2025. In 2025, we have also increased salaries of allied health professionals, the AHPs, pharmacists, and administrative, ancillary, and support staff in public healthcare institutions by up to 7%. But retention of healthcare workers is not enough to build a robust healthcare system. We need to continuously upskill our healthcare workforce to take on new and expanded roles. Healthcare today does not fit neatly into traditional silos. A patient with multiple conditions needs professionals who can work seamlessly together. That is why we are moving from rigid specialty-focused training to flexible, competency-based learning delivered via stackable modules in a work-study format where possible. This reduces time away from work and the impact on patient care. For our allied health professionals, we are working with our institutes of higher learning to build up shared competencies across relevant allied health training programs to better support a team-based shared care model. These will be rolled out progressively, starting with students who begin their studies from academic year 2027 onwards. Separately, for mental health, the shared competencies are outlined under the National Mental Health Competency Training Framework based on patients to create a common language among our allied health professionals. With this, our allied health professionals will be more versatile and able to work more collaboratively to deliver care holistically. For nursing, we are working with the polytechnics to redesign existing nursing post-diploma specialty programs into a work-study format. This allows nurses to learn and practice in real-world settings as training is based directly on job activities, enabling our nurses to become competent and productive more quickly. 2 advanced diploma in nursing programs, palliative care and community health, will be prioritized for initial launch in a work-study format. With enhanced capabilities, our healthcare workforce is better positioned to deliver comprehensive care. Ms. He Ting Ru asked for an update on the regulation of mental health professionals. We will be registering 5 higher risks sub-disciplines of psychologists to ensure high standards of practice, ethics, and professional conduct so that our people receive safer and higher quality psychological services. These are clinical neuropsychology, counseling, educational, and forensic psychologists. MOH and partner ministries will work with Singapore Psychological Society, SPS, to raise public awareness of the psychologist professions and support our professionals and stakeholders in navigating the registration process. The detailed registration schedule, requirements, and roadmaps will be announced by early 2027. The third and last pillar is to develop a flexible and agile healthcare system that can respond to fast-evolving healthcare needs. One example is in mental health. Mental health concerns came to the fore during the COVID-19 pandemic and remains one of our key national agendas in the Ministry of Health. Ms. He Ting Ru and Mr. Alex Yeo asked about this. Since the launch of the National Mental Health and Wellbeing Strategy in 2023, we have established the National Mental Health Office in 2024 to coordinate and oversee multi-agency mental health initiatives. First, we have guided mental health service providers to adopt the tiered care model and improve care coordination across different providers, enabling clients to receive seamless care at the most appropriate care setting. Second, we have expanded the capacity of mental health services across the primary, community, acute, and long-term care sectors. Polyclinics and GPs are equipped to provide care to individuals with mild to moderate mental health conditions such as anxiety and depression. Community mental health teams provide a range of mental health support to individuals with mental health needs. Today, we have 71 community outreach teams, or CRES, and 26 community intervention teams, COMIT, to conduct outreach, screening and assessment, psychological intervention, and service linkages for seniors with mental health needs or dementia and their caregivers. By 2030, we will expand the number of CRES and COMIT to 75 and 35 respectively. We have also established the first stop for mental health services to facilitate easy access and navigation of mental health services. Third, we expanded support in encouraging help seeking amongst youths. Youths can access CRES Youth and Chat, which are sited in the community. Those who need psychosocial interventions may then be referred to the youth integrated teams. The recently launched Groove, spelled G-R-O-V-V-E, at Scape also provides mental health services to youths where they gather to improve access and reduce barriers and stigma. Youth-oriented self-help services such as Let's Talk and Ask a Therapist can also be accessed on myline.sg. In addition to these services, an ecosystem of support is available within the education system. Educators and staff are trained to look out for signs of distress in students and refer those who require further support to counselors in schools, or IHLs, as well as community mental health professionals. Peer support structures are in place for students to look out for one another and encourage distressed peers to seek help from trusted adults. Youths are also taught ways to build mental wellness and resilience through the character and citizenship education curriculum in schools and mental well-being programs in the IHLs. Fourth, we are enhancing capabilities of community service providers through the National Mental Health Competency Training Framework and have trained over 160,000 frontline personnel and volunteers to identify and guide individuals in mental distress to support avenues. Fifth, we have promoted mental health and well-being through educational efforts for the general public, parents, and youths through campaigns such as Beyond the Label and resources like Parenting for Wellness and the Positive Use Guide. Lastly, we have strengthened workplace mental health support in collaboration with the Ministry of Manpower and Workplace Safety and Health Council. The Wellbeing Champions Network has grown from 54 founding member organizations to 800 over the last 2 years. Now, as mental health is a complex and multifaceted issue, we continue to work with various agencies to track and monitor medium to long-term trends, including overall state of mental health and well-being of our population, for evidence of improvements from the baseline. Adopting a no-wrong-door approach to facilitate access to services and right-siting care in the primary and community settings, encourage individuals to seek help early in non-stigmatizing environments while avoiding over-medicalizing mental health needs. We also hear Mr. Eric Chua's concerns about our people paying for the silent addiction to explicit materials. On this, we recognize that addiction extends beyond individual health to affect families and the broader society. Individuals may also face underlying difficulties such as financial hardship and lack of social support. The National Addiction Management Service, NAMS, situated within IMH, was established to provide treatment and assistance for individuals seeking help for addictions. NAMS specializes in addiction medicine research, which includes intoxicating substance use and emerging areas of concern, such as internet and gaming. MOH, together with MSF and NCCS and other stakeholders across sectors, will continue to develop and enhance access to addictions services in the community. So healthcare is highly dynamic and fluid, compounded by shifting patient demographics and needs. As we navigate the road ahead and future challenges together, these three pillars will work in tandem to strengthen the core foundation of our healthcare system. We're not just filling positions. We're building a sustainable workforce and system that can adapt, collaborate, and deliver good quality care to all Singaporeans. Thank you, sir.
SMS Tan Kiat Hao.
Sir, as shared by Minister Ong with this House earlier, welcome to Super Aged Singapore. This trend will accelerate. By 2030, 1 in 4 Singaporeans will be 65 years and older, and 1 in 4 of them will be aged 80 and above. Within the next decade, by 2040, 1 in 3 seniors will be aged 80 and above. Seniors will likely need more support. For example, seniors use 8 times the amount of hospital care than those who are younger. So I agree with many members who spoke on the implications. First, to caregivers. Today it's not uncommon to see a working adult supporting elderly parents in their late 60s who are in turn taking care of the parents in their late 80s. I certainly see many of such families in my constituency. With family size continuing to shrink, the burden on caregivers will only get heavier. Secondly, there will be increasing pressure on the healthcare system. If half of our seniors have at least one chronic disease, we will have to care for close to 500,000 of them in 2030, up from about 400,000 of them last year. That is why we want our seniors to remain healthy for as long as possible. As Minister said, it's not just about living longer, but also living healthier for longer. Today, I will outline how we are doing so with technology as an enabler. First, getting seniors to age well in the community. Second, wrapping care around them. Third, supporting healthcare providers to deliver better outcomes. As pointed out by a number of members, many seniors face social isolation. A study has estimated that this risk is equivalent to smoking 15 cigarettes a day. Members will be familiar with the Silver Generation Office, or SGO. Since 2022, SGO has started preventive health visits, engaged more than 600,000 seniors, and connected those with needs to services like active aging centers, or AACs, senior care centers, or SCCs, and community mental health services. Recognizing that younger seniors are more digitally savvy, SGO is reaching out to this group through a live SG app. And since December last year, over 3,000 seniors have received personalized recommendations on services useful to them. So for seniors who have not yet availed themselves to this application, this service, please check out the live SG app. We have also grown the AAC network from 154 centers to over 230 over the last 2 years, now serving around 100,000 seniors. More than 150 SCCs provide daycare services, including for those with dementia and respite care. And over 90 community outreach and intervention teams offer psychosocial support. We will continue to expand these services. Mr. Ng Chee Meng, Mr. Yip Hong Wing, and Mr. Fadli Fauzi spoke up for caregivers and referenced what other countries are doing to recognize and support caregivers. Like members, we believe that caregivers play a vital role, and we are doing more to support them. We are enhancing long-term care subsidies and grants, and this year, we will raise the per capita household income, or PCHI, threshold from $3,600 to $4,800. This will cover about 7 in 10 households. I'd like to assure Mr. Ng Chee Meng and Ms. Mariam Jaafar that these subsidies are not dependent on the number of activities of daily living needs, or ADLs. Last year, caregivers of over 14,000 seniors benefited from subsidized home and center-based respite services. We will do more. From 1st April, more than 5,600 eligible seniors and their caregivers can benefit from the Enhanced Home Personal Care, or HPC Plus service, featuring home-based respite care, medication reminders, and 24/7 technology-enabled monitoring for fall detection and incident reporting. Members also spoke about caregivers who are juggling work and care. We empathize with their challenges. Support is available through various ministries' effort. For example, flexible work arrangements and a caregivers training grant, which helps to offset costs for training family caregivers and migrant domestic workers. Eligible caregivers can also tap on enhanced parental leave provisions, such as a new shared parental leave and unpaid infant leave, care leave. We will continue to study member suggestions as we explore ways to better support our caregivers.
Mr. Victor Lai spoke about the unintended consequences of relying on PCHI to assess the caregiving circumstances of families. I appreciate his concerns. The PCHI means testing approach was discussed at the budget debate last week. MOH takes stressing from this framework. However, individuals in difficult circumstances who require additional support can approach our medical social workers. Mr. Lai gave a few suggestions on how we can improve the current framework. MOH will study his suggestions with the Ministry of Finance. Mr. Terence Ho and Mr. Eric Chua advocated for seniors to contribute to the community, including helping fellow seniors. I agree. Such involvement gives our seniors a sense of purpose. Seniors can tap on volunteering opportunities, with some organizations providing training and allowances. For example, as Silver Generation ambassadors, they help conduct outreach to other seniors. Seniors can also join the SG Healthcare Corps to assist with basic patient care. Those aged 50 and above comprise 20 to 40% of volunteers across these programs, and we welcome more partners to join this effort. Let me turn to the topic of end of life. I agree with Mr. Yip Hong Wing's point that we want our seniors to live well, or as the Chinese say, 安然离去. Since 2023, we have significantly expanded community palliative care services, enhanced subsidies, and facilitated hospital discharges at the end of life. We want more Singaporeans to spend their final days at home in an environment where they feel comfortable, surrounded by loved ones. The response has been positive. As of June 2025, the utilization rate for home palliative care was around 90%. We will expand capacity as demand grows. We want to continue supporting families who wish to be with their loved ones at home during their final journey. Next, I assure Mr. Chai Ying-jo and Mr. Yip Hong Wing that we do track outcomes of our programs, such as frailty prevalence, social participation, and caregiver well-being. We do so with different parties, including research institutions. Let me now turn to care delivery transformation. By 2030, around 100,000 seniors will need help with at least one daily activity like eating or showering. They will likely need services from different service providers. We want their experience to be as seamless as possible and not have to run from pillar to post to receive these services. Technology will be a key enabler for tighter care coordination. So I agree with Mr. Chai's point that we want to make it easier for seniors to access social and health services. First, we have introduced integrated community care providers, or ICCPs, in 84 sub-regions around Singapore. This means a single party to coordinate care for seniors within each area. Currently, seniors undergo multiple care assessments done by different service providers they go to. Not only this duplicate effort for providers and create greater inconvenience for our seniors may also end up with uncoordinated care due to different care plans. We will streamline this entire process. From next month, seniors requiring multiple long-term care services will need only one comprehensive assessment done by the ICCP using a standardized, internationally recognized tool. Each senior will have a single community care plan developed based on this assessment. Every provider that a senior goes to will take reference from this care plan. Such an approach will ensure seniors benefit from a seamless experience and better coordinated care. We will progressively roll this out from October this year. And we are enabling this new way of coordinating and delivering services through a common IT platform for community care providers. Mr. Azhar Othman asked about teleconsultation. I refer the member to SMS Kopukun's recent response to a parliamentary question on this matter. But fundamentally, MOH agrees with the member to make good use of technology to improve the healthcare experiences for our patients. For example, the Productivity and Digitalization Grant, launched in 2022, has supported more than 240 projects, such as systems to automate showering and vital signs monitoring. We intend to enhance the grant to make better use of technology solutions in the healthcare sector, including harnessing robotics and artificial intelligence. So when I brought this House through the Health Information Bill in January, I said that MOH will help healthcare providers meet the provisions. I'm pleased to provide an update. First, we are working with the vendors for health information management systems used by healthcare providers to comply with the necessary requirements. Second, we will provide resource guides and training to help healthcare providers and their staff understand and implement these requirements. Third, we will launch the National Electronic Health Record Connect Grant, or NEHR Connect Grant, and open it for application in July this year. The grant will offset the cost for providers to onboard the NEHR. For typical healthcare providers, this grant will cover up to 2 years of subscription costs for the health information management systems. For providers with in-house systems, the funding support covers up to 40% of enhancement costs. MOH will set aside up to $45 million for this. Let me illustrate how this works for a typical clinic with 5 staff. Most of them already subscribe to a health information management system. They can apply and benefit from the NEHR Connect Grant. On top of the NEHR Connect Grant, the clinic can receive up to 70% co-funding support from the Cyber Security Agency of Singapore to engage cybersecurity consultants. They also benefit from up to 50% funding support from Enterprise SG to adopt cybersecurity solutions such as those for anti-malware. In total, the clinic can receive about $20,000 in grants. Sir, in Mandarin, please.
During the New Year period, when exchanging greetings, I noticed that seniors would say 恭喜发财 less now. Instead, they say good health more frequently. They understand the importance of maintaining good health, especially after the pandemic. To encourage seniors to maintain their physical and mental health, we have established over 230 active aging centers. This year, we will also designate integrated community care service providers. Allow me to repeat myself again. This year, we will also designate integrated community care service providers. Care teams will coordinate and plan more comprehensive health care according to seniors' needs. For example, if seniors need home personal care services and as well as visiting senior care centers, they only need to contact one care team, reducing the hassle of liaising with different community care providers. We are also actively using technology to provide more precise and convenient care experiences for our people. For instance, seniors at risk of falling can enjoy 24-hour smart monitoring under enhanced home personal care services. If an accident unfortunately occurs, the system can promptly notify relevant personnel to help. This way, family members can have peace of mind. Nowadays, more seniors are becoming tech-savvy. Therefore, we launched
the LiveSG application. Through LiveSG, the Agency for Integrated Care can interact with seniors and set personalized health plans for them. Since December last year, over 3,000 seniors have benefited. From July this year, GPs can view health records previously documented by specialists, hospitals, and other medical institutions for patients in their computer systems. This way, doctors can have a more comprehensive understanding of patients' conditions, formulate the most suitable personalized health plans for them, and eliminate the need to repeat personal medical histories. And our grandma and grandpa do not need to worry about the diagnosis or medications that have prescribed by the doctors. As the saying goes, having a senior at home is like having a treasure. We use technology to enhance care quality and ensure that seniors receive treatment in familiar environments. We would also continue to expand these services so that every senior can receive the care and support they need to enjoy their golden years. We want our treasures, our seniors at home, to live happily and to age well at home.
Through the Health Information Act and other digital health priorities, we are building a more connected, responsive, and secure health system. This is in support of our broader healthcare transformation to anchor care in the community with more coordinated services that wrap around our seniors. Importantly, a healthcare system that puts people first. Thank you.
We have some time for clarifications. Ms. Mariam Jaffa.
Thank you, sir. Well, the Minister didn't actually address many of the direct questions I had in my speeches, but he did acknowledge that there were many good ideas. So I look forward to seeing some of those perhaps come in future. But I wanted to focus on three clarifications today. One is to Rahayu on the Woodlands pilot. Thank you for your sharing. I think my clarification is, how is MOH also working with other agencies to get the most out of this pilot? It's one thing to have HPBs give you, digital wayfinding to find healthy food options. There's another actually to increase the number of healthy food options, especially halal food options, and that would require working with, say, MND, right? Because I think, when you have a coffee shop where there's only one halal store and it serves roti prata and mee goreng, I think and you depend on those, it's kind of hard to maintain a healthy lifestyle. And I think my second clarification is for the Minister. On the AI topic, as the consultant in me says, absolutely, yes, fully support the practical use case approach. The important thing is that these use cases must scale, and I think some of the things you outlined does that. But scaling also requires a lot of work on infrastructure governance and talent that I brought up in my cut speech, so I wonder if you can say something about that. My third clarification is also for the Minister. And happy to hear about the changes to 500, 700, or now you call it MediSafe Chronic and MediSafe Preventive Care. It was actually entirely the crux of my suggestion on MediSafe Flex for that purpose. And I wonder if the Minister can share, he shared data on the healthcare expenditure on preventive care, for example, but how much of MediSafe actually is used today for chronic and preventive care? And has the Ministry actually done any modeling on, if we made, MediSafe, chronic MediSafe preventive care actually based on balances, how would that actually impact the sustainability? Thank you.
Minister.
I'll start with the second question. AI scaling, the points you made, we agree. So I don't have much to add, but I think Ms. Mariam Jaffa is also aware of all the steps you have taken, and you mentioned that in your cut in terms of IT infrastructure, NEHR, NGEMR, Helix, AIM-SG. We set up all this quietly in the background, and then at the same time strengthen cybersecurity. So a lot of background work has been done. We are now, therefore, in a position where we are ready to say if a use case proved to be useful in a hospital, in a particular sandbox, we can scale it up. That took many years of preparation, and I think we are ready to do that now in a very proactive way. As for MediSave, it's difficult to do modeling. We can, but the fact is the needs across the population is so different. Some time back, we gave an answer in Parliament how much MediSave is left at the point of demise for someone aged 85 and above when they die. And so we collated the data from 2017 to 2021. 2 in 10 have less than $1,000. 5 in 10 has $1,000 to $10,000. 3 in 10 has more than $10,000. So is it excessive? It depends on who you are talking about. Those with $10,000, $30,000, I think that's a lot. Those with less than $1,000, I think is barely enough. We really need to save their MediSave towards their old age. So I think some members have raised this suggestion that can we have a bit more flexibility based on balances? Can we free up the rules a bit? It is conceptually correct, but it's not so easy. It's not a matter of modeling, but able to cater to individual circumstances. But for a scheme that applies to the whole population, it's never easy to do precise policy. But we will have a go. We'll try. We'll take in the suggestion. We'll try our best. Since I'm standing here, I'll answer on behalf of MOS Rahayu. Working with other agencies in the community for the North, we might be thinking of different things. On more halal food choices, healthy choices, let's sit together and see whether we can work together with other agencies, including NEA. But what we are thinking about is actually a care model, not so much just food. We will look into that. Exercise, we will look into that. But a care model where you don't need to, where you encourage residents to do early checkups, enroll for Healthier SG with the support of a CHP, of a community health coach that make things very easy, a very convenient touch point that together with local MPs and advisors, we can make sure that more people respond to our preventive care push.
Dr. Harish Singaraju.
Chair, I've got 2 questions. This surrounds clinical capacity. One is on team-based care. As SMS has mentioned, that has been around since 2015. And that's something which the clusters have done great works and set up frameworks for. And yet, many of the services, nurse-led, pharmacist-led, allied health services are underutilized. How exactly will the ministry help in terms of the national effort to get patients and citizens to understand and trust the care that these providers provide? And second is on the aspect of Healthier SG enrollment, where we've had residents who have enrolled across public and private. Have we studied the factors to strengthen that relationship such that patients do not drift across? Thank you.
SMS Ko.
So I thank the member for his 2 questions. On the first question of team-based care and whether certain AHP-led services are underutilized, we acknowledge that this is one of the challenges we have to continue to deal with because patients do have autonomy on who they eventually want the care to be given. So it's not something that we can force a person to see a particular professional, right? And that is why building rapport is important. At the same time, we are also, through our signaling, that these are professionals that have been trained, given accredited certification to perform at a higher level. And over time, we hope that the lived experience of patients who have seen these professionals will validate some of the kind of outcomes that patients are looking for. So that over time, you build confidence, build rapport in the community, and patients will gradually accept the kind of referral pathways that we are channeling to. One of the things that we're doing in the community health post, to have more nurses actually now fronting many of the conversations with our seniors, is a good way to actually socialize to our seniors and our patients that actually the nurse can deliver many of the care that they already need. So I think it will take a multiple approach to do this, and it will take some time as well. But I think increasingly we are also seeing that this capacity will be better utilized by the population. The second question on enrollment across the different providers, especially in Healthier SG, that indeed is something that we have to continue to work on, because beyond enrollment is also how well the clients or the patients actually follow up with what is needed in the implementation of the care plan. So we are under no illusion that just because we roll out Healthier SG, everything will be very smooth right at the beginning. So it takes a bit of not just system change in the providers, in the doctors and the care teams, but also a gradual shift in the mindset of our population as well. So it's something that we have to continue to do. There is no magic bullet to this, and it's not something we can achieve overnight.
Dr. Hamid Razak.
Thank you, Mr. Chairman. I'd like to ask two clarifications, one for MOS Rahayu. I really welcome the care protocols for osteoporosis as well as frailty from 2028. I'd like to ask if as part of this care protocol, whether there'll be an intentional strategy to include early education for those in the 30s and 40s, precisely because peak bone mass and peak muscle mass happens much earlier through lifestyle interventions such as nutrition, resistance exercises, and vitamin D, whether that's going to be part of the strategy so that we can frame this not just as an aging issue, but a life course preventive strategy. Next clarification to Minister. Really, I think a lot of the physicians will welcome that hereditary cancers will be now included as part of the coverage. I'd like to ask, because this is a high-risk group, and risk reduction treatment in this group will definitely entail high cost, whereas MediShield Life is a principle of risk pooling, and this may be actually competing interests, whether the ministry will look at design implications for MediShield Life, as well as treating the treatment costs for these high-risk individuals in a single concept rather than as episodic treatment, because there may be a time lapse between risk reduction treatment for a healthy breast versus a breast that has already cancer detected. And this will be supplemental cost throughout the life course of an individual. Yeah, thank you.
MOS Rahayu.
Thank you for the question. The care protocols are still being developed, and I thank member for this suggestion, something we can look into. What we do is that these are, we take guidance and recommendations from the Screening Test Review Committee as well as the ACE clinical guidelines. So there are some evidence and data that we will use in determining these protocols, but what you have raised will be something we'll take back and consider to be included.
Minister Ong.
On HBOC, I hope I get the member's question right. We actually did the modeling because risk reduction mastectomy save future treatment costs. And overall, actually, the impact on MediShield Life is quite negligible, which is why we are prepared to do this.
Dr. Chu Pei-Ling.
Mr. Chairman, I thank the Minister for his comprehensive response. In Tengah, Singapore's newest town with many young families, something quite remarkable is happening. Since last year, I have met 19 sets of twins among residents there. It reflects the stage of life many couples in Tengah are in as they begin building their families. As the Minister noted, healthcare needs for younger population are often episodic. But towns like Tengah also gives us a rare opportunity to start prevention early. Could the Minister share how MOH is working with other agencies so that preventive health can be built into new towns like Tengah right from the start, rather than introduced only when populations have already aged? Thank you.
Minister Ong.
I think some of the basic steps. It's like a fruit tree. You go for the lowest hanging, then you go higher and higher. Sometimes we think of the highest first. The lowest actually is what Dr. Harris mentioned. You've got to stick to one doctor, one GP, where you become your family doctor, advise you on the health of your family. Hence, Healthier SG. So a new town like Tengah, please go for it and get as many people as you can enroll for Healthier SG. After that, ensure that they follow up with their checkups, with their vaccinations, with their health screening. And then it will help if you promote anti-smoking, enforce against vapes. All these are very basic steps to ensure good health. I think put all this in place. Beyond that, we'll be more than happy to work with Dr. Chu, with other agencies, to see what other health programs we can implement in the Tengah town.
Ms. Hertingru.
Thank you, sir. I have three clarifications for SMS Co. The first relates to the new accelerated pathway for clinical psychologists. So my clarification is, what is the projected increase in the number of entrants to the profession as a result of this, in the future? And then my next point, my next clarifications relate to the announcement of the registration of psychologists. And I want to thank MOH for announcing this. And I think this will be taken with much, and I know there are a lot of people in the profession who actually really anticipate this, and they're very happy to hear this. And I think I have two clarifications relating to this, and they were actually part of my cut. So the first is, what is the support actually for people who are aspiring to enter the profession? Because, as I mentioned, the practicums and, the supervision costs can be quite prohibitive. So, my clarification relates to what is the ministry doing, or how is the ministry looking to address some of the concerns about barriers to entry for professionals who are interested in entering the professions. And then the second point is for people who are actually seeking these services, for clients, what support is available if they have, in the meantime, before these registration requirements come in? What are the what recourse do they have, and what support do they have if they have concerns about professional ethics and standards? Thank you.
SMS Co.
So I thank the member for her three clarification questions. On the first question about how many psychologists will end up eventually in the system, and what does the new pathway mean in terms of increasing the headcounts, I would say it's probably very hard to tell at the moment. The course, I think the initial phase of intake will only be about for 10, right? So we will also see what the uptake is from the first roll of the course. But bear in mind that there's also a pathway for existing psychologists to upgrade. So that's the existing pathway. So I think we need to actually let time just kind of sense out what is the demand overall from the undergraduate as well as the in-service psychologists. The challenge also is because we haven't done our registration of psychologists before this. So we don't really have an accurate number of how many psychologists there are out there. But offhand, Singapore Psychology Society has about 1,700 members. Most of them are also practicing in the clinical space. So if you give that as a ballpark, that's roughly probably the numbers that we're going to start with when we formally do the registration. But I think in time to come, once the registration is done, we'll have a better grip, a better grasp of the situation. On the second question of what support will be given to the aspiring, say, students who might want to enter the course, we are still in the midst of discussing with the institutions, but I would say minimally, you have to meet entry criteria, because that standards is not something we can lower, right? So students who are interested in pursuing the course, if they meet the entry criteria, then of course that will be something that will be accepted into the course. But I think beyond that, other support measures, like whether there will be subsidies for the course fees, I think it will largely, my understanding is, will be in line with what the IHLs have today. So if you're a Singaporean student, you will expect that there will be some subsidies to the fees. Then the third question on then how can the public who may want to seek psychology as care know who is legitimate? And in the meantime, before registration, it'll be very hard for us to provide a detailed list of the individual specialists or psychologists. But perhaps what they can do is to check whether this individual is registered, at least for the moment, with the Singapore Psychology Society, because at least that is the community of practice that is recognized as peers. So I think that will be a place to start for now. But certainly for those psychologists who are practicing in public healthcare institutions, there is already a governance framework in place, and the public should be, at least be comforted that these are the ones that have already been under supervision and recognized by our public healthcare institutions.
Mr. Pritam Singh.
Just two questions from me. One pertains to my cut on healthcare manpower, and I also note the comments made by various office holders about the super aged society and that we are here now. In line with this, is the ministry looking at new indicators or data points with regard to how the healthcare system is working in this new environment? So, for example, we've got healthcare institution statistics, which MOH helpfully releases now, attendance at emergency medicine departments, time for admission to wards, bed occupancy rates. I think these are helpful. But could there be other indicators that also would be helpful for the public, for example, waiting times at polyclinics? And would there be other indicators that reflect on how well the healthcare system is doing, looking after especially given the new environment that we're in? My second clarification deals with the other cut I had about the additional withdrawal limits. I take Minister's point about MediSave and the karma of MediSave, that there will always be greater demands on it to deal with expenditures. But of course, with the basic healthcare sum also increasing year on year, this would be inevitable to some extent. So to that end, can I inquire whether there would be some consideration as to increasing the additional withdrawal limits through MediSave as well? Thank you.
Minister Ong.
I will put Mr. Pritam Singh's suggestion into our wish list, which is getting quite long. And we do, as you know, we review this every year, and the next time we will review the wish list entirely. But to manage your expectation a little bit, the focus of MediSave, I totally get the tension between big lumpy episodes versus recurrent expenses. But all these are done in the context of ensuring subsidized healthcare is affordable and minimizing out-of-pocket expenses for Singaporeans. Additional withdrawal limits is for private insurance. So I think we will keep that in mind. Yeah. As for your first question, there are so many indicators in MOH. If you file a PQ, I will have so many indicators to tell you we are monitoring. And that includes waiting times, ED, polyclinics, bed occupancy rates, ALOS, what we call average length of stay across different settings. These are the immediate operational indicators. Medium term, we are hoping to make some impact in terms of enrollment into Healthier SG, follow-up with the checkup, with their check-ins, rate of screening, rate of vaccinations, and in the even longer term, the health of the population in terms of prevalence of chronic diseases, mortality rate of cancer, for example. So range of KPIs runs into 100 and beyond, but we will continue to monitor all of them.
Mr. Tarrington.
Thank you, Chairman. I have 4 supplementary questions. The first is on for SMS Co. It was mentioned that there was a master's in audiology, but my question is whether we have plans for a diploma or undergrad in audiology, as well as podiatry, which I understand we don't have any localized courses as stated on the NUHS website. My second clarification is for SMS Tan on flexible work arrangements for supporting caregivers. I understand that it's flexible work arrangements are differing context to context and workplace to workplace. How can MOH help to formalize the caregiver status and legitimize their need for flexibility in a way that they can better demonstrate to their employer the need for that flexibility? The third question is on the ICCP arrangements. I thank SMS Tan for sharing about the one care plan and one assessment, which is clinical. Would there be enhancements in the pipeline beyond clinical outcomes to also having one financial assessments as well as one employment coordinator for seniors who might be looking for part-time employment? My last question is on social prescription. We do see the need for social prescription in combating loneliness, which, as SMS Tan had highlighted, is equivalent of smoking 15 cigarettes a day. My question is, as we measure medical prescriptions, how are social prescriptions therefore measured and interventions tracked? My question also stems from how AAC participation is the current measure from a previous PQ that I filed regarding attendance as well as participation. How can we better take into account other areas that the senior might be active in, for example, in faith-based or community CC events or cause-based initiatives that they might be volunteering at? How do we take that into account? SMS Tan also highlighted there were studies ongoing with schools. If he could share a bit more details about what that entails. Thank you.
SMS Koo.
So I thank the member for his question on audiologists. Now, in general, a qualified audiologist in Singapore needs a higher level of certification because a diploma level may not be quite enough to perform the task. So we will look and see whether there's a way to actually find an in-between, but ultimately we cannot sacrifice standards just to meet the needs of people who can want to take a shorter course to get there. So I think the first thing is maintain standards, but there are actually some of these audiology programs that are done at a lower level. So for example, I do believe that there are some basic industrial audiometry courses at Temasek Poly, but that's really more for industrial application of technicians that are actually screening at the industry level, not so much as a clinical setting where you actually provide services at a hospital.
Mr. Ong.
I'll answer the last question, and the first two questions SMS Tan will answer. Social prescription, can it be tracked? Realistically, it can't be tracked because it's your life. We are there to provide the support, the funding, to make it as easy as you can. Come to the AAC, participate. But as to what you do with your life, I'm afraid I can't track it, and I don't think I should track it. But please enroll for Health 365. At least the app will help you track it. Yeah.
SMS Tan.
So I will try to answer the questions from Mr. Chai. And please correct me if I heard your questions wrongly, because I was trying to get your 4 questions. You asked, one of the questions was, if I remember correctly, whether social prescriptions are part of the One Care assessment and plan. In fact, that is actually part of the Healthier SG approach, where the care plan also includes the social prescription. For example, diet, lifestyle, exercise, and many more other areas. So certainly that should be part of a care plan, but goes beyond what the ICCB does. We should really focus a little bit more on some seniors and the needs for those seniors. And Mr. Chai also asked, in a way, could the ICCP and AAC help to cater for other different sorts of activities, whether faith-based volunteering, or maybe, for example, the seniors are interested in gardening as a social activity. Well, I would say that we are just starting to roll out the ICCP framework, starting this year and the coming years, and it is a non-trivial exercise across 84 sub-regions in Singapore, bringing together different parties, partners. In every area, every sub-region, there are different providers, different parties providing different services, from befriending services, rehabilitation services, and many more. So bringing the different partners together, having a common language in which to discuss, understand, and reach out and provide services to a senior is non-trivial. Having a standardized tool based on this assessment, developing a care plan, implementing this care plan, and getting our seniors to go through the care plan entirely is non-trivial. So I would say, let's take one step at a time. And there are many activities and other partners in the community providing different services and volunteering opportunities for our seniors. We welcome it. It's really part of the fabric of a diverse community and very much part of the We First society.
Mr. Fadli Fauzi.
Flexible work arrangement.
Chairman, I have a clarification for MOS Tan Kiat Hao. I would like him to confirm whether MOH will take up my suggestion of a caregiver passport, and whether MOH has any considerations which may prevent the suggestion from being adopted. Thank you.
SMS Tan.
So let me take the opportunity to also answer Mr. Chai's question that I missed out earlier about flexible work arrangements and how can we work with different partners on that. Certainly, this is something that I mentioned in my speech, different ministries' effort to support caregivers, and we understand the challenges that caregivers face, juggling between work and care, and it's something they are working on. So flexible work arrangements and different other initiatives and support. We'll continue to work with our colleagues and other partners in the community. On Mr. Fadli Fauzi's question around the career caregiver passport, if I get it correctly, that he referenced in his speech in his card from UK. Well, as I mentioned in my speech earlier, I think Mr. Fauzi wasn't in the room, that we certainly welcome all different suggestions from members, including other suggestions that members have raised as part of this MOH-COS and in other occasions. And specifically to his suggestion, I looked at it online. I must caveat to say that the information I get was really what I can glean from online resources. It's a ground-up initiative in UK. And it's a way for the different parties involved in this ground-up initiative, and these parties range from hospitals to supermarkets, he mentioned earlier, to show care and support for caregivers. For example, some hospitals may provide longer visiting times. The hospital canteen may give some discount to caregivers eating there, and some supermarkets might give some discounts. It's a ground-up initiative where different parties come in. And also, because it's a ground-up initiative, I understand that the implementation can be quite uneven. Different caregivers going to different parts of the city in UK may have different experiences. Going to different supermarkets will have different experiences. Some supermarkets do provide the support, some don't. It's a voluntary effort. And like many ground-up initiatives, we certainly welcome them. And there are many funding support in government to support ground-up initiatives. So if Mr. Fadli Fauzi knows of individuals or parties who want to gather together, support our caregivers, ground-up support, we certainly will look at those proposals.
Dr. Wan Rizal.
Thank you, Chairman. 3 clarifications for SMS Co. As I mentioned earlier about the mental health office, National Mental Health Office, that was established to coordinate multi-agency initiatives. What would SMS be able to share? What are their KPIs? For example, whether there's a reduction in average wait times, improved care continuity, reduced crisis presentations, and how often will this, if any, be reported? SMS also mentioned a tiered care and a no wrong door approach, which I welcome. Will MOH share the desired service standards? For example, maximum time to first contact, maximum time to first clinical appointment for moderate or high-risk cases, and escalation protocols across settings. And my third and final one is SMS spoke about retention measures for nurses and allied health staff. Are there any retention levels for psychologists specifically? For example, specialist track, progression, and the public sector pay competitiveness.
SMS Co.
So on the first question regarding KPIs for National Mental Health Office, I did mention in my earlier PQ replies a few days ago that our key focus now is on building capacity, because in ensuring enough capacity to meet the needs of those who may need to seek help, naturally you will reduce any of these waiting time. But what's important is that putting forth the first stops for mental health, which is accessible, for example, myline.sg is 24 hours, it's accessible, it's anonymous, would really remove the key barriers that is holding everyone back from seeking at least the first contact point to get some advice, to seek further help. And in terms of KPIs, therefore, the first stops would not have waiting time. It's a 24/7 available chatbot. There are counselors who are manning the phone lines that you can actually call anytime to speak to them or to text them on WhatsApp. So I think from that first touch point, there is really no waiting time. But what's important is to make sure that the individual that gets into the first touch point is prepared to also receive help to higher tiers of care if they need to. And oftentimes, this is where the challenge is. Many of them will be reluctant to move on to the next tier of care because, as all of us have dealt with in a community on challenging individuals with mental health issues, sometimes getting them to even come forward to seek help is the problem. It's not that the resources are not there, but they are not willing to come forward. And it's multifactorial, it's difficult. So it's really about convincing them, working with them, earn their trust. And we hope that actually some of the first stop resources we put forth will be a way in which our counsellors can convince the individual through a phone call to actually be prepared to step forward and receive care. Having said that, that will flow into the second question on the tiered care model, in which whether there are ways to monitor those at high risk, whether they receive care. Again, and following from the train of thought, I would want to assure the member that those who are deemed to be high risk will always be prioritized. So, for example, if they enter through if they receive counseling online or through a phone call, and the counsellor assesses that this individual is at risk of suicide ideation, they will try their very best to convince the individual to step forward and receive care. And if the person is prepared to come forth, there will be a protocol to fast-track them to make sure that they receive immediate attention from qualified psychiatrists, or even present at the A&E in IMH where care can be immediately rendered. But like I said, the biggest hurdle is whether they're prepared to step forward, and not really the care capacity per se. So I hope this is something that the member can understand, why it is not meaningful for us to also track some of these timelines, because the counterfactual is unmeasurable. There's no way to measure how many who are at risk and whether they turn up or eventually they become a suicide case. The counterfactual is unable to validate. So we will therefore focus on putting forth resources to make sure that if they're prepared to step forward, the resources will be available. On the third question on retention for psychologists, I think let's take it one step at a time. We are starting with registration to give formal recognition to those who are practicing in higher risk subsectors in psychology, and making sure that the quality, the standards, and the support is given to them to deliver the care that the clients and the patients need. And at the moment, we are not looking at anything more than that for now, but let's take it one step at a time. Certainly in the healthcare sector, we have also given out retention and measures to allied health professionals in, I think it was just about 2025, if I'm not wrong. Yeah, so we will look at it holistically as part of supporting our allied health professionals.
Associate Professor James Lim.
My question is for Minister Ong. So I mentioned lumpy medical expenditure in my cut, not just in the context of end-of-life care, but actually also on an ongoing basis. And this is based on feedback that I've received from residents. Now, at the same time, I'm keenly aware of what Minister mentioned about the inherent tension between current and future usage. And that's why my suggestion to allow a carryover of unused annual limits for just up to 3 years may actually balance the prudent drawdown constraints while also permitting flexible usage to meet lumpy needs. So if I may frame my question posed in my cut another way, what does the minister perceive might be the logistical or behavioral difficulties that is associated with allowing this sort of limited carryover of annual MediSave limits?
Minister Ong.
I'm not going to immediately say yes, good idea, or no, we will reject it. I think it is an interesting idea. As I say, we review the scheme every year. I do want to see how we can create more flexibility, and we'll take your suggestion into account.
Mr. Hong Wing.
Thank you. Thank you, Mr. Speaker. My clarifications is on aging and the super-aged society. Of the seniors living within the vicinity of the AACs, how many of them, what proportion of them are actually actively engaged? That's the first clarification. And secondly, I understand that offices like SGO, the Silver Generation Office, do proactively engage seniors in their premises. But what else are we doing differently to engage seniors who are socially isolated that may not voluntarily step forward to join the AAC activities? Thank you.
SMS time.
So, as I mentioned in my speech earlier, we've expanded the footprint of the AACs to about 230 centers. Has been done so. We have done so over the last 2 years, expanding the footprint. We serve about 100,000 seniors now, and we want to do more. And in a few aspects, First is not just the number of the AACs, which is one thing. So the number of AACs make it more convenient, easier for seniors to come by to an AAC near their home, an environment they're familiar with, in a neighborhood they are familiar with, and we want to do so. That's why we expanded the footprint. But beyond the number of AACs, it's also the activities that AACs do to make it meaningful for the seniors to come by, so that they are not socially isolated. They come by, they participate, they are engaged, they make new friends, and hopefully they also can make changes to their lifestyle so that they can be healthier and happier. And over the last few years, and in the coming years, we'll do more to expand the number of activities that AACs do, going beyond just maybe just doing, for example, activities like healthy rumba, etc., to also create more awareness about health and also having CHP, health posts within the AACs to provide services to our seniors. And we'll continue to explore how we can do more, so that not just quantity, but the kind of activities. Thirdly, well, the Silver Generation Office, we have Silver Generation ambassadors that reach out to seniors. As I mentioned, since 2022, they've engaged more than 600,000 seniors. And they do so not just to reach out and to speak to the seniors, less of befriending as well, but also preventive health visits. Understanding the circumstances of the seniors that they visit at home. What kind of needs the seniors have? What kind of family circumstances is there behind a closed door? And are there services, especially those near their homes, that are relevant to those seniors, and connect them to those services, whether it's AACs, SCCs, or even mental health services. So the SGAs, the Silver Generation Ambassadors, go beyond just do visitations, but also provide a valuable touch point to the community and a connector to services that are around the vicinity of the senior. And we want to do more for seniors who are socially isolated. And we've been working with community partners, not just AACs and SCCs, but also other organizations in the community, including faith-based organizations, voluntary organizations, to do more, to reach out to those seniors. And we are working very closely. That's where I think the ICCP comes in, for seniors who are discharged from public health institutions, hospitals. How can we make sure that those seniors who are discharged are not left alone, are not forgotten? And that's where the referral process comes in with the ICCP and ICCP to work out the assessment and a care plan for those seniors, and crowd in partners to reach out to those seniors, especially those who live by themselves. So to members' point, I welcome any suggestions, but this is an area, an important priority for the MOH in the coming years.
Ms. Sylvia Lim.
Thank you, sir. I'd like to return to the Minister's TikTok video. I'd clarify that I don't usually watch his TikTok videos, but that particular one was referred to me because I had feedback from some people in the insurance industry that that video on integrated plans and riders created an impression in some members of the public that riders were not really necessary. So in the video, riders were symbolized by a wooden horse, and I think at one point in time, the minister flicked the horse off the table. So I don't know whether the minister is aware of that feedback, that that video may have given the impression to members of the public that riders aren't really that useful, and could he take this opportunity to reaffirm again that riders are indeed prudent for the reasons I mentioned in my cut?
Minister Ong.
It's the challenge when attention span is so short and you try to put so much information in a short video. I'm not surprised the insurance industry gave you that feedback. But I think the video and the information that we've been putting out is a serious one, which is you have to examine if you really need a rider. Let's go back a bit. The purpose of insurance is to cover expenses that we cannot afford. And for most of us, it's because if we have a big inpatient episode running into tens of thousands, hundreds of thousands of dollars, a big bill, the insurance plus subsidy can cover it. The rider does not do that job. We put cancer aside. The rider cover co-payment. The rider cover deductibles and cover the 5% co-payment. That's what that's the core purpose of the rider. And therefore, look at it carefully. I think talk to your financial advisor, and given your premium as you get older, the rider premium goes up the most. Balance the cost and benefit to see really if a rider is suitable for you. I think the core message of the video continues to be accurate, yeah, that we should really take a look at our financial needs, what risks are we trying to protect, and then examine, do I need a rider? If I need a rider, will the new riders that the insurance companies are introducing in April, where you cover less of co-payment but at a much lower cost, is that more suitable for me? So I think take those steps. Needs are varying. Different people have different needs. Some really wish to pay more premium in order to cover as much as you can, and so be it. But others who use, especially those who use public health institutions, use subsidized care, really take a close look if you really need the rider.
Ms. Lim, quick one.
Thank you, sir. To follow up with Minister, isn't it the case that actually if you don't have a rider, then there is an exposure that the patient will have to pay hospitalization bills at 10% without any cap? I mean, that is one of the concerns about loss limits in that sense.
Minister Ong?
That's not quite accurate, because what we are, okay, if you are talking about riders, if you don't have a rider at all, yes, you do co-pay the 5% or 10%, yeah. So if you are considering that I go to a private hospital where my bill may run up to hundreds of thousands of dollars, and I want to protect myself against that 10% co-payment, yes, a rider will be, may be suitable for you. But do remember, as you get older, in your 70s, in your 80s, premium runs up to $10,000 a year. Yeah. And if without that rider, you are saving that premium. So do your calculation, talk to your financial advisor. But if you are always seeking help, seeking care in a subsidized public health settings, then MediShield Life kicks in, plus subsidy, is very unlikely you are exposed to tens, hundred thousands of dollars of exposure should you fall sick. Then consider whether a rider is suitable for you. Yeah. And remember that in a public health institution, when you can't afford, there's MediFund that you can always apply for.
On that note, I think all clarifications have been asked and responded. Can I invite Ms. Mariam Jafar, if you'd like to withdraw your amendment?
I thank members for the robust debate. I think healthcare is probably one of the most complex ministries. So on behalf of the Health GPC, I'd like to say thank you to the healthcare family, from everyone at MOH to the front line in the hospitals and community. And with that, I beg to withdraw my amendment.
Is the honourable member given leave to withdraw the amendment?
Aye.
I think leave of the majority is given and the amendment is withdrawn. The question is that the sum of $20,035,377,700 for head O stand part of the main estimates. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it. The question is that the sum of $2,467,566,400 for head O stand part of the development estimates. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it. Head X, Ministry of Culture, Community and Youth, Mr. Alex Yam.
Chairman, I beg to move that the total sum to be allocated for Head X of the estimates be reduced by $100. In quieter times, discussion about national identity can feel philosophical, even abstract. But we certainly do not live in quiet times today. The world around us is very much unsettled. War rages again in the Middle East. Major powers are contesting influence across regions and supply chains. Strategic rivalry is intensifying. Closer to home, regional tensions periodically flare as well. For a small and open country like ours, these developments are not distant headlines. They remind us that the global environment is becoming more fragmented and uncertain. In such a world, national resilience cannot rest only on economic strength or military capability. It must also rest on something less visible, but equally vital, and that is social trust. The confidence that fellow citizens will stand together when it matters. This is the essence of what we mean when we speak about a we-first society. But building such a society today is not so straightforward. Singaporeans, understandably, are focused on bread and butter issues. Families worry about the cost of living. Parents think about their children's future. Workers are adapting to technological disruption and economic uncertainty. In a fast-paced and demanding society, it is natural for people to focus first on their own households. Yet, if everyone looks only inward, the invisible threads that hold our nation together will loosen. A we-first national identity cannot be built by slogans alone. It cannot rely only on campaigns or occasional events. It must be experienced in daily life and reinforced through habits. Singapore begins from a position of strength. Surveys by the IPS consistently show relatively high levels of trust in our public institutions. Community participation and volunteering have grown steadily over the years. But trust is not a static asset. It must be continually renewed. International comparisons are perhaps instructive for us. In many Nordic societies, more than 60 to 70% of citizens say they trust people they don't know personally. These are among the highest levels of social trust anywhere in the world. Such trust did not arise by accident, of course. It is the product of social norms and institutions that encourage citizens to participate actively in community life. Take Denmark, for example. There is a deeply rooted tradition known as foreningsliv. It refers to a vibrant culture of associations where citizens organize sports clubs, cultural groups, volunteer initiatives. Many of these organizations are run not by professionals, but by ordinary citizens. These associations build horizontal bonds across age, profession, and backgrounds. They create social networks that sustain trust. In the Netherlands, there's the concept of gezelligheid. This word has no perfect English translation, but it captures a sense of warmth, togetherness, and shared belonging. It reflects the idea that communal life matters. It's not merely a collection of individuals pursuing individual goals. In Japan, the Yakult ladies play a vital social safety net role in keeping a super-aged society connected. These examples remind us that social cohesion is, of course, not automatic. It's cultivated deliberately through everyday practices. So for us, we must begin with our young. Schools are places where students prepare for life. They are also where civic instincts are formed. Programs that bring students into contact with different segments of society can deepen empathy and a sense of shared responsibility. In workplaces, many Singaporeans spend a large part of their lives at work. Employers therefore have an opportunity to foster environments where collaboration across backgrounds, nationalities, and skills is valued, and where corporate volunteering help employees contribute beyond their professional roles. In our neighborhoods as well, those are the most immediate settings where we first instincts can flourish. Singapore's housing model has long been a quiet but powerful engine of social cohesion. But as lifestyle changes, we need to reinforce face-to-face engagements so that neighbors don't become strangers. Initiatives that bring residents together can help restore that sense of familiarity with each other. We must also recognize that much of our national conversation takes place online. Digital platforms have extraordinary reach, but they also amplify outrage, misinformation, and polarization. So for a diverse and multicultural society like ours, cultivating digital citizenship is also essential. Our online spaces must reflect the same values of responsibility and mutual respect, as we do in our physical spaces. We must also continue to bridge differences across generations and socioeconomic groups between the old and the young. Creating opportunities for these generations to interact will help anchor our national identity in both memory and renewal. We must guard against social silos forming as economic pressures rise. A We First society must ensure that compassion and mutual support remain embedded within our social compact. Chairman, therefore I look forward to hearing how MCCY intends to further embed the ethos of We First across multiple aspects of society, so that our national identity is formed through participation, not just persuasion. It will be the quiet but enduring conviction amongst our people that our faith is shared, and that when the world is more turbulent, Singaporeans will instinctively do what we have always done best, to put we before me. Because in this uncertain world, the greatest strength Singapore possesses will not just be our economy or institutions, but our people.
Question is that the total sum to be allocated for Head X of the estimates be reduced by $100. Ms. Mariam Jaffar.
Young people today face a lot of pressure. School exams, social media influence. Behind all of this, many young people are quietly asking themselves, who am I and where do I belong? When stressed, the search for identity and the need for a sense of belonging collide, our mosque can be more than just a place of worship. Mosques can be safe harbors. Mosques have a unique strength in supporting youth well-being because they offer community, meaning, and guidance from trusted adults. For many youths, their struggle with anxiety or identity are not just emotional questions. It also touches on spiritual and hereafter matters about purpose in life, self-worth, and relationship with their faith. That's why spiritual guidance cannot be viewed separately from well-being. I welcome efforts by MUIS and the mosque sector in stepping up on youth engagement through initiatives like NextGen. However, we must do three things. First, we must listen, give youth a real voice, involve them in co-designing programs regularly at district and congregational levels so that the initiatives they create will speak to the real challenges that you face. Second, we must equip them. A young person may approach an ustaz or a youth leader long before they seek professional help. The question is, are we ready? Can we consider piloting a project involving trained youth counselors in the mosque, peer support groups, as well as clear referral pathways? Spiritual guidance and professional care must work hand in hand. Third, we must reach out. We cannot wait for youth to walk through the doors of the mosque. Instead, we must bring mentoring and resilience workshop into the community spaces and digital platforms. Meet them where they are. Every young Malay Muslim needs to believe that they are seen, valued, and supported in faith and in life. Because when our youths are anchored in faith and supported in well-being, our community will become stronger, and so will our nation. Thank you.
The Singapore College of Islamic Studies is an investment into the next generation of religious leadership and scholarship for the local Muslim community and builds on the existing work and contributions of our madrasas and religious institutions here. How will SEIS ensure that its programs will maintain high standards of Islamic scholarship relative to other institutions around the world, with the aim of producing graduates who not only contribute to the needs of the local Muslim community, but extend their depth of scholarly knowledge, wisdom, and expertise to also benefit wider Singapore society and indeed the world as a whole?
how does the Minister see SCIS's importance, centrality, and development in the context of today's global developments and SCIS's potential contributions alongside Singapore's nation-building efforts and forward aspirations as a country?
Mr. Fadli Fauzi.
Mr. Chairman, in January, I asked a PQ about the population planning parameters used to determine whether a new mosque will be built and whether these parameters include not only Muslim residents, but also the Muslim working population and Muslim foreign workers. The minister's answer did not reveal the specific population planning parameter or the exact mosque to Muslim resident ratio that the government uses. My question was prompted by news of the planned closure of Masjid Al-Firdaus in Choa Chu Kang. Although located in a relatively isolated area, this mosque has fulfilled the spiritual needs of the community, including national servicemen stationed nearby and foreign workers employed in the area for more than 60 years. Masjid Al-Firdaus is to be closed once a new mosque in Tengah is completed. This raises the question, what are the specific planning parameters to determine whether and when a mosque should be closed down, relocated, expanded, or newly built? Does the government have a target mosque to Muslim resident population ratio? And if so, may we have some clarity on it? Other than that, while we rely on planning parameters to determine how many mosques will be built, we must also consider heritage beyond just numbers. For example, because of historical settlement patterns, we still have kampong-style mosques in sparsely populated areas like Masjid Omar Salma in Bukit Brown or Masjid Hang Jebat in Queenstown. These mosques may no longer have large congregations, but still have long histories that carry meaning for the community. When new housing estates are built, will it be the policy of the government to rationalize the number of mosques by relocating or closing old mosques like Masjid Al-Firdaus? As the minister noted, our mosques are funded by the community through the Mosque Building and Mendaki Fund or MBMF. Our mosques have always been community assets and anchors of faith, history, and identity built through sacrifice and collective effort. How can we strike a better balance between prudent urban planning with heritage preservation? Thank you. Since its launch on 3rd August 2024, only 150 Muslims have designated WMS as beneficiaries in their wills or nominations. This represents only 0.1% of Muslims aged over 60 and just a small fraction of our entire Muslim community. We need to examine this figure more closely. WMS has the potential to become a financial backbone supporting the Singapore College of Islamic Studies, ensuring the continuity of our madrasas and supporting mosque operating costs. Aside from funding institutions and infrastructure, WMS funds are expected to be channeled to support social programs, education and youth development, investments that will shape the identity and capabilities of future generations. Without adequate contributions, we risk undermining the institutions and programs that safeguards our religious heritage and develop our community's potential. WMS offers every Muslim in Singapore an opportunity to build a lasting legacy, especially since there are restrictions on endowing other forms of assets as wakaf. Each endowment will generate returns, supporting students, maintaining religious institutions, and helping the needy. I suggest we broaden community engagement platforms such as mosques, community clubs, schools, professional bodies, and student associations. These sessions should empower our community with knowledge about the profound social and spiritual impact through WMS. I would like to ask the Minister, first, how will the Ministry tailor outreach efforts to different segments of the Muslim community? Our Muslim community is diverse: Indian Muslims, Chinese Muslims, Arab Muslims, Malay Muslims, youth, professionals, and seniors. Each group has its own perspectives and communication channels. Are there specific programs suited to their context? Second, will the Ministry fully disclose the assets managed under the fund and provide the latest updates and information to contributing estates as soon as the fund is active? When the community sees clear evidence that the fund is being used responsibly, such as a student successfully graduating, a family being helped, or a mosque whose maintenance has been completed, it will deepen trust and inspire others to participate. We should aim to increase the figure from 150 contributors to thousands. Every Muslim family should consider WMS in their legacy planning and regard it as an opportunity to make a lasting investment in the hereafter.
Mr. Chairman, I want to address challenges facing many young families. Many belong to the sandwich generation and face pressures from rising living costs while balancing responsibilities of raising children and at the same time caring for aging parents. Sometimes they bear all these without strong family support networks, unlike previous generations. As a mother, I've experienced the joyful early phases of marriage and parenthood. But when facing new experiences, feelings of confusion, fear, and exhaustion can emerge. Preparing breakfast, adjusting to new routines, staying up when children cry, all while balancing work and family demands. This can affect household well-being. In this context, the Bersamamu or Together With You program and Project Arif have helped many couples in early marriage and parenthood, providing religious guidance, medical perspectives, and practical skills to strengthen communication and financial planning. I would like to ask about the latest developments on Project Arif and Bersamamu. How many young couples have benefited from these initiatives? Are there plans to expand services, especially in aspects like mental health and wellness support for young couples? Also, since these, are there consideration to strengthen the program with strengthen cooperation with programs like Kids Start, so family support can be implemented continuously? How does the government outdo its outreach to ensure young couples know about these programs? With more multi-generation families and increasing elderly population, clearly our social landscape is changing. I've also raised the need to give more attention to our elderly. Nationally, there are many efforts supporting the elderly in their golden years. But can we consider support programs for multi-generational families living under one roof? Mr. Chairman, I request that the Ministry consider allowing Mendaki funds to be used for establishing a community of excellence. While it is understandable that these funds are mostly set aside for education, it is important that we realize that there is still a strong financial foundation within this organization. We need to look beyond education as the sole pathway to success and to explore other forms of achievement like arts, sports, and career development. We want to ensure that every individual receives the necessary support and becomes the best version of themselves. Mendaki should also look into providing holistic support to families that encompasses financial literacy education and strengthening family bonds. Mendaki should be able to envision how this community can be developed and ensure that programs designed to support it are implemented holistically and professionally. Thank you.
You may take your two cards together.
Mr. Chairman, in our AI planning must ensure that students and youth use technology, but also able to raise value from it. Recently in Toa Payoh, I met secondary 4 students who said that he's interested in AI. But when he asked further, he said he has never written code and is not sure how to start. So what is lacking is not aspiration, but exposure. So how do we evaluate the effectiveness in literacy and numeracy, especially for Malay Muslim students who lack support at home? Secondly, how is Malay Muslim program support is organized, such as in applied technology and advanced manufacturing, so that it opens new job opportunities? And finally, beside participation rate, what are the indicators we use, such as the involvement and industry training to make sure that it's lasting? Mr. Chairman, in our Malay Muslim community, the family has always been the first line of care. Many of our seniors are supported by children and grandchildren who do their best to provide financial support and companionship and daily assistance. But as family structures evolve and working lives become more demanding, we should ask ourselves, how do we sustainably support our seniors' social and mental well-being? On the ground, we see seniors who are widowed and living alone, elderly parents who hesitate to burden their children, and caregivers who quietly manage both work and elder care responsibilities. Many of them may not openly express distress. That is why social and emotional support must go beyond occasional events. It must be sustained, trusted, and easily accessible. Firstly, how are we strengthening regular befriending of seniors, peer support, and community touchpoints so that seniors remain socially connected throughout the year? How can we bring back that kampong spirit amidst today's modern housing environment? Second, what more can we do to support caregivers within the Malay Muslim community, especially those in the sandwich generation, balancing work and parental care? Are there accessible support networks and early intervention channels to prevent caregiver burnout? Third, aside from the number of program attendees, what indicators do we use to measure actual impact, like reduce isolation, improve emotional well-being, and stronger intergenerational engagement? Cik Syaritaha. Terima kasih, Tuan Pengerusi. Mr. Chairman, our young people are the hope for our community's future. The Mendaki tuition program has greatly helped our students succeed in their studies. However, our children's future cannot depend on tuition alone. The key question is, are we really preparing our young people for tomorrow's job market? Today, the world is changing very rapidly. New industries such as technology, artificial intelligence, engineering, and the digital economy are expanding. We want to see more of our young people daring to dream, being confident in their abilities and pursuing future industries such as aerospace, artificial intelligence, and cyber security. The government and community organizations need to have closer partnerships, not only in academic support, but also in career exposure, mentorship, guidance, and real job opportunities. The M-Cube Pasir Ris Changi, there we run programs such as learning journeys, robot wars, and hackathons to expose our young people to the skills needed in new industries. However, these efforts need to be expanded further. With the establishment of professional networks across over 10 industries, how can we leverage these networks to heighten awareness about new skills, career pathways, and job opportunities, especially for our young people? How can these networks also collaborate with schools, Mendaki Tuition, MCube programs, and youth organizations so that more young people get early exposure to future industries? By 2030, Singapore will become an aging society. Many seniors visit the mosque daily, not only to pray, but also to seek peace, support, and companionship. Mosques play a key role in the lives, a very important role in the lives of our community. Imagine if mosques could work more closely with agencies such as HPB and MOH, as well as partners in the financial sector to provide comprehensive health, financial, and social support, everything in one place that they trust and are familiar with. In Pasir Ris Changi, Al-Istighfar Mosque, together with M-Cube, have been holding talks on lasting power of attorney, conducted health screenings, as well as fitness activities such as the Yalla Run and Move with Muiz to support the well-being of our seniors. My question is, how can mosques work more closely with these agencies to provide religious support as well as comprehensive support to congregants? Mr. Chairman, the economy is evolving rapidly and we cannot simply be observers. With the establishment of the National AI Council, the National AI Mission, and AI Champions program, many new opportunities are emerging. The question is, are Malay Muslim businesses ready to step forward in this new world? Thank you.
So I would like to touch on youth transiting from higher education institutions, ITE, polytechnics, and universities to the working world. This transition is a momentous occasion in every young person's life. In a rapidly changing economy, owning a certificate or diploma is no longer enough. Our youth need early exposure to growth sectors and understanding of future skills, as well as closer relationships with employers. We want to see more youth entering good jobs in sectors such as technology, advanced manufacturing, healthcare, and AI-enabled roles, not by chance, but through clear and planned pathways. Under Focus Area 4, or FA4, of M-Cube, there is scope to strengthen support for this transition in a more structured manner. NTUC and Mendaki are ready to collaborate with IHLs, employers, and community partners like Membina Community and 4PM to enhance career guidance earlier on campus, provide channels towards career coaching services, and advice on skills that are more targeted to growth sectors, expand access to industry mentors and professional networks, and open pathways such as internships, place and train, and entry-level roles in high-potential industries. A more integrated approach like this can help ensure that our youth understand the available opportunities, build confidence, and are ready to face the transition more confidently. However, this effort will be more effective if it is supported by strong coordination between ministries, agencies, and educational institutions, so that these transition pathways are well structured, have clear outcomes, and can be scaled up if proven effective. Thus, I seek the Minister's views on How does the government plan to strengthen coordination between ministries, IHLs, and community partners so that this youth transition support can be implemented more systematically with measurable outcomes and help more of our youth enter good jobs in growth sectors? Thank you.
Harun Al-Habsi.
Language, tradition, and culture are the pillars that strengthen ethnic identity. These elements shape how we understand and value our own heritage and help us find the balance to build strength and unity together in Singapore's diversity. Can the Minister share information about programs in the pipeline and the latest updates on the Heritage Centre reopening scheduled for April? How can the Malay Heritage Centre continue to strengthen awareness, knowledge, and appreciation of Malay culture, especially among young people, and contribute to broader efforts to strengthen social cohesion and nation building collectively in the future?
Dr. Hamid Raza.
Mr. Chairman, sir, here in Singapore,
di Singapura,
Indian Muslim organizations, IMOs, and other committed partners. But when efforts run in parallel, residents can face repeated touchpoints, gaps between services, or a confusing handoff from one organization to the other. This is where the M-Cube network can play a practical, convening role, strengthening collaborations between MMOs and IMOs and other community partners, so strengths are combined and outreach is more coordinated on the ground. I have two questions for the Minister. First, how can the M-Cube network strengthen collaboration between MMOs, IMOs, and other community partners, including shared referrals and joint planning, so individuals and families experience one coordinated pathway of help? Could the Minister consider adopting a no wrong door approach? Second, will the Minister consider a common playbook for MMOs, IMOs, and partners with simple navigation standards and a small shared set of outcomes to make outreach more seamless? In Malay, please. Tuan Pengguru.
Mr. Chairman, I call upon our Malay Muslim community organizations and grassroots bodies to work hand in hand rather than operating separately. Each organization has its own strengths. Some are strong in youth matters, some in family issues, some in education, careers, or social services. If we coordinate our efforts, we can reach out to more people faster and more effectively. Let us complement each other, share clear frameworks, and contribute according to our respective strengths so that our community can achieve the vision of becoming the best version of ourselves, confident in our identity, and continue contributing to Singapore.
Tamil, please.
Mr. Chairman, a whole of society effort means that Malay Muslim organizations, Indian Muslim organizations, and other community groups must work together in unity. Every community has its own strengths. We have to have a whole of community approach. What does this mean? The Malay Muslim organizations and Indian Muslim organizations have to come together and achieve our national objective, and we have to work together. When we work together, our last mile outreach will become more precise. Our young people, our people who are in need, we have to work together to make these people progress forward together.
I will focus on 3 areas: the Singapore College of Islamic Studies, strengthening support for Malay, Indian and/or Muslim organizations, and increasing social mobility for our families. Sir, in Malay. Penubuhan College Pengajian.
The establishment of the Singapore College of Islamic Studies is an important step in developing local religious leadership that is capable and sensitive to Singapore's unique multicultural society, as well as being knowledgeable about Southeast Asian dynamics. Many have high hopes for the success and credibility of SCIS, which is seen as a long-term investment for our community and Singapore. Last month in Parliament, I asked the acting minister about SCIS and was encouraged by his clarification that the establishment of SCIS has been well received by regional partners. Therefore, to further boost confidence in SCIS, it is important to share information about efforts that will guarantee its quality, governance, and expected outcomes. May I seek clarification on how SCIS will ensure its program's quality control so that graduates can guide our community in the future and serve Singapore at the same time. Beyond academic qualifications, to what extent will the targeted standards emphasize strong religious understanding, comprehensive spiritual capabilities, as well as graduate skill in guiding the Muslim community in facing current social challenges? Mr. Chairman, as someone who has served more than a decade at PPIS and a member of the first cohort of the TUNAS program, I deeply understand, cherish, and respect our MMOs and IMOs. The majority of MMOs and IMOs were established before 1965 and are still around. They weathered all storms and stood the test of time. Each one remains focused on their individual objectives, be it strengthening families and empowering women, supporting workers, nurturing youth, and guiding children. They are experienced and serve as pillars of community trust. MMOs and IMOs are assets to the community. Therefore, they should be prioritized as long-term strategic partners where their sustainability is given attention. Currently, Yayasan Mendaki has worked to ensure more can benefit from CLF funds, an important effort that should continue. I asked the acting minister to comment on the utilization rate of CLF funds by MMO, IMO, and what new efforts there are to encourage more to apply. Second, when Kurnia at WGS was launched, when Wisma Geylang Serai opened its doors in 2019, it aimed to unite MMO and IMO so that it would be easier for the community to obtain comprehensive assistance. Since January this year, it is understood that this office has been merged with MQ at Geylang Serai to foster closer cooperation. I hope that the Minister can share more about the future plans for this office and whether this effort will be expanded for other MQ towns, especially MQ at Bedok, which I have the opportunity to lead. Mr. Chairman, fundamentally, whether managed by MQ, MMO, IMO or SSA, the mission is the same, to improve the quality of life of our community so that the future of coming generations will be brighter. I welcome Singapore's efforts to actively support vulnerable families. The challenges faced by these families are increasingly complex, from financial pressures, health issues, family relationships, job searching to housing. Fortunately, these families can receive help from various parties such as Family Service Centres, FSC, Social Service Officers, SSO, Malay Muslim Organisations, MMO, Comlink, MCUB's Project Dian, and so forth. Could the acting minister summarise how effective this support ecosystem is for vulnerable families and share the latest information and future plans to enhance Project Dian?
Good policy must translate in real life. If coordination exists only on paper, families continue to bear the burden of navigating systems. There has to be shared practice standards, clear referral pathways for continuity of care. Beyond programs and subsidies, social capital itself matters too. Community platforms that build social capital, such as professional networks, alumni networks, or cross-community connections play an important role for social mobility. For social mobility to be sustained across generations, we must be intentional to invest beyond services and subsidies, but in social capital to open doors of opportunities. Chairman, as it is often said in the House this past 2 weeks, where you start should not determine where you can go.
Acting Minister, Associate Professor Muhammad Faisal Ibrahim.
Mr. Chairman, Mr. Chairman, with your permission, I will take clarifications after my speech. Mr. Chairman, let me say a few words on the situation in the Middle East. Our thoughts and prayers are with the innocent civilians in the affected region. The fact that these attacks took place during the holy month of Ramadan deepens the pain felt by many. We are closely monitoring the situation together with colleagues from the Ministry of Foreign Affairs. I had a video call last night with some of our Singaporean students in the Middle East. They were understandably concerned, but are staying calm. I assured them that their safety and well-being is our top priority. We will continue to stay in close contact with them and render any support we can. We are also in touch with the Association of Muslim Travel Agents, AMTAS. They have advised their member agency to help affected Umrah travelers with adjustments to their travel plans where needed. These recent events are a stark reminder that the peace and harmony we have in Singapore is especially precious, and we cannot take it for granted. There's a Malay saying, sehati menghadapi, sepakat membangun. It means to stand united in overcoming challenges and to work together to build a better future. This has always been a defining strength of all Singaporeans, and particularly of the Malay Muslim community. It has helped our community achieve remarkable progress over the years. We have built stronger marriages and more resilient families. Our children are better educated, and many have found good jobs across different sectors of the economy. We are able to practice our faith, celebrate our culture with pride, and live in harmony with friends from other races, religions, and cultures. Despite the progress, I recognize that everyone has a different lived experience. During my engagements with the community, I also hear concerns about job security. Some have shared difficulties in trying to access help, and others have called for greater support for those struggling in silence. It is crucial that as we move forward, we ensure that nobody gets left behind. Mr. Chairman, many have asked me what my vision for the community is. While we might each have different circumstances, I envision a Malay Muslim community where every member can be the best version of themselves at every stage of their lives. I speak not just for myself, but for my fellow parliamentary colleagues, our government agencies, our Malay Muslim organizations, Indian Muslim organizations, volunteers, and many others who give of themselves generously every day. Because of them, no member of our community should ever have to walk alone. By moving forward together with one heart, we can achieve our vision to help every member of our community thrive. We'll do so through three key pillars. First, we will uplift individuals across all life stages to provide them with opportunities to succeed. Second, we will develop trusted religious institutions to enrich our community religious life. Third, we will nurture a vibrant cultural sector that celebrates our unique Singaporean Malay arts, culture, and identity. First, we want to uplift individuals and provide them with opportunities to excel at every life stage. Some are already doing well, and with the right inspiration, they can reach even greater heights. Others may need an extra helping hand to succeed. As Ms. Nadia Ahmad Samdin mentioned, strong families are key to this, as they are the bedrock of our community and society. They nurture values like responsibility and empathy, shape our identity as a person, and build our confidence to navigate life challenges. Strong families begin with stable marriages, which is why the Bersamamu program has been so vital to our Muslim community. Since its launch in 2019, Bersamamu has supported over 36,000 couples, providing access to marriage support and guidance from our Qadi and Naib Qadi. They serve as trusted advisors throughout the couple's early marriage years. An example, Mr. Razi Barian Arlandito and Ms. Visa Shigemi, a Singaporean-Japanese couple, have benefited greatly from Bersamamu. Their Naib Qadi, Ustad Muhammad Nazim bin Rahumadullah, provided invaluable advice to help them navigate cultural differences, religious practices, and family dynamics. As a mentor to the couple, Ustad Nazim provided spiritual guidance and connected them with like-minded couples facing similar situations. To help more couples like Mr. Razi and Ms. Visa, we will be expanding the Bersamamu program to further strengthen marriage support for Muslim couples. We will increase the pool of Qadi and Naib Qadi by about 50% to better support newlywed Muslim couples, especially those who need more assistance. These couples can benefit from additional post-solemnization face-to-face sessions to ensure they get a stronger start in their marriage journey. We will also make it easier for the community to access marriage support services by deploying family development officers to selected mosques around Singapore. These officers will guide couples through the various national and community programs that best address their needs, including those with dual caregiving responsibilities. Taken together, couples can get more help and targeted follow-up for those in high-risk marriages, so that issues are addressed early before they escalate into crisis. We will also expand the Bersamamu program to include parenthood support for more seamless assistance from marriage to parenthood. Under the pilot run of Project Arif, mothers receive integrated support from the Qadi and Naib Qadi, as well as the medical social workers and healthcare professionals from KK Women's and Children's Hospital. This includes those who do not qualify for Kids Start, so that they continue to receive the necessary support. Some 5,000 couples have benefited from the pilot and demonstrated improved maternal and child health outcomes in terms of babies completing mandatory immunization and being breastfed for at least 3 months. Starting from June 2026, we will include Project Arif as a permanent component under the Bersamamu program. From marriage guidance to parenting support, we are broadening the continuum of care to foster more resilient families and give our children the best head start in life. Mr. Chairman, we want to provide every child the necessary support and pathways to enable them to seize opportunities for success, regardless of their background. Our community has made significant strides in educational achievements, and investment in education remains a key focus. But I agree with Mr. Azhar Osman that we can do more to help every child reach their fullest potential in other areas too. That is why Mendaki's 2030 work plan, which I recently launched with SMS Zaki Muhammad, goes beyond nurturing confident learners and includes building stronger families, supporting a future-ready workforce, and growing a thriving community. We recognize that excellence begins early and at home, which is why Mendaki has strengthened its suite of programs to support the parenting journey. From April this year, parents can look forward to Ready, Set, Learn RSL roadshows held in the heartlands, providing convenient access to workshops and resources on supporting their children's holistic growth. A key component of this support is RSL Math Explorer, formerly Class Mathematica, which prepares parents to guide their preschoolers in numeracy skills and prepare for math in primary 1. The result speaks for themselves. 9 in 10 participating preschoolers of this program entered Primary 1 without requiring learning support for maths. Mendaki will expand the efforts and roll out RSL Language Explorer, a reading program designed to equip parents to nurture early literacy in both English and Malay. Together, this program will build confidence and strengthen learning, laying the foundation for long-term academic success. Mr. Chairman, for children from families facing greater challenges, attending school regularly can be difficult for various reasons, such as when parents work shifts or when they must care for younger siblings at home. These last-mile gaps prevent them from participating fully in their education, and in turn may affect their holistic development. We are determined to close these gaps by providing the customized support that these children and their families need. So I'm glad that Mendaki and MOE, with the support of MSF and MCCY, have embarked on a pilot program at selected schools at Tampines to strengthen the after-school care and support for our children from Malay Muslim families who need additional help. For some families and their children, the help needed could be to provide them better nutrition, a study desk at home, or alternative childcare arrangements. For others, it could be connecting them to a trusted mentor who can address motivational issues. So under this pilot, a Mendaki care advisor will work with each identified child's family, school, or other social service professionals to understand their unique needs and develop an individualized care plan for the child. The partnership between the school and community will provide academic and non-academic support to complement existing school efforts. This pilot has been launched earlier this year, and I want to thank the participating schools and Mendaki who have worked tirelessly to make this partnership possible, and grassroots advisors, Dr. Charlene Chen and Acting Minister David Nyo, for suggesting this approach to address the needs of students in Tampines who need that additional help. Together, we ensure that no child gets left behind because of circumstances. Mr. Saktandi's part asked how Malay Muslim educational initiatives are evolving to prepare our youth for an artificial intelligence AI-driven economy, while Mr. Sharil Taha asked how Mendaki can better prepare our children and youth for the future through mentorship and awareness of pathways. Mr. Chairman, Mendaki's tuition program has helped many students improve in their academic journey, but we cannot rely on tuition alone to prepare our students for the future. This is why Mendaki has enhanced the program to the Mendaki Achievement Program, or MAP, with two new focus areas. The first is enrichment, where students will have opportunities to be exposed to programs in areas such as AI exploration and robotics. The second area is engagement, where students will be exposed to various education and career pathways. Today, Mendaki's Youth Mentoring Office has helped to match mentors to more than 2,500 youths from secondary 3 to up to undergraduates. Mendaki will be expanding its mentoring program to start earlier from secondary 1 students. This will enable more students and parents to be connected to support systems such as Mendaki's professional networks to help them make more informed education and career choices. Dr. Wan Rizal asked how we can support our youth in job transition. We will create more platforms for our youth to connect and learn from professionals who have succeeded in their chosen fields as they prepare to enter the workforce. Mendaki has recently signed an MOU with NTUC E2I to strengthen AI readiness through targeted workshops and community engagement initiatives. It also seeks to expand access to career advisory services, skills development pathways, and employment opportunities. These efforts will put our youth on a better footing to make informed decisions about their career pathways and seize opportunities in growth areas. Last October, we launched the Malay Muslim Youth Task Force, led by MOS Rahayu and SPS Dr. Syed Harun, to hear from our youth their views on career development, identity and values, and how they could contribute to society. Through this task force, we hope to keep our policies relevant and our youth invested in Singapore's future. The task force has seen appointed 13 youth consultants who are leaders from diverse fields, including entrepreneurship, sports, digital media, technology, religion, and the social sector. They have lined up a series of youth conversations in partnership with M-Cube agencies and the National Youth Council, which will capture the perspectives of youths on various issues closer to their hearts and co-create initiatives in support of the National SG Youth Plan. I look forward to hearing their views on bringing the community forward at the upcoming M-Cube Youth Festival in August. I've spoken in detail about our youths, but we must also remember our seniors, who have given so much of themselves to build a better future for us. Both Mr. Saktiandi Spaat and Mr. Sharif Taha have asked about how we intend to strengthen holistic support for seniors in our community. I share their concern. We must ensure our seniors continue to thrive.
Kita mesti memastikan warga tua kita tetap dapat hidup cergas dalam tahun-tahun warga emas mereka. Warga tua Melayu Islam kita dah mengatakan mereka berada dalam keadaan sihat, tapi mahukan lebih mempunyai hubungan dan hidup bermakna dengan orang lain. Penuaan yang sihat itu adalah berkenaan tentang hidup bersama dengan bermaruah dan mempunyai satu tujuan dalam keadaan sihat. Jadi saya suka cerita yang Masjid Mutakin dengan kerjasama MAIN dan Pusat Penuaan Aktif Muhammadiyah telah memulakan santunan emas, satu usaha dari bawah untuk memberikan peluang kepada warga tua kita dan penjaga mereka dalam pengalaman bimbingan agama, aktiviti sosial dan kesihatan. Program ini telah dilanjutkan ke masjid yang lain seperti Masjid Darul Makmur dan Yusof Ishak, melibatkan 900 warga tua setiap minggu. Masjid-masjid ini juga bekerjasama dengan rakan-rakan seperti Agensi Penjagaan Bersepadu dan Kumpulan Kesihatan National Health Group dan Majlis Hospice untuk mendekati warga tua di rumah-rumah rawatan. Saya baru-baru ini menghadiri satu jerayawara santunan emas di Masjid Darul Ghufran dan
System of care affirm the need for a targeted program for Malay Muslim seniors that is developed by the community and for the community. I have therefore asked the Islamic Religious Council of Singapore, MUIS, and People's Association, PA, to support Santunan Emas efforts and to help rally resources and agencies across health, social, financial, and religious domains. For example, MUIS will work with Santunan Emas networks at local mosques to identify needs and facilitate partnership with other community organizations, as well as with healthcare providers to enhance healthcare. PA, with its grassroots network, can also rally fellow seniors to serve as befrienders, mentors, and active members of the community. This way, we strengthen not only our services, but also the culture of care and dignity for our seniors. Mr. Chairman, let me turn to our businesses and workers now. The Prime Minister has outlined comprehensive support measures for businesses in recognition of the challenging economic climate, including a corporate tax rebate. The budget also provides a booster shot for our businesses and workers to transform for the longer term, including to expand to new markets, to reskill and upskill, and to adopt new technologies like AI. Lower wage workers in particular will benefit from the enhancements to the progressive wage credit and workfare skills support schemes, while workers making a career transition will benefit from the expanded Skill Future Level Up program. I encourage our Malay Muslim enterprises and workers to make good use of these schemes. Mr. Sharif Taha asked how Malay Muslim businesses can participate meaningfully in the digital and AI economy. the government has announced that it intends to harness AI as a strategic advantage. The Champions of AI program, enhancement to Enterprise Innovation Scheme, and expansion of the Productivity Solutions Grant will be implemented to help businesses confidently transform and grow using the AI. The pursuit of AI must translate into better outcomes, such as stronger livelihoods and more opportunities, so that our community can progress with confidence in this AI economy. That is why we must make upskilling practical and accessible. As MOS Rahayu shared at MDDI's Committee of Supply debate, workers can upskill through Langkah Digital, an M-Cube initiative spearheaded by Mendaki to strengthen AI and digital literacy amongst our community. This will be done through practical workshops and events to help the community understand how best to make use of AI. This will complement national measures announced by PM, including the 6 months of free access to premium versions of AI tools to help our community move from learning to applying AI and benefiting from it in their jobs. Mr. Chairman, the efforts I have shared reflect our unwavering commitment to uplifting every member of our community. In doing so, we hope that they are able to contribute back to strengthen the entire community. Sir, our mosques are at the heart of our community religious life. They are not just places of worship, but community hubs that foster spiritual growth and promote wellness, where faith comes alive through collective prayers, learning, and service to others. To stay relevant, our mosques must remain forward-looking and be able to adapt to the evolving needs of our community. Mr. Fadli Fauzi asked how we plan for the development and closure of mosques. As I've shared in this House, MUIS takes into consideration key factors that contribute to the demand for prayer spaces, such as projected population changes, as well as land development plans, including the building of new housing estates. Mosque heritage is important to us. Where mosque has heritage value, MUIS will work closely with mosque leaders and agencies to preserve this, including in situations where relocation is necessary. We are committed to ensuring that our community's religious needs are sufficiently met as Singapore continues to grow. Beyond infrastructure, our mosques provide various programs that encourage community building. I agree with Ms. Mariam Jaafar that our mosques can play a larger role in partnering youths to improve their well-being. Initiatives like the Next Gen SG Mosque Youth Symposium and Mosque Dialogue with Mufti allow our youths to engage our religious leadership on contemporary issues, explore specific concerns of the young, and develop ideas to address real issues grounded in faith. Our pastoral care programs also provide spiritual guidance and support to those facing life difficulties. So this also includes activities together. It's not only about dialogues. The leaders, mosque leaders, as well as the youth go out and spend time, and that's where they learn from one another. We will look into the useful suggestions that Ms. Mariam have raised earlier. Our asatiza help the community navigate modern issues, such as social challenges, technological advancements, and geopolitical conflicts. Being an asatiza today requires not just deep religious knowledge, but the ability to connect with people and bridge different communities with wisdom and compassion. It is crucial that our asatiza embody these values, engage with empathy, and develop relevant skills to be effective guides to the community in today's complex global landscape. Mr. Chairman, this is precisely why we must continue developing our religious leadership. And one of our most significant investments in this area is the Singapore College of Islamic Studies, SCIS. Dr. Syed Harun asked how we will ensure that SCIS programs will maintain high standards of Islamic scholarship while still meeting the needs of the local Muslim community. SCIS will be led by our Mufti and supported by distinguished scholars. The curriculum will be interdisciplinary, incorporating social sciences modules to give our future Asatiza well-rounded perspectives and boost their employability in the religious and adjacent sector. We are making good progress. SCIS remains on track to open in 2028. We have signed an MOU with the Singapore University of Social Sciences, and we are finalizing other partnerships with institutions in Egypt, Jordan, and Morocco. The SCIS campus development at Rocho is also underway. Mr. Chairman, our mosques, madrasas, and the ICIS are institutions collectively owned by our community. Mr. Abdul Muhaimin Abdul Malik asked for updates on the Wakaf Masyarakat Singapura, or WMS. I'm happy to share that MUIS has held over 20 outreach initiatives together with various partners, reaching out to different segments, including workers, seniors, and the Indian Muslim community. We have also appointed WMS ambassadors to expand our outreach efforts. As of February 2026, the WMS has raised over $8.5 million with contributions from over 15,400 transactions. I strongly encourage those with the means to give back to the community, and this will ensure the financial sustainability of our social and religious needs for generations to come. Only when our religious institutions are strong are we able to nurture an enriching community religious life. Mr. Chairman, our rich Singapore Malay culture and heritage anchor our identity and sense of community and define us as distinctively Singaporean Malay. I've always enjoyed attending our community's cultural events. I had the privilege of experiencing Gentar Rasa SG60 last November. I was struck by the artistic excellence, passion, and dedication of the performers who brought our traditions to life with such authenticity. Our cultural expressions serve as vehicles for storytelling, identity formation, and intergenerational connection, helping our young understand their cultural roots while inspiring them to contribute their own creative voices to our evolving cultural narrative. At the heart of our culture and heritage lies the Malay Heritage Centre, MHC, in Kampong Glam. Dr. Syed Harun asked for an update on MHC reopening. The MHC will reopen in April this year with Pesta Pecah Panggung Transcending Boundaries, a festival featuring programs by over 60 partners showcasing the best of Singapore and Nusantara arts, youth talent, and community creativity. I strongly encourage everyone to join these celebrations. The revitalized MHC will have an expanded mission that goes beyond its traditional role as a repository of artifacts and exhibits. It will become a vibrant hub that offers a variety of programs like festivals for children and youth, regular film screenings, and community-driven showcases to take the cultural development and placemaking of Kampong Glam to the next level. Central to this expanded role will be the MHC's function in deepening documentation and research on Malay culture and heritage as a resource for practitioners and the community. The MHC will establish a research unit led by an advisory panel with Dr. Noor Sharil Saad as the chair to build a comprehensive body of knowledge about Singapore Malay heritage. This unit will work with stakeholders to identify areas of focus and support long-term research by academics and community groups. Through this effort, we will ensure our cultural narratives are not just preserved, but actively studied, understood, and shared with future generations. However, research and documentation are not enough. We need living practitioners like Puan Jumaini Arif to keep our traditions alive. Puan Jumaini is a passionate practitioner of traditional storytelling who never fails to dazzle with her craft. She speaks fondly of it and shares her hopes for a new generation to continue the tradition of a Penglipu Laga. In fact, as I was speaking, I could remember how she was doing it when I was engaging her. The MHC has also launched an intangible cultural heritage mentorship program, connecting experienced practitioners with young enthusiasts over a 10-week structured program. This initiative embodies our commitment to ensuring cultural knowledge and skills get passed down seamlessly from one generation to the next, culminating in showcases through MAC where mentees can demonstrate their newly acquired expertise and contribute fresh perspective to age-old traditions. When our culture is alive and vibrant, it not only becomes a source of pride for us, but it enriches the multicultural fabric that makes Singapore special. Mr. Chairman, I have outlined our plans to strengthen our community across the 3 pillars. We will uplift individuals by providing them opportunities to succeed at every stage of their lives. We will enrich our community religious life by developing trusted religious institutions, and we will nurture a vibrant cultural sector that celebrates our unique identity. These goals build on the solid foundation that our community leaders have already established over the years. For instance, MCube brings together Mendaki, MUIS, and PA Mesra to address community issues through focus areas and MCube towns. However, as Dr. Hamid Razak and Ms. Hazlina Hazlim have pointed out, we must broaden our collaborative networks to achieve these goals. We will therefore expand and rebrand MCube to MCube Plus. We want to emphasize greater collaborations between MCube agencies and our community partners as we strategize nationally in each of the focus areas and deliver programs at the MCube at towns level. I hope that MCube Plus will better recognize the specialized knowledge and community links of Malay Muslim organizations, Indian Muslim organizations, informal groups, and individual contributors who are already doing excellent work on the ground. In fact, this is already being done in some areas. For example, MHA and MCube Engagement Coordination Office at PA has been working with Jamia's Darul Islah Halfway House, the Tapis Halfway House, and PPIS Rise Above Halfway House to strengthen the rehabilitation and reintegration efforts. They have facilitated training sessions for over 300 ex-offenders to develop financial and practical skills that will empower them to build sustainable futures for themselves and their families. At the town level, the Association of Muslim Professionals, AMP, has also worked with MQ Woodlands to conduct a micro-business program to equip budding entrepreneurs with knowledge such as financial management, business ideation, and marketing to build sustainable micro-businesses. One of the program participants, Mr. Muhammad Noor Hafiz, was able to transform his seasonal cookie sales into a thriving family business called Chonkri.sg. MMOs, IMOs, and other community partners can tap on a variety of community resources to support these efforts. For instance, in 2025, Mendaki disbursed more than $2 million from the Community Leaders Forum Fund, which Ms. Azlina spoke about. As Dr. Hamid Raza and Ms. Hazlina rightly pointed out, many of our MMOs and IMOs also provide services directly to families. It is important that we facilitate collaboration and improve coordination by bringing together MCube agencies and our community partners to develop better ways of working together. This includes ongoing efforts under Project Dian, where we have reached out to over 900 families as at end 2025. We will launch this exciting next phase in April 2026, beginning with an MQ Plus networking session. Some of the ideas include putting together a directory of services that our MMO and IMO partners offer so that our MQ focus areas leads and MQ at towns can systematically work with this community organization to identify new opportunities and greater synergies for better program delivery and to close last mile gaps. I thank Dr. Hamid and Ms. Hasdina for their suggestions and encourage our MMOs, IMOs, and individuals to step forward and co-create MQ Plus with us. Together with this effort, we will continue to develop the next generation of community leaders through the TUNAS program. TUNAS brings together emerging community leaders to build their capabilities through knowledge exchange and networking, developing common projects and mentorship from senior community leaders. To date, 2 cohorts of leaders have completed the TUNAS program, and we will welcome the 3rd cohort later this year. These TUNAS graduates will help drive MQ Plus forward by connecting partners, identifying opportunities for collaboration, and leading ground efforts so that support reaches those in need more seamlessly. Mr. Chairman, in Malay, please.
Mr. Chairman, my vision for the Malay Muslim community is for us to move forward together with one heart and a shared purpose. With the spirit of moving forward together with one heart, we aim to provide opportunities and support so that every individual can be the best version of themselves at every stage of their lives. We can achieve this vision through 3 key pillars. First, by uplifting the social and economic outcomes of the community. Second, by strengthening religious institutions and cultivating a vibrant religious life. And third, by nurturing Malay arts, culture and heritage. The Bersamamu program has supported over 36,000 couples will be enhanced by increasing the pool of Qadi and Naib Qadi by about 50% and deploying family development officers to selected mosques. In addition, Project Arif will become a permanent program to help couples throughout their journey from marriage to parenthood. In childhood education, the Ready, Set, Learn program will be expanded through road shows held in the heartlands, while the RSL Language Explorer will be launched to complement the RSL Maths Explorer. The Mendaki Achievement Program will provide students with early exposure to artificial intelligence and robotics, while Mendaki's mentoring program will be expanded to include Sec 1 students to support students comprehensively in the education journey. For students who need additional help, I'm pleased that Mendaki and MOE have launched a pilot program in selected schools in Tampines with support from MSF, MCCY, and community partners. We can strengthen after-school care and support, helping students attend school consistently and improve their academic performance. For our seniors, MUIS and PA will support the Santunan Emas program and its holistic approach, which is crucial in an aging society. It will provide religious guidance, social engagement activities, and healthcare support for seniors and their caregivers. This program requires strong partnership from all stakeholders, mosque, community partners, families, and government. Through this collective effort, we can ensure our seniors receive the support they need and live meaningful lives in their golden years. Mosques will continue to play a key role as dynamic community hubs to strengthen community bonds, address social needs, and fulfill an evolving religious life. The Singapore College of Islamic Studies will open in 2028. We have signed an MOU with SUSS to offer an interdisciplinary curriculum for undergraduate programs. We are also finalizing partnerships with Islamic educational institutions in Egypt, Jordan, and Morocco. These efforts aim to produce a pipeline of asatizas who are more competitive and ready to guide the community in addressing complex contemporary issues. The Malay Heritage Centre will reopen in April this year. It will serve as the cultural heartbeat of Singapore's Malay community, bringing together festivals, film screenings, and community-based exhibitions to enliven and enrich Kampung Glam. The centre will shape the future direction of our culture, supported by a research unit with an advisory panel led by Dr. Nur Shahril Saad. The Intangible Cultural Heritage Mentorship Program was launched to connect practitioners with the young generation. This program will run for 10 weeks to ensure our knowledge and traditions continue to be preserved and developed across time. So to expand MCube's impact, we must broaden our collaboration with partners beyond Mendaki, MUIS, and Musra Network. Therefore, I will launch MCube Plus to involve Malay Muslim organizations, Indian Muslim organizations, informal groups and individuals who want to contribute more comprehensively. MCube Plus will strengthen the support provided. Each MCube town and focus area will work closely with Malay, Muslim, and Indian Muslim organizations. Informal groups and individuals who aspire to serve the community, they will explore new opportunities where efforts can be coordinated more effectively. This network will be launched in April 2026, starting with an MCube Plus networking session. Additionally, the TUNAS program will continue developing the next generation of community leaders through knowledge exchange, networking, and mentorship from senior community leaders. MCube Plus reflects the continuity of the spirit of cooperation that has long been our community's strength, based on the principle of moving forward together with one heart. Let us move forward with one heart and strive to be the best version at every stage of our lives. For example, Madam Latifa binti Abdul Rahman first joined the Santunan Mas program as a participant in October 2024 to seek spiritual guidance and social support. Now, she serves as a volunteer coordinator who organizes the Welcome Committee, prepares refreshments, and conducts exercise sessions and craft classes. The knowledge and experience gained motivated her to give back to the community. Madam Latifa's story shows how a program participant can embody the spirit of one heart and subsequently emerge as a contributor who helps the community to progress. This is the transformation we want to see in every member of our community.
I spoke about the recent developments that have unfolded in the Middle East at the beginning of my speech. During times of global uncertainty, it becomes even more important for us to strengthen the bonds that keep us united. External conflicts must never divide us. As Singaporeans, we must stand together, support one another, and maintain the mutual respect and understanding that define our society. I have shared my vision for our community, to cultivate a thriving community where every member can be the best version of themselves. I've outlined how we will achieve this vision through 3 pillars that address every dimension of our community's development. Through these 3 pillars, we ensure that every member of community can build secure and prosperous futures while remaining grounded in the values and rich culture that define us as a community. Throughout this speech, I've shared stories of individuals who embody the spirit of bersatu hati, maju bersama, each serving as sources of inspiration in their own right. Mr. Razi and Ms. Visa show us how strong foundations enable families to thrive. Puan Jumaini demonstrates how dedication to preserving heritage becomes a valuable contribution to future generations. Mr. Muhammad Noor Hafiz exemplifies how entrepreneurial spirit, when supported by the community, transforms aspirations into success and opportunity. Puan Latifah's journey from participant to volunteer coordinator embodies the meaningful cycle of receiving support and giving back that strengthens our community. These individuals illustrate the essence of we first society, where personal development contributes to collective progress and where every act of service creates positive impact throughout our community. This is the spirit we hope to see everyone in our community embody. As we move forward, we will continue strengthening support by building capable, trusted institutions, and more importantly, by engaging one another closely on issues that are close to our hearts. Our true strength lies in our collective spirit, the same spirit that sees neighbors helping neighbors, organizations collaborating across boundaries, and leaders emerging to serve the greater good. We have much to look forward to in our collective future. Let us do so by moving forward together with one heart. Thank you, sir.
Are there any clarifications for the Acting Minister? Ms. Hasina Abdul Halim.
Thank you, Acting Minister. Having shared with us the developments of your engagement with students in Middle East, could you also give us an update as to some early plans the government may be making with regards to planning ahead of the Hajj season? Thank you.
Acting Minister Faisha.
So I thank the member for the SQ. I shared about how we are continuously engaging our students in the Middle East. And in fact, I had a very good session with them last night, more than an hour. And no doubt they are very concerned, but I think they asked many advice on what they should do and the various scenarios. And we just also heard MOS Gan Xiao Hang message earlier. And the message that I shared with them was to continue to keep up, to be connected, and also we look after one another. And this is something that they have been getting closely. And MUIS have been working very closely with them, and quite a number of them also experienced incidents in June. So for the seniors, they are able to handle and manage this better than the juniors. And quite a number also shared about how they can continue attending classes also. So you see a different type of steps being taken by the different countries. Some are doing it online. Others still have face-to-face classes. And one thing that I also shared with them is also keep in touch with their families. As expected, many of their family members are very concerned. And I, in fact, asked them to up more updates. Right? For many, they updated their families once a day. I say maybe up to 2 times, right? So that family parents can be assured of it. And for Umrah, as I said, we are in touch with AMTAS, and AMTAS released an advisory where it concurred with MFA advisory. And for those who are already in Saudi Arabia, I urge them to register with MFA so that they can receive timely updates as the situation develops. And for others who wish to make changes to their travel plans, I'd like to thank AMTAS, who have been reaching out to their travel agents to exercise understanding and to see how it can help to travelers to review, postpone, or make travel arrangement for affected travel plans. For Hajj, as said to date, we are in close contact with Saudi Arabia's Ministry of Hajj and Umrah, MUHU. To date, all preparation for Hajj 2026 season continue uninterrupted. So we will closely monitor the latest developments. Above all, the safety of our pilgrims remain our utmost priority.
Dr. Said Harun.
Chairman, I thank the Acting Minister for sharing about the revamped Malay Heritage Centre as well as the setting up of the research unit. In some ways, we're looking back towards wanting to preserve the heritage and traditions of the Malay community, but I wonder whether there are initiatives to be able to celebrate and also share and showcase our unique Malay identity towards others so that we can celebrate the diversity that we have here in Singapore. Thank you.
Acting Minister Faisal.
Sir, I thank the member for the SQ. You can see the expanded role of the MHC. It goes beyond just cultural preservation. It will showcase how Singaporean Malay identity has evolved into something truly distinctive. Right, so, and it comes along with a deeply rooted Malay identity and traditions perspective, but you have to recognize that our identity is uniquely and precisely been shaped by our multicultural environment. And this is where you see many Malays have excelled across many sectors, right? And they come forward to contribute regardless of race, language, or religion. And all this also being done with deeply rooted to our culture and faith. So this balance is what sets our Singaporean Malay apart from the rest. And if you look at the Intangible Cultural Heritage Mentorship Program, it will help us to continue this journey. We have built this process of building our community and part of nation building over the years, where you can see certain values in the Malay community that exemplify Singapore as a whole as well, in terms of its self-determination, openness, and resilience. And that has enabled the Malay community here to be able to continue to, while keeping to its tradition and identity, able to strive for success and excel in their life. And we are also setting up the research unit, where research unit will look at various aspects of this journey as well, but looking at in terms of the heritage, tradition, the arts and cultural history, and Nusantara, where some of these will present opportunities for people, including non-Malays, to come on board this journey and share the joy of our nation building. So it's something exciting, something that we have built together, and I would like to deepen this journey with fellow community, and also how my hope that anyone who visits MEC or take part in the program will know that this is distinctively unique Singaporean Malay identity that has progressed and something that we should be proud of.
Mr. Saktiandi Supat.
Thank you, Chair. Can I ask my first clarification in Malay, Mr. Chair? Tuan Pengerusi.
Mr. Chairman, to look after the senior is not about the program, but to strengthen responsibility and compassion in our community. So I welcome the holistic approach that Minister said to assist our seniors. I would like to ask if this program is, in terms of budget and resource, can be given for the infrastructure costs in the mosque. This is important because Singapore is fast aging. Secondly, can we take into consideration the caregiver in our community, especially for the sandwich generation?
The Minister mentioned about the Mendaki Achievement Program, the MAP, about helping AI exploration and robotics. I was wondering whether Minister can share a bit more, whether we can increase the budget and resources for Mendaki so that these efforts can be increased, especially when the government in this year's budget is talking about AI missions, AI champions, and whether within the MM community we can actually get extra budget for this cause as well. Thank you.
Minister Faisal.
So I thank the member for the SQ. So relating to the second SQ about some of the enrichment part that we do, and also if you look at the Mendaki 2030 work plan, you will see that there are elements of not only about education, but about how we want to support workers, and also in this journey of AI and preparing our community for the future. And we, as shared, the program spearheaded by MOS Rahayu, Langkah Digital. So this is another area where it gives us another opportunity to really expand our outreach in a way that can help the community. And I also am very heartened that not only the programs done by Mendaki are reaching out to the people, but the professional networks that we have developed over the years have really, really grown significantly. Few of us, or maybe all of us, may have attended some of the programs of the professional network. I was very heartened. I attended one on the aviation sector, and professionals, in the past they were not there to be part of the engagement. Today they are there, and they provide that additional impetus, support, and this also goes beyond funding. I think in the way we develop our community, we have to bring in as much resources out there, especially those who have done well, to come back, give back, and mentor and nurture and provide the impetus for each and every one of our children, even those who are still working, to have that aspiration to develop further. On the second point, program Santunan Emas ni adalah satu program.
This program, Santunan Emas, is a ground-up program, and it is also holistic. But what is important on this program is how it cooperate with bodies and agencies such as AIC and HG. And when I heard on these programs, and I get the feedback that it is very interesting, and it touched my heart, the heart of the elderly. They told me that they want to hear the motivation, what Ustaz Patri said. And I think this is an important aspect. And when I explore further, I found that this program, not only in terms of religious aspect, but it also gives guidance in the life, such as looking after the health, and also for the caregivers, the family members, and also in terms of how we can, what activities we can do. And I see it as a portal which is good for us to increase our approach. As I have said, I have told Muiz and Mesra to see how we can support this effort so that we can reach more in our community so that they can age gracefully in a calm way. And I agree with what has been said by Mr. Satyandi, and we will widen this approach. And I am very grateful to all those who have initiated this program, because they started small and they do not know what is the potential. But when we see that it touches the heart, and to give development, to help the elderly, and I also hear from my own wife on this program, and she told me that her friends like to attend it, and they also get the support from the community. And I also hear, and I was also at the mosque, and I have seen a very good impact on it. So we will work hard to look after our elderly.
For clarification, if I may seek the indulgence of members, what I propose to do, because there's almost 6 other hands who wants to ask questions. My suggestion is that we defer this because I'm worried that if we don't, the rest of the MCCY cuts and the clarification may all be taken up. We will sacrifice break for today as well. I'll save 20 minutes. So all these clarifications, let's push it right to the back. At the end of the rest of the cuts, if I have the, I will ask members and Minister for your indulgence on this. Mr. Mark Lee.
Chairman, when we speak about social cohesion today, the deeper question is not just how well we get along, but how confident Singaporeans feel about who we are becoming. Singapore is undergoing 2 shifts. Externally, the world is becoming more uncertain, contested, and polarized. Internally, Singaporeans, especially younger Singaporeans, are thinking more actively about identity, voice, fairness, and belonging. Together, these shifts mean that social cohesion today is no longer just about coexistence, but about whether people feel anchored in a shared sense of who we are. In this context, I welcome MCCY's clear decision to position multiculturalism as an anchor of our Singapore identity. It recognizes that Singapore has always been open and evolving, and that with a strong sense of self, we can remain open without insecurity. But if multiculturalism is our anchor, then the key question is how Singaporeans experience and live that anchor in everyday terms. What does it mean today to be a Singaporean Chinese, a Singaporean Malay, a Singaporean Indian, Eurasian, not as fixed categories from the past, but as identities shaped by shared experiences, common values, and participation in modern Singapore? How do our arts, sports, heritage spaces, and youth platforms help people internalize this, rather than just leaving identity to be shaped implicitly by fragmented or external narratives? This matters where identity is under-articulated or not felt. It creates space for pessimism and quiet social distancing, even if surface harmony remains. As such, beyond delivering strong individual initiatives, how is the ministry intentionally shaping a coherent narrative of what defines us as Singaporeans today, one that builds confidence in our multicultural identity and a shared sense of belonging, especially amongst younger Singaporeans? And how does the ministry assess whether its work is strengthening this deep foundational long-term social cohesion? Thank you.
Ms. Valerie Lee. Oh, sorry, Mr. Alex Yam.
Chairman, beyond competition and medals, school sports builds resilience, teamwork, discipline, and healthy habits for young people. However, many students today find it difficult to join school CCAs unless they already demonstrate a certain level of aptitude. Trials can be highly competitive and places are, of course, limited. As a result, some students who simply wish to try something new or participate recreationally find themselves excluded from school sports altogether. This risks narrowing participation to those who are already skilled, when the developmental nature of sport lies precisely in allowing more young people to experience it. Could MCCY share how it's working with MOE to broaden access to sports in school so that participation serves not only competitive excellence but also serves for youth development? For example, are there plans to expand recreational tiers, modular programs, or learn-to-play pathways where students can pick up a sport without needing to pass a competitive trial? Such pathways could allow students to discover interests and develop confidence before deciding whether they wish to pursue a sport more seriously. Sports also provides one of the most natural spaces for young Singaporeans of different abilities and backgrounds to interact. When students train and play together, they learn cooperation, perseverance, and mutual respect. In building a we-first society, such shared experiences matter. School sports should remain both a pathway for excellence and a platform for broad participation. I would therefore appreciate if the Minister could share how policy can better balance these objectives while ensuring that students' well-being and academic balance are safeguarded.
Ms. Valoridi.
Chairman, sports and outdoor education play a formative role in shaping the resilience, confidence, and sense of belonging for our youth. I have previously declared that I was in the National Youth Bowling team, but beyond that chapter, my journey in sports begins simply, playing basketball at a CC with my father and at school during recess with friends. It progressed to competing in bowling, javelin, and shot put in school, and having my Alex Honnold moments on the rock climbing walls as a young adult when I started working. What stayed with me was not achievement or the medals, but the lessons in discipline, teamwork, and perseverance. For many youth, sports provide a constructive third space where they build identity, friendships, and resilience. Studies have also found that youths who participated regularly in sports report significantly higher life satisfaction and lower stress levels than their less active peers. In this house, we often focus on the Olympics, major games, and elite performance. These are important, and we should continue supporting high-performance athletes. But if our focus is too narrow, we risk overlooking the broader base where many youths are meaningfully engaged. My sense is that the number of athletes represented by NSAs which does not qualify for the Olympics greatly outnumber those in the few sports we often highlight. Many sports such as chukball, roller sports, dragon boat, and others are sustained by passionate communities, many of whom are youth. These platforms may not carry Olympic status, but they play an important developmental role. I would like to ask, how does the ministry intend to support such sports that house and nurture large numbers of young people? Could we consider a modest seed fund to help smaller NSAs build capabilities? Could the government play a bigger role in facilitating greater after-hours access to facilities, such as schools, as training grounds? If we truly believe sport is for youth development, then breadth of opportunity must matter as much as podium outcomes. If sports shape youths in familiar community spaces, outdoor education shapes them in unfamiliar terrain. I'm a grateful beneficiary of the Outward Bound School, having attended the 5-day OBS course in Secondary 3 and later returning for longer programs on the Ubin campus and the final one in the mountains of Korea. These experiences challenged me physically and mentally and strengthened my appreciation for teamwork and nature, lessons I carried on into adulthood. I'm heartened that the government is extending OBS to every Secondary 3 student. But as this expansion progresses, may I ask, what is the next milestone for OBS Singapore? As we strengthen local access, could we also consider extending more overseas OBS experiences in a calibrated way? Exposure to different terrains and cultures stretches youth in ways sometimes our domestic environments cannot. While OBS remains a national cornerstone, continued support for other outdoor education providers, working with parties like the Outdoor Adventure Education Council, would strengthen the broader ecosystem and widen access for youth with different interests and needs. Chairman, sports shape resilience in our young people. Outdoor education builds rugged confidence and character. By broadening support for participation in diverse sports and deepening the next phase of our outdoor education, we invest not just in programs or facilities, but in Singapore's future.
Ms. Goh Zi Ki.
Mr. Chairman, I'm sure every member of this House is aware of the issues arising from the increasing popularity of pickleball in our neighborhoods. But this growth comes with much friction. I received some very angry complaints from both players and residents right after I became an MP. It is, let's face it, a very noisy game. Different wards dealt with it differently. Some restricted playing hours, others banned it entirely. But the tensions are not limited to our HDB neighborhoods too. I've had complaints about pickleball noise from the grounds of a private club. For my ward, I've been pushing for what I call an 80% solution. I met a Mountbatten resident, Ms. Pauline Tan, at a house visit, and she happens to be a competitive pickleball player. She showed me a set of pickleballs made of foam. She is a very considerate neighbor and had started using them because they reduce noise levels considerably. The difference at our neighborhood courts were dramatic. We organized a pilot community event to roll these out more widely. We gave out free foam balls to many players, and we organized a stealth mode silent pickleball using these foam balls. But it is only an 80% solution because it is, of course, impossible to please everyone. Some players resisted the foam balls because they felt different and were not competition ready. They were happy to take the free foam balls. They just will not use them, which is really ironic because our neighborhood courts are not competition compliant either. Some residents, on the other hand, feel that this does not go far enough and would prefer pickleball to be banned entirely. In political science, there is the concept of positive and negative rights. Our pickle over pickleball can be a classic case study of tensions between both. The right to play clashing with the right to peace and quiet. Political scientists will tell you that this is a zero-sum game. In a dense city like ours, neither right can be absolute. We must approach it from a framework of compromise and give and take. That is the only way to preserve harmony in our society. Participation in community sports is growing, and demand for neighborhood and precinct-level facilities is rising. We should welcome this, but yet, as we have seen, it can also easily become a source of discord instead of bonding in our communities. So, this cannot be just about trying to meet the demand. It would be very easy to turn many underutilized spaces in our neighborhoods into more pickleball courts, or other sports courts for that matter. But the most convenient place may not be the best place, or even the right place. Would noise and human traffic be an issue? Would it disturb the residents in the neighborhood? Can the noise be contained at the location chosen? We should learn the lessons, and we can preempt much of these tensions. The last thing that we want to do is to create more tensions and unhappiness in our communities. In this context, I would appreciate it if MCCY could provide an update on the rollout of new sports facilities in our neighborhoods. And are we planning ahead to meet, and how are we planning ahead to meet this increasing demand at community level? Is MCCY addressing facilities demand in a way that anticipates and addresses such friction? Thank you.
Associate Professor James Lim.
Pickleball has taken Singapore by storm. The sport now boasts at least 5,000 serious players and many more casual ones. It is likely to become even more popular. While many enjoy the physical and social benefits of play, complaints abound. Some grouse about the limited availability of shared courts, while others object to the noise. In response to the hundreds of noise complaints received, some town councils have chosen to restrict playing time or to ban play altogether. Yet, as many have faced intense lobbying efforts calling for expanded hours, competing interests make this MP feel knocked around, much like a pickleball. I propose that we allow the conversion of underutilized second to top floors of multi-story car parks into pickleball courts. There's generally sufficient space for the game, and the ceiling will limit upward noise transmission. To further contain noise, retractable sound curtains can be easily installed along the perimeter. There's some precedence for the conversion of existing infrastructure into pickleball courts. Indoor badminton courts at community clubs have pickleball lines drawn to permit dual use. And sections of the Little India bus terminal are to be retrofitted to accommodate 8 pickleball courts. One objection is that there is an opportunity cost to foregone income, since such lots could generate potential revenue. This has sometimes been MND's response to requests for converting car park spaces to other uses, such as community gardens. But in many newer estates, especially Sengkang, these lots are chronically underutilized and almost always empty. The opportunity cost of foregone income is almost entirely imaginary. Moreover, even if guest parking needs are elevated in certain periods, such as during holidays where visitations are more common, swing barricades can easily be installed and opened to allow access on such occasions. Another objection to safety is that safety might be compromised when car parks are used beyond their designated purpose. Indeed, when Sengkang Town Council proposed this idea to MND, the response begged the question. The playing of pickleball and any other recreational activities are not an approved use of the HDB car park currently, as HDB MSCPs were designed and built primarily for parking only, end quote. But MSCPs are already used for other functions. Temporary office space, such as HDB site offices, is sometimes located on the upper floors. There is also the Courier Hub scheme that is applicable in select MSCPs. In response to a PQ I asked in 2021, then MND Minister Desmond Lee stated that HDB is, in principle, open to alternative uses of MSCPs for social communal facilities. Now, a third objection is that regulation pickleball courts often call for 5-meter height minimum. But there are many MSCPs, including those in Sengkang, that fulfill this requirement. And while the 5-meter clearance is preferable for professional courts, casual players may well be content with less. Hence, while not currently approved, there are good reasons why we can have pickleball courts in the MSCP. Let's get this done for the sake of players and non-players, and perhaps long-suffering MPs.
Mr. Andre Loh.
Chairman, to go for a run, all you need is a pair of shoes. You step outside and go. There's no membership, no queue, no need to travel to a gym. Strength training has no equivalent, and I want to make the case today that it should. The science is clear. Strength training is not just for the muscle-bound bodybuilder, it is for everyone. Bone density peaks around age 30 and declines steadily thereafter. Aerobic exercise slows the decline, but strength training has the potential to reverse it, building bone, building muscle, and reducing the risk of falls and fractures in ways that cardio alone cannot. The World Health Organization recommends 2 full-body strength sessions per week for all adults. I think most Singaporeans are not meeting that target. I will speak personally. Before my daughter was born 6 months ago, I went to the gym 2 or 3 times a week. Since she arrived, I have gone fewer than 10 times in total. Not because I do not want to go, but because 15 minutes traveling there and then 15 minutes back is 30 minutes that a young father cannot find.
If there were a resistance station at Moyne Void Deck, I would use it every other day. I am sure of this. And I am not alone. The elderly resident maintaining muscle and bone density, the beginner who would not know where to start in a commercial gym, the time-pressed parent. The barrier looks different for each, but it is the same barrier. Active SG gyms deserve credit. They're affordable, well-distributed, well-equipped, but they require a trip. You need to check if the capacity is full, and often at peak hours, you need to queue for equipment. And for many who have never set foot in a gym, the sign-up and the unfamiliar environment are barriers they never overcome. Our fitness corners could bridge that gap. There are over 3,400 of them, free and accessible across our estates and parks. Many already include strength-oriented equipment, but effective strength training requires progressive overload, the ability to increase resistance as you get stronger. The beginner starts at 5 kg and then moves up to 20, 30, 40 over time. Variable resistance machines make that possible, but our fitness corners today largely do not possess them. Instead, they largely feature equipment that focuses on encouraging mobility and fixed resistance machines. In their current guise, they serve a limited demographic. We should increase their utility. And therefore, I have 3 suggestions for the ministry. Firstly, lead by example. Sport SG already directly manages 10 sport in precinct facilities with more to come. You can upgrade these first, and for upcoming planned builds, incorporate variable resistance equipment from day one. 2, we should work with NParks to incorporate variable resistance equipment into park fitness corners as they come up for renewal or upgrading. And lastly, for HDB fitness corners under Town Council management, we should develop a national framework with pre-qualified standards, recommended suppliers, and co-funding pathways through Sport SG, so as town councils can upgrade without running full procurement exercises. Chairman, aerobic fitness is inherently accessible. Let's make strength training so too.
Mr. Alex Yam.
Chairman, at last year's Committee of Supply, the Ministry announced an important restructuring of our high-performance sports ecosystem. This included the consolidation of the National Youth Sports Institute and the Singapore Sports Institute and the Singapore Sports School into the High Performance Sports Institute. The Ministry also alluded to the eventual consolidation of the HPSI and the Sports School. This is a significant structural shift. For many years, Singapore's sports landscape has involved multiple institutions working across different stages of the athlete's journey, from youth identification to elite performance. The intent behind this consolidation is therefore an important one, to create a more integrated system that supports athletes more effectively throughout their development. Could the Minister provide an update on the progress of this consolidation? In particular, how will the new structure strengthen athlete development pathways, ensure smoother transitions from youth potential to elite performance, and how will the system better coordinate coaching, sports science, athlete management, so that promising young athletes receive consistent support as they progress? At the same time, I seek to ask how the Ministry will ensure that sporting excellence is balanced with education and well-being, because many of our young athletes must juggle training commitments with academic responsibilities. Finally, from the perspective of athletes, coaches, parents, what improvements have been observed so far? How will MCCY and Sports SG ensure that this integration reduces fragmentation across the various agencies and ultimately leads to stronger long-term outcomes for Team Singapore? I would therefore appreciate the Minister's update on how this new structure is taking shape.
Mr. Jackson Lam.
Mr. Chairman, I declare my interest as a Vice President of a National Sports Association. Sports play an important role in national identity, community health, and youth development. Singapore has enjoyed notable successes on the international stage, and grassroots sports participation has grown. But if you look more closely at the institutional backbone of our sporting ecosystem, the National Sports Association, the NSAs, there are structural pressures that deserve attention. Recent public reporting has shown that private sponsorship for sports remain limited. In 2023, sports donation amounted to about 30 million, representing less than 1% of the total charitable donation in Singapore. Many NSAs and athletes have acknowledged the difficulty of securing sustained corporate backing. This means that associations remain heavily reliant on government subvention and short-term grants. While NSAs are mainly run by volunteers, MCCY shared in Parliament that Sport Singapore and the Singapore National Olympic Council are working to strengthen their governance and operational capabilities. This is an important recognition. But it also underscores the reality that many associations operate with lean secretariats and limited professional debt. Furthermore, Sports SG funding is tied to governance and strategic planning requirements. Currently, funding is provided to 45 out of 63 eligible NSAs, subject to meeting capability criteria. While this promotes accountability, it also means that associations with weaker institutional capacity may struggle to secure stable, multi-year support, reinforcing a cycle of fragility. Against this backdrop, feedback from athletes and NSA leaders continue to highlight structural constraints. Difficulty retaining coaching talent due to funding uncertainty. Challenges in building robust athlete development pathways beyond the elite tier. Limited resources for sports science, injury prevention, and sustained grassroots outreach. If we expect NSAs to widen participation, strengthen safeguarding standards, develop youth pipelines, and support high-performance ambitions, then episodic program-based grants may not be sufficient. I therefore ask the Minister, has MCCY conducted the recent capacity assessment of NSAs to understand where structural gaps, not just financial shortfalls, are impeding long-term development? Beyond periodic funding grants, will MCCY explore multi-year core funding frameworks or partnership models that build organizational stability for NSAs? As Singapore faces an aging population and persistent fiscal inactivity challenges, what additional structural support will be provided to NSAs to expand community engagement and broaden participation safely and sustainably? If sport is to remain a pillar of national well-being and identity, then our NSAs must be equipped not only with passion, but with stability, professionalism, and long-term resilience. Thank you.
Associate Professor Kenneth Goh.
Thank you, Chair. In this changed world, in this changed, turbulent world, we must invest just as deliberately in the arts, sports, and the cultural ecosystems, because these are the human and societal foundations that shape who we are as Singaporeans. In an AI-led world, creative work, sport, and cultures will not disappear. They will be even more valuable as distinctly human pursuits. Allow me to make 4 points in my cut. First, on the sustainability of our arts and sports practitioners. In both sectors, talent alone is not enough for excellence. Practitioners must be financially secure. Many artists and athletes face income uncertainty. Career spans can be short, income streams uneven, with the burden of support often falling on their families. In the arts, many operate as freelancers or pursue portfolio careers. But to sustain their work at a high level, practitioners must be equipped as professionals able to protect and sustain their work. For self-employed artists, could MCCY consider strengthening advisory and support platforms to better equip them in navigating contract negotiations and protecting their IP and rights, areas where freelancers can otherwise be vulnerable? For our athletes, given the finite duration of sporting careers, MCCY has already put in place schemes such as SPECS Business and SPECS Education to support dual career pathways. But could the ministry consider further strengthening these efforts with more structured support for career transitions? This could include providing modules in areas such as sponsorship management, personal brand development, and entrepreneurship, so that our national athletes are better equipped to support themselves beyond their competitive years. Financial viability also matters in heritage cultural enterprises. As long-standing businesses close, could MCCY consider establishing a targeted succession support initiative, providing advisory support, mentorship, and transition planning to help heritage cultural enterprises pass sustainably to the next generation? So we have spoken a lot about cost of living in this chamber during this debate. Let's ensure that rising cost of living does not hinder Singaporeans from pursuing their talents in these domains. Second, on the participation in the arts and sports. A vibrant arts and sporting culture also depends on broad participation. A broad base helps to strengthen the talent pipeline. I'm encouraged by arts programs in community spaces and the showcasing of our national athletes in our neighborhoods. These initiatives embed culture and sport in everyday life. The SG Culture Pass was introduced in Budget 2025 to encourage greater participation in the arts. I would welcome updates by the Ministry on utilization, whether it is reaching new audiences and increasing regular engagement. Similarly, could the Ministry consider piloting a participation-based mechanism, such as an SG Sport Pass, where funding is directed specifically towards programs delivered by accredited coaches? Not only would this broaden access to structured sports participation, it will also incentivize coach certification and upskilling, and strengthen the livelihoods of our coaches, many of whom operate as small businesses and enterprises. My third point is on enhancing ecosystem financing. In 2024, sports and the arts received just 3.9% of total charitable giving, suggesting that there's considerable room to crowd in sustained private support, a point that Member Jackson Lam also highlighted. I welcome the extension of the 250% tax deduction for qualifying donations to IPCs till December 2029 announced in PM's budget. But we can do more to crowd in and catalyze sustained giving in the arts and sports by corporations and private donors. To do so, can the government consider extending enhanced tax deductions of up to 400% tied to long-term support for these sectors, given their importance to national resilience and unity? A structure that supports multi-year giving pledges with higher deductions will provide planning certainty for arts groups and our sporting organizations. If we are prepared to incentivize investments in technology capability because it strengthens economic competitiveness, we should also be deliberate in incentivizing cultural investments that strengthen social cohesion. My fourth point is on projecting our national identity. Now, the arts and sports do more than bring us together at home. They also project who we are in the world. Just as our athletes proudly fly the Singapore flag at major international games, could MCCY consider developing a strategy for high-potential arts and cultural groups to perform on the world's most prominent stages and international festivals? When our artists and creatives showcase their work on these international platforms, it helps to project confidence in who we are as a nation. If we are proud and confident of our identity, we should also present that identity to the world with equal confidence. Chairman, as we build a future-ready economy, we must also build a future-ready society, one that can help us thrive in these uncertain times. A resilient society invests in its cohesion. The returns may not always appear in economic numbers, but they will be reflected in our pride that we share as a nation. Thank you.
Ms. Joan Pereira.
Last December, the former home of our founding Prime Minister Lee Kuan Yew at 38 Oxley Road was gazetted as a national monument. This January, the government commenced the process to acquire the site. As the government now moves forward to develop the site into a public space, it is important that the process takes into account national heritage needs, exercises sensitivity and respect for the dignity of the site, and also to take into account the concerns and needs of neighbouring residents at every stage of the planning process. After all, for neighbours, they will be the most greatly impacted by this development. The historic significance of 38 Oxley Road is beyond dispute. The Preservation of Sites and Monuments Advisory Board assessed the site to be of strong national significance, having borne witness to pivotal events in the 1950s that marked our country's transition from colonial rule to independence. It was here that our founding leaders held the consequential discussions that led to our governance. On the other hand, let us be mindful that 38 Oxley Road does not exist in isolation. It sits within a quiet, established residential enclave. The daily lives of residents in the vicinity will be directly affected by the transformation of 38 Oxley Road from a private residence into a public heritage space. Since the government announced its intention to gazette the site, residents have come forward to share their concerns with me. First, traffic congestion. Oxley Road is a narrow, two-lane road that already carries heavy vehicular traffic as a thoroughfare between Orchard Road and River Valley Road. Multiple residents have expressed worry that the conversion of the site into a public space could bring significantly more vehicles, tour buses, and pedestrians into an area that, as one resident put it, isn't built for that purpose. Second, illegal parking. Residents have highlighted the long-standing problem of non-residents using their private car parks, given the absence of gantries or security at their entrances. If the site attracts large number of visitors, where will they park? Third, impact of human traffic. Noise, crowds, and the disruption to the tranquil character of the estate. Residents recalled the surge of visitors in 2017 during the public dispute over the site's future and fear a repeat on a far larger and more permanent scale. They understand and can agree that it is important for visitors, including our future generations, to visit and understand the significance of this site, but they also worry that the place will lose its sense of dignity. These are not abstract concerns. They are practical, everyday realities, and they deserve to be treated with the seriousness they merit. Addressing these concerns requires a whole-of-government approach. MCCY, as the lead ministry responsible for the preservation and development of the site, will need to plan and coordinate with the relevant ministries and agencies very carefully. MOT must be engaged on traffic management, parking solutions, and public transport access. Proposals such as designating alternative access points, creating drop-off zones for tour coaches, and improving pedestrian infrastructure along Oxley Road should be seriously studied. MND must address building and estate maintenance issues. The surrounding properties are aging. Residents have expressed hope that the gazetting will bring upgrades to the surrounding estates, including improvements to walkways and infrastructure. There is also the question of whether planning controls and height restrictions in the area may be adjusted, which will affect residents' property rights and interests. MTI must work to minimize disamenities caused by tourism. If the site were to be developed into a heritage park, there must be careful management of visitor flows, operating hours, and commercial activity to ensure that the residential character of the neighborhood is preserved. Property consultants have noted that planners will need to facilitate adequate car and coach parking and drop-off zones. The most important point I wish to make is this: residents must not be informed Residents must not be informed of decisions only after they are made. They must be involved in shaping those decisions from the very beginning. The government should establish structured, regular consultation channels with the residents of the immediate vicinity. These should not be just one-off feedback sessions, but an ongoing dialogue throughout the planning, design, construction, and operational phases of the development. The preservation of 38 Oxley Road as a national monument is a significant step in safeguarding Singapore's founding history for future generations. But a monument that is developed in a neighborhood without mitigation measures risks becoming a source of division rather than unity. Let us build this heritage space the Singapore way, through careful planning, interagency coordination, and most importantly, through genuine partnership with the residents whose lives will be most directly affected.
Mr. Foo Che Siang.
Chairman, Tanjong Pagar, Tiong Bahru is a place where many of Singapore's stories began. Our very first community centre in Tiong Bahru, one of our first residents' committee centres in Tanjong Pagar Plaza. Our beloved Tiong Bahru Market set amidst a beautiful pre-war public housing estate, and over at Tanjong Pagar, shop houses filled with clan associations juxtaposed against one of our very first mixed-use public housing developments, Tanjong Pagar Plaza, juxtaposed against the towering 50-floor pinnacle at Tluxton until it's overtaken by the 60-floor Pearls Hill BTO coming up soon. Chairman, these are not just built infrastructure. They contain stories of our residents who have stayed here for many decades, and they are living repositories of memory, culture, and identity. However, heritage by itself does not sustain itself. If it is to be meaningful, it needs to be refreshed and shared with each new generation. Today, our neighborhood is home to many new families, young residents, and international communities who may not know the stories of the earlier generation staying here. And it has been my mission to refresh our legacies and connect our generations in Tanjong Pagar, Tiong Bahru. And I would like to seek the government's support to support more community-led initiatives that bring together seniors, youth, and new residents together to rediscover these stories through heritage trails, intergenerational storytelling programs, as well as collaborations with schools and civic institutions. Where heritage is lived and shared, it will become a bridge between the past and the present and the future generations. And together we will achieve my vision for Tanjong Pagar, Tiong Bahru to be a living community where every generation finds its place in the Singapore story. Thank you.
Ms. Elisa Chen, kindly deliver your two cards together.
Sir, in today's volatile world, Singapore cannot afford a generation retreating from mutual help. At home, our aging population, complex social needs, and weakening social ties strain both the social and health sectors. In my budget speech, I spoke about community networks protecting against isolation. In Bishan, mothers gather at playgrounds, taking turns to host playdates and support one another. At Bishan Community Club, a group of young widows called Hope Herd ensures no widow journeys alone. Like elephants, they form a herd so mothers and children can grieve and heal together. Young people are stepping up too. The Rotaract Club of Raffles City runs community projects and has launched cross-border collaborations with their twin club in Kuala Lumpur, including the inaugural Rotaract ASEAN Young Leaders Exchange. These ground-up efforts show that our communities already possess deep social capital. When trusted and supported, residents take ownership, supporting families, combating isolation, strengthening mental well-being. What would supercharge them is sustained low-barrier funding. Will the government, through the 50 million SG Partnerships Fund, ring-fence support and simplify access for youth and parents-led ground-up initiatives? And will the government consider expanding the fund to 100 million, given the demand in rental and vulnerable communities? My next card. Sir, in my budget speech, I spoke about combating social isolation. One way to build lasting mutual aid is time banking. Volunteers can earn credits for helping others, redeemable when they need help themselves. This idea is proven elsewhere. Japan's Furaye Kippu lets volunteers earn credits caring for the elderly. Switzerland's St. Gallen Zeitvorsorge, backed by their Federal Social Insurance Office, records volunteer hours in social security accounts for future use. Both have sustained community caregiving for decades. Singapore's rapidly aging society needs similar infrastructure. We can co-design this with the community. The Government Partnerships Office under MCCY can pilot small-scale time bank or community currency experiments for different purposes before deciding how to scale this nationwide. Time banking gives dignity because no one is a passive beneficiary. Everyone contributes. Skills like listening, visiting, and mentoring, often unpaid and performed by women, are valued. It also reinforces interdependence. Helping a neighbor today means someone will help you tomorrow. Time banking is also democratizing. As I shared in my budget speech, Ayin, a mother, volunteers in our community. 1 hour of her time visiting a hospitalized neighbor is as valuable as 1 hour of a lawyer volunteering at a legal clinic. Will the ministry pilot time banking, allowing Singaporeans to exchange skills and support through time credits? Could this be hosted on existing digital infrastructure like giving.sg? If not, is the government exploring alternative ways to strengthen neighborliness and mutual aid? Thank you.
Associate Professor Terence Ho, kindly deliver the two cuts together.
Mr. Chairman, in the age of artificial intelligence, arts and culture will be more important than ever. I'm very glad that the SG Culture Pass, an idea raised by former NMP Terence Ho, has been launched. I hope that the arts will be seen as a staple of life in Singapore, alongside sports. In this regard, I would like to ask the Ministry if it plans to make periodic top-ups to both active SG credits as well as the Culture Pass, so Singaporeans can stay fit and healthy in body and spirit. The Culture Pass covers a range of activities spanning heritage, visual arts, theatre, music, dance, film, and now Singapore literature. It would be wonderful if the Culture Pass could encourage Singaporeans to try something different from what they are accustomed to. For example, could it persuade a heritage buff to step into the theatre for the first time? Assuming there will be regular top-ups of the Culture Pass, I would like to suggest offering first-timer discounts or bonus credit when a person spends Culture Pass credits in a new category that he or she has not previously used the credits for. A discount arrangement could be worked out with participating arts and heritage organizations. Sir, I will move on to my next cut, please. I would like to declare my interest as a published book author. In the second cycle of the OECD's Program for the International Assessment of Adult Competencies, conducted in 2022 to 23, Singapore climbed to 18th out of 31 countries in literacy proficiency. However, the study also found a significant decline in literacy after the age of 35. Age-related proficiency loss also occurred in other countries, but was particularly pronounced in Singapore. This is a concern as literacy affects the ability to handle and process new information. In the interest of promoting literacy, among other things, I would like to suggest that more be done to strengthen the literary infrastructure and ecosystem in Singapore by providing greater support to local publishers and bookstores. I remember the days when bookstores could be found all across Singapore, from second-hand bookstores in Far East Plaza to the MPH flagship store along Stamford Road. While the book publishing and distribution business model has changed with the times, and we cannot expect a similar density of bookstores as in the past, there's still something special about bookstores that's worth preserving. They are places to discover new authors, often serendipitously, browse the latest titles, and access the ideas that are trending across the world. In this sense, bookstores could be considered almost as a public good that encourages reading and contributes to our publishing ecosystem, complementing our public libraries. Independent bookstores are particularly important in giving visibility to local writers and serving as natural gathering places for fans of local literature. They could be supported with grants to host book clubs and talks, or to support the design and development of conducive spaces to host such events. Perhaps commercial developers could even be granted additional gross floor area if they lease premises to bookstores that fulfill certain community objectives. Thank you.
Ms. Eileen Chong.
Sir, I speak today as a Singaporean who is an avid theatre goer. By the numbers, our arts ecosystem appears supported and healthy. The Public Sector Outcomes Review reports rising heritage awareness, stable graduate employment in the arts, and growing attendance at festivals and community programs. The Cultural Matching Fund has disbursed over $400 million since 2014. Last year, every Singaporean over 18 received $100 in SG Culture Pass credits. If our arts ecosystem is so well supported, why does it remain so fragile? The substation had already shut its doors back in 2021. Last year, the projector closed. Last month, Pandemonium announced its final season after 16 years. Now, each closure had its own reasons. But when established companies with a track record and loyal audiences cannot sustain themselves, or choose to stop as the conditions have become too demanding, then it is not just a series of individual decisions. Perhaps it is a reflection of an ecosystem that remains stretched. And the numbers bear this out. 90% of our arts ecosystem comprises small organizations. 1 in 2 arts and culture practitioners is self-employed. Many work project to project. While the more accessible grants administered by NAC cover between 50% to 70% of project costs, this also means that every production begins in deficit and need to fundraise the remainder cost. Yet donation to the arts make up less than 2% of total charitable giving in Singapore. On the demand side, there is a paradox. The 2023 population survey on the arts showed that while 3/4 of Singaporeans agree that the arts benefit our community, only 3 in 10 consume local arts content. Now, this same survey also points us towards answers. It found that Singaporeans with childhood exposure to the arts were significantly more likely to value, attend, and advocate for the arts as adults. Students and youths already have among the highest physical attendance rates for performances. The data tell us both where the gap is and where the opportunity lies. Sir, I have 2 suggestions. First, introduce microgrants for small-scale, community-facing arts projects. They should come with simplified administration criteria and should not be pegged to a percentage of an overall budget. For small projects, such microgrants could be the difference between a project happening or it not happening at all. Second, make the arts more affordable and accessible for our youth. They are already the most willing attendees. Let us meet their enthusiasm with sustained, expanded and subsidized access. This could mean expanded subsidized student pricing, extending the SG Culture Pass to students aged 13 to 18, or even exploring co-payments for tickets using funds from their EduSave account. If we believe that the arts build character, empathy, and understanding, then we should treat access to them with the same seriousness we treat access to education and enrichment. Thank you.
Ms. Goh Zi Ki.
Sir, first, I declare my interest as a practicing lawyer. Many of arts practitioners are self-employed. They work project to project, commission to commission. While that gives them independence, it also means they are often disadvantaged when it comes to negotiating fees, contracts, or usage rights. Too often, they end up being price takers rather than price makers, and they take the short stick. MCCY has done a lot over the years to support our arts practitioner in funding, talent development, outreach, and capability building that has helped grow the sector and strengthen our arts ecosystem. But there's one area that seems to have left a little behind: legal support. When you are self-employed, understanding contracts and intellectual property rights and negotiating commercial terms, negotiating commercial terms is not just useful, but essential. However, without guidance and support, talented artists can find themselves underselling their work or signing away rights they should not. Many are particularly disadvantaged when dealing with large commercial organizations. Professional help exists, but as I have noted in this House before, lawyers can be very expensive. This affects not just their earnings, but also the sustainability of their careers in the arts. So I want to ask, Would MCCY consider looking at ways to help self-employed art practitioners navigate the legal aspects of commercializing their art? This could be through legal literacy programs, templates for contracts, or access to affordable legal advisory services. Assisting them with commercial or legal negotiations would also be of great help for art practitioners. Supporting them in this way frees them up to concentrate on their art and strengthen their careers. Because at the end of the day, talent alone is not enough. Artists need to be empowered to protect their work and negotiate on their own terms so that our arts ecosystem can continue to thrive. Thank you.
Ms. Haslina Abdul Halim.
Chairman, I declare interest as CEO of ECF, an IPC charity focused on nurturing the potential of children and youth, as well as director on the board of SBF Foundation. I will touch on nurturing confident youths, active citizenry and ground-up initiatives, as well as making businesses do better. It's unenviable how young Singaporeans today live lives. There is more of everything, and yet many feel and wonder that if they are ever enough. Singapore's young must believe they have a place and a future here in Singapore. Last year, MCCY engaged youths across Singapore to develop an SG Youth Action Plan. I'm hopeful for this plan to level the playing field so opportunities are open to every young person, not just a few. We should also ensure that the SG Youth Action Plan is accessible by design, so youths with special needs or from minority communities are not excluded from leadership development, community engagement, and civic participation. I look forward to an update on the SG Youth Action Plan, especially intentional efforts to nurture confidence. I hope MCCY expands partnerships on these efforts and collaborate with partners, particularly for mentoring and work experience efforts, so youth get access to mentors, internships, and real-world opportunities. In the East Coast GSC, we have the internship program, and I think some of the students are joining us here in the house today. When young people can see the path towards meaningful roles and future opportunities, it builds confidence and hope. Our young have some of the biggest hearts. When I was lecturing at Temasek Polytechnic over a decade ago, I led several local and international service trips. My students were more than arms and legs. They were the heart and soul of those missions. Some volunteer with me till today. I welcome the new 50 million SG Partnerships Fund, which I hope encourages more Singaporeans to be a part of something bigger than ourselves. I look forward to more details, including priority areas and support offered for Singaporeans who are keen to apply. Being in the impact space for close to 15 years, Chairman, I see firsthand how many charities and community organizations are doing important work and how more help is often needed. Time, talent, treasure is the currency of the sector. I welcome the move to extend 250% tax deductions for qualifying donations, as well as the corporate volunteer scheme when employees volunteer or are seconded to IPCs until 2029. This is helpful as the enhanced fundraising program is tapering to pre-pandemic levels, and several charity friends have shared their concerns with me. Acting Minister, what is MCCY's plans in working with other agencies or ministries to engage and galvanize corporate involvement and enhance support for corporate giving, as well as volunteerism to encourage businesses to care beyond their bottom lines? Chairman, in conclusion, let's draw inspiration from our young, their big hearts and strong sense of social justice. There is one Malay saying that goes, Pemuda harapan bangsa, pemudi tiang negara, which means the youths are the hope of the nation and pillars of society. And that belief, Chairman, is what will carry us to the future.
Mr. Sanjeev Kumar Tiwari.
Mr. Chairman, I would like to declare my interest as my union operates a credit cooperative and I'm a member of the Singapore National Cooperatives Executive Council. Cooperatives are formed because Singaporeans believe strongly in the principles of self-help and mutual assistance. The spirit of fellowship brings them together to provide services that uplift their members and support communities at large. During Singapore's formative years, the cooperative movement attracted individuals who drove initiatives that include consumer cooperatives which provide affordable essentials and thrift and loan cooperatives that offer accessible financial services. Consequently, they became key pillars in providing affordable, quality and accessible goods and services to workers and vulnerable communities. This intent remains the same today. A case in point was the 22 new projects initiated by cooperatives in 2025. Together with empowering Empowering Communities Fund, the cooperatives rallied over $1.2 million and volunteers to support projects that address needs ranging from seniors, active aging, caregivers, and families to individuals facing social, emotional, and financial challenges. This demonstrated their continued commitment to invest alongside public support in serving communities. With rising competition from more private entities, including global brand names, cooperatives in Singapore are experiencing challenges in attracting youth involvement, talent attraction, and retention to continue the mission. I would like to... Separately, there is also a broader question of how to encourage the formation of new cooperatives to meet emerging community needs. The recently developed Singapore Cooperative Movement 10-year transformation roadmap is a good start in setting the direction. As we look ahead, can the Ministry share how will it support cooperatives in community engagement, youth involvement, and ease of formation of new cooperatives so that more Singaporeans can adopt the cooperative model to address community needs? What will be done to encourage cooperatives to scale up and remain sustainable? Can the Ministry consider reviewing aspects of the Cooperative Societies Act to allow for greater flexibility in their operations, including allowing enterprises to form cooperatives from the current rule whereby only individuals and unions can form cooperatives? Further, can the Ministry support cooperatives by reviewing the current Central Cooperative Fund contribution rate to ensure it is comparable with the current corporate tax rate? That way, cooperatives can channel their savings to support more members and the community. Mr. Chairman, in a world of rapid change, cooperatives are built on trust, powered by like-minded people, reminding us that success is not measured by profits alone, but by how many lives are uplifted and how many futures secured and progress shared. Thank you.
Mr. Darrell David.
Chairman, Outward Bound Singapore, OBS, was established in 1967 by Dr. Goh Keng Swee to cultivate ruggedness, resilience, leadership, and character through outdoor experiential learning. It formed part of early nation-building efforts to prepare young Singaporeans for life's uncertainties. From its beginnings on Pulau Ubin, OBS has grown into a key national institution, delivering character and leadership programs for youth. In recent years, OBS has expanded its reach and upgraded its facilities. Under the National Outdoor Adventure Education Master Plan, a new OBS at Coney campus was developed, and when fully operational, it is expected to significantly increase OBS's annual capacity, reinforcing the government's commitment to outdoor education and part of its holistic development. Today, the OBS experience is most closely associated with youth for many young people. It's a formative rite of passage that fosters resilience and social cohesion. So given OBS's transformative impact, can we not extend its experiential learning model to Singaporeans who did not have the opportunity in their youth? By building on existing partnerships, could OBS collaborate with grassroots networks, for example, to design adapted programs for even older adults and community groups? With appropriate adjustments, I believe that OBS's ethos of resilience and teamwork can be translated into accessible intergenerational experiences that foster connections across age, ethnic, and social groups. Such partnerships could help bridge generational divides, encouraging lifelong learning and creating shared experiences that deepen community bonds. Exploring these possibilities would broaden OBS's role beyond youth development, strengthening our social fabric and reinforcing a shared Singaporean identity. Thank you.
Ms. Elisa Chan.
Sir, in my budget speech, I propose third spaces in our heartlands where young people can socialize and access mental health support. Let me share why this matters. In Ireland, Jigsaw operates youth mental health cafes, low-stigma drop-in spaces that have significantly reduced barriers to help seeking. In Australia, Headspace combines informal hangout areas with on-site mental health, work, and study support. These models work because they meet young people where they are, without requiring them to formally seek help. In Singapore, traditional spaces like void decks have no football signs put up, and malls require spending, which may discourage youth from utilizing them as third spaces. About 1 in 3 youth report severe mental health symptoms, yet 84% of mental health illnesses go undiagnosed. We need intermediate spaces in our heartlands, not clinical settings, but places where young people can play, socialize, and access support early before conditions escalate. Will the government pilot third space hubs in our heartlands, co-locating informal hangout areas with access to mental health, mentoring, and work-study support? Will MCCY develop a national plan to repurpose void decks and community spaces into free, youth-friendly spaces that facilitate social connection?
Sir, I would like to talk about physical space and a challenge which many young Singaporeans live with: loneliness. A 2024 Institute of Policy Studies poll found that Singaporeans aged 21 to 34 face the highest levels of loneliness and social isolation of any age group. This is not a uniquely Singaporean challenge. Last year, the WHO Commission on Social Connection described loneliness as a pressing global health threat. But in Singapore, this is a serious and growing challenge that interacts with something very specific to us: our relationship with space. Singapore is a land-scarce country where every square meter must justify its economic value. We are not short of communal spaces. We have parks, community centres, and integrated hubs, like One Tampines Hub. But space alone does not guarantee connection. There is a difference between programmed spaces and unstructured open spaces. Many of our communal facilities are curated with specific demographics and aims in mind. They function well as spaces of organized activity, but less well as spaces of spontaneous encounter. The Void Deck understood this intuitively. It was a default third space for an entire generation of Singaporeans, including mine. There, community happened without anyone having to organize or pay for it. But the ground-level openness that made the Void Deck a place that you passed through and stayed in has given way to something more structured, purposeful, and less porous. Newer HDB estates have moved towards designs where communal spaces sit between floors or on top of buildings, spaces that require intentional visits rather than chance encounters. I invite the House to consider what is the default third space for young Singaporeans today. Where can they show up without a booking, a program, or a minimum spend? And have the kind of organic encounters that build friendships, spark passion projects, and forge civic bonds. Younger Singaporeans are already trying to answer this themselves. We see it in ground-up initiatives like Friend Zone and the Casual Poet Library. These are signs of unmet need for spaces that are free and open to all, where people can just be. Mr. Chairman, we cannot build a we-first society through youth panels and volunteerism drives alone. We need physical space for togetherness, spaces where we can actually form. So I hope MCCY can work together with M&D and young Singaporeans to co-design a new generation of open, accessible, unstructured community spaces in our heartlands. Spaces that treat the need to gather and belong not as a luxury, but as essential social infrastructure.
Professor Kenneth Poon.
Mr. Chairman, I welcome the Ministry's continued investments in youth engagement platforms, traineeships, and pathways into employment. Coupled with the strong academic attainment of our youth as evident on our performance on international benchmarks, these initiatives will undoubtedly help prepare our young people for economic participation amidst the demands of an increasingly competitive global environment. I would like to propose today that preparing our youth for the future must also include preparing them to develop a shared sense of national identity. This is particularly important in a digital age where their values, aspirations, and sense of belonging are shaped by global influences. National surveys such as the Health Promotion Board's Student Health Survey and the National Youth Council's National Youth Survey have highlighted concerns related to stress, mental well-being, and life pressures among young people. Complementing these findings, National mental health studies indicate that a significant proportion of youth report symptoms of anxiety, depression, or psychological distress. Studies such as the 2020 UNICEF Digital Lives of Children in ASEAN and the IMDA Digital Social Survey highlight that young people today are highly connected digitally and increasingly exposed to a wide range of information, perspectives, and social influences through online environments. More than a century ago, sociologist Emil Durkheim observed that when the social groups individuals belong to weaken, people become increasingly reliant on themselves alone. His insight remains relevant today as young people navigate identity formation in a rapidly changing social and digital environments. We understand from research that adolescents who report a stronger sense of belonging to their national or community context may demonstrate higher levels of well-being, social trust, and resilience during key life transition. Conversely, where opportunities for participation in shared institutions or community life are limited, young people may report greater uncertainty in identity formation, which may in turn be associated with lower perceived well-being. Opportunities to participate in civic or community settings then may serve not only social purposes, but also contribute to psychosocial outcomes that support long-term well-being. Identity formation does not arise solely from instruction or program participation, but through opportunities for shared responsibility, meaningful participation, and voice. Sir, during the budget debate, I introduced 4 questions as a lens for considering how initiatives can strengthen Singapore's social foundations. One of them pertained to the extent to which our citizens have a meaningful voice in shaping how they are supported, in relating them to our youth. I would like to ask if the Minister can share how opportunities for youth participation in community or civic initiatives are being structured to support the development of belonging and shared responsibility, and how such opportunities may contribute to young people's sense of connection, contribution, and participation in a shared national community. I look forward to the Minister's response on this matter. Thank you, sir.
Dr. Charlene Chen.
Recent surveys show that young Singaporeans experience more loneliness than older age groups. Many say they feel more anxious speaking face-to-face than online. Loneliness is not just a mood. It shapes identity. If a young person repeatedly feels unseen or peripheral, that experience becomes part of how they see themselves and their place in society. So the question before us is not only how to run more programs, it is this: are we designing everyday Singapore in a way that makes connection easy or effortful? I suggest we focus on 2 levers: spaces and programming. A young man once told me that when he felt overwhelmed, he would go to the skate park in Tampines. He did not go there for a structured activity. He went because it was where he felt understood. That detail matters. When mirrored panels at Bayfront MRT were frosted, dancers felt displaced. That linkway had quietly become a rehearsal space, a place where they practiced, formed friendships, and improved together. The provision of mirrored space at Marina South Pier MRT acknowledged that informal spaces matter. These examples show something important. Young people do not only need facilities, they need places where they feel ownership. Youths tell me that they compete for library seats or spend money at cafes just to have somewhere to study together. Community clubs exist, but booking systems can feel formal, adult-controlled, or difficult for spontaneous use. If our spaces feel distant or procedural, young people simply retreat to their rooms and to their screens. So imagine this instead. A secondary school student finishes classes, she books a small multi-use room in her neighborhood CC with 2 taps on an app. It is available because certain off-peak hours are designated youth access blocks. She and her friends rehearse a dance routine. Next door, a group of students are revising together. An uncle from the neighborhood drops by to conduct a small mentoring session, matched through a community platform. These are small design changes, but from a youth's perspective, the difference is large. Connection becomes convenient, participation becomes routine, belonging becomes local. So I asked whether MCCY could review underutilized rooms for youth-designated time blocks, pilot simplified youth-friendly booking systems, incorporate small acoustically treated multi-use rooms in future precinct upgrades. This is not about building new complexes, it's about existing infrastructure being more youth intentional. The second is programming. We have grants, youth organizations, and platforms, but initiative often remains fragmented. A secondary school student recently wrote to me asking if she could put posters to match volunteer music teachers with learners who lacked access. Her instinct was right. Connection happens when people teach, learn, and serve together. But why should she have to rely on void deck posters? Imagine instead a neighborhood-based matching feature within existing community apps. A polytechnic student who plays the violin indicates she can volunteer for 2 hours a week. A primary 5 student who cannot afford lessons signs up. The match is facilitated through the community club. Basic safeguards are in place. They meet weekly. They are no longer just volunteer and learner. They become part of the same community. Belonging deepens not through consumption, but contribution. So I asked whether existing MCCY or PA platforms can incorporate hyper-local volunteer learner matching for sports, arts, and mentoring. Grant prioritization for recurring, sustained youth-led initiatives, not one-off events. Chairman, belonging cannot be siloed by age. We need integration. And when generations interact regularly, identity becomes shared, not fragmented. I also hope that the MCCY can consider how we can nurture cross-generational mingling as well. Chairman, if loneliness is rising, the response is not only more services, it is better design. Design spaces that are easy to access. Design systems that match initiative with opportunity. Design programs that reward continuity. From a youth's perspective, the difference is simple. Instead of asking, where can I go? The answer becomes obvious, right here. That is what it means to design belonging, not as a slogan, but as everyday reality. Thank you.
Mr. Alex Yam.
Chairman, in a We First society, our youths are not just beneficiaries of Singapore's future. They must also be partners in shaping it. Over the past year, MCCY has engaged many young Singaporeans. These conversations are valuable ones. But the key question is how these conversations translate into sustained pathways for participation. Young Singaporeans today grow up in a very different environment. They face economic uncertainties, rapid technological change, and the constant pressures of the digital world. Member Dr. Charlene just spoke about loneliness in our interconnected world today. Therefore, how is MCCY equipping our young people with the resilience to navigate these pressures while remaining grounded in a sense of shared responsibility for Singapore? What opportunities are there for young Singaporeans to step forward meaningfully in community building, policy making, and service to society? For example, how can our youth be more actively involved in shaping local initiatives, volunteering networks, or national conversations? For example, in Finland, under the Finland Youth Act, municipalities are required to include youths through the youth councils, or nuorisovaltuusto, and there are over 300 youth councils to cultivate early civic ownership. Ultimately, the goal is not simply to encourage participation, but to nurture a generation that sees Singapore not just as a place to live, but as a community they feel responsible for. Because when they feel a genuine stake in Singapore, they and we collectively can unlock the fecundity of their ideas, the initiative and civic imagination. I would appreciate, therefore, the Minister's thoughts on how we can continue building such a generation.
Responses. Acting Minister, Mr. David Neo.
Mr. Chairman, I thank members for their speeches and suggestions and their strong support for the work that we do at MCCY. Sir, this year, 2026, marks the 60th anniversary of the Singapore Pledge. For 60 years, we have lived out our ideals of becoming one united people, regardless of race, language, or religion. In writing the Singapore Pledge in 1966, our founding father, Mr. S. Rajaratnam, articulated his vision of building an inclusive Singaporean identity anchored on our model of multiculturalism. Fresh off the uncertainty of separation, we chose to build a united, shared, and equal existence as a we first collective, rather than coexistence as divided, isolated, and competing me-first communities. It was a bold vision. Over 60 years, we've built a cohesive, multicultural society where we identify with one another as Singaporeans first. While Singapore is often noted for our exceptional third world to first world economic story, what is equally, if not more exceptional, is our success in fostering a cohesive, multicultural society amidst great diversity in race, language, and religion. And today, we again face the uncertainty of a changed world. Externally, the world order that brought us peace and prosperity is being challenged, reversed, and dismantled. We have heard how international relations have become more my interest first, rather than how can we prosper together. Internally, we face a combination of rapid aging and fast declining fertility. As DPM said, it is an existential challenge. We'll need to stay open with a carefully managed immigration flow to augment our low birth rate. Immigrants will need time to adapt. Will we choose unity over division, sharing over isolation, and equality over discrimination? It is in these uncertain times that the question, what makes me a Singaporean, becomes even more salient for us as individuals and as a nation. Our national identity, which reflects our core values, our principles, and our beliefs, will be what anchors us in a changed world. Only when we are strongly anchored in our collective identity as Singaporeans can we withstand the tests that will come. The Honourable Member Mr. Alex Yam spoke about the need for a We First national identity. In MCCY, we seek to foster a We First society in 3 ways. Let me elaborate. First, we need to expand the common space that we share as Singaporeans. At a basic level, we need to do more to get people to interact, bond, and identify with one another. As members in this chamber will remember, we used to bond through shared experiences, whether it's watching local TV programs like Aksi Mat Yo-Yo, or drama serials like Uso Nanyang, or just going downstairs to play in the Dragon Playground. But times have changed. With Netflix, YouTube, and TikTok, experiences have become more individualized.
We can be in the same room at the same time, but yet have totally different experiences. This reduction of spontaneous, shared experiences have led to an erosion of the bonds that bind us together. In the recent 2026 IPS study on fraternity and social fabric, Singaporeans report a drop in the number of close friends, from an average of 10.67 in 2018 to 6.49 in 2024. 1 in 10 Singaporeans profess to have no close friends. We need to change this. MCCY will step up efforts to foster greater interaction, understanding, and respect among Singaporeans, as this is what keeps our Singaporean identity strong. We will do this through our strengths in arts, heritage, culture, and sport, which is our identity infrastructure. One of MCCY's priorities going forward is to deepen our multiculturalism, a core value that we all hold dearly. Over the years, MCCY has consistently invested in preserving and enhancing our multiculturalism. Our arts and heritage programs, such as Arts Everywhere at CDC and Heritage Activation Nodes, bring Singaporeans from different backgrounds together to appreciate and understand each other's heritage and culture better. Our Harmony Circles encourage honest conversations, build empathy, trust, and respect across differences so that we do not just live alongside each other, but we stand together and we celebrate each other's cultures and beliefs. I agree with Mr. Mark Lee that we should set our ambitions higher, going beyond peaceful and harmonious coexistence to foster deep cross-cultural understanding and appreciation. When I speak with practitioners from our arts and culture groups, they tell me they are starting to notice declining interest among the young to engage in traditional arts. Some youths are trading traditional dance co-curricular activities, or CCAs, for contemporary dance styles such as K-pop. So while I understand the allure of K-pop and K-drama, we also need to retain our diverse traditional art forms and culture that forms the foundation for our multicultural identity. And we need to pass these on to the next generation. So we will be stepping up our efforts to strengthen our unique multicultural identity. National Arts Council, or NAC, will introduce a new suite of new initiatives at preschools and MOE schools to actively expose our younger generation to our ethnic cultures. MOS Bay will elaborate on this. NAC will also launch a new $20 million multicultural arts program grant, seeded by both the President's Challenge and MCCY to support the development of practitioners of traditional and multicultural art forms. To reinforce our identity as a multi-ethnic and multicultural nation, the National Heritage Board, or NHB, will step up placemaking to strengthen the ethnic identities of our historic districts of Kampong Glam and Little India. MOS Dinesh and SMS Law will elaborate further. Through these initiatives, we want more Singaporeans to appreciate, experience, and treasure the multicultural identity that makes us Singaporeans. On the community front, we'll do more to share our unique multicultural identity with newcomers who choose to live, work, and study in Singapore. Newcomers need to understand and appreciate that Singapore is not a homogeneous or monocultural society, and they have to adapt to a set of norms that may be different from where they came from. At the same time, Singaporeans also need to make a conscious effort to share our culture, values, and norms with them. The Alliance for Action on Integration of Foreign Professionals that was formed last year has made good progress in putting forth new initiatives to better integrate foreign professionals into our workplaces and our communities. MOS Dinesh will share more. The second is to encourage people to care for one another and to contribute to building Singapore together. While activities bring people together, it is care and connection that keeps us together. The spirit of care is alive and well in our society. We saw this clearly during COVID-19 when people instinctively stepped up in their own different ways. We continue to see it in everyday acts, such as giving up our seats to people who need it more than us. Our ambition is to build a vibrant and thriving democracy of deeds, where more Singaporeans can contribute to build Singapore together. many Singaporeans want to step forward. Take, for instance, Ms. Yu Po Ling. At 60, a breast cancer survivor, Ms. Yu discovered the benefits of water exercise during her rehab and was driven to share this gift. She created bite-sized aqua fitness videos and led 12 classes for seniors from Fei Yue Active Aging Center. The seniors enjoyed the sessions so much that they encouraged Ms. Yu to offer these classes more regularly. And with support from the Singapore Government Partnerships Office and Sport SG, Ms. Yu is now an Active SG coach, and she runs her aqua fitness classes as part of Active SG regular programming so that she can impact more seniors. We want to lower barriers and create more opportunities for Singaporeans like Ms. Yu to step forward to contribute. Well, in 2016, we launched our Singapore Fund, or OSF, to partner citizens and turn their ideas for the community into reality. OSF has since supported more than 800 projects to benefit Singaporeans. Well, OSF is very well received and has made a real impact on the ground. There are pain points. So, for example, the grant cap and the short implementation period confine projects, and the need to co-fund pose challenges for smaller grown-up groups or individuals who lacked fundraising capability. Well, we took this feedback seriously, and we've been working very hard to fine-tune this grant. So we will launch a new $50 million SG Partnerships Fund over the next 5 years, as announced by PM earlier. This fund supports bigger projects and dreams, welcomes smaller groups, and embraces good ideas wherever they may come from. SMS Low will share more on how this works. We want to empower more Singaporeans to contribute meaningfully so we can build stronger bonds, deeper trust, and a greater sense of shared ownership. This is the first step towards building a stronger We First society. Finally, we want to rally the nation to build an inclusive society where everyone, regardless of their starting point, will be supported to realize their full potential. Our strength lies in our diversity of talents, from entrepreneurs to artists. When we create pathways that allow Singaporeans to pursue their passion and thrive in their chosen fields, we forge a strong national identity built on the shared belief that every Singaporean matters. This is especially important for our youths, who will have to overcome new challenges in this uncertain AI-dominated and changed world. As Ms. Elisa Chen, Mr. Kenneth Poon, Mr. Alex Yam pointed out, our youths increasingly struggle with social isolation, worsening mental health outcomes, and growing career insecurities. The National Youth Council is committed to support our young people to make them active participants equipped with the skills, opportunities, and support systems to thrive and fulfill their aspirations. SPS Go will share a lot more about our initiatives in this area. Let me now turn to sport development. Sport is a powerful unifier for all Singaporeans, transcending age and ability. Sport creates genuine human connections. Sport also ignites national pride and solidifies our national identity, as Associate Professor Kenneth Goh pointed out. MCCY and Sport SG will step up efforts to further democratize sports participation among youths. I share Mr. Alex Yam's concerns that sports CCA should not be something only for the naturally gifted or those who can afford prior training. We will provide more platforms where children can play to nurture their love of the game, so that every child has more opportunities to experience what sport can teach them about themselves and about others. We introduced the School Sports Fiesta last year to bring students from different schools together to play sports. To date, we have held fiestas for 16 schools and well over 2,000 students. 15-year-old Arya Garindran from St. Gabriel's Secondary School had never considered playing basketball. The school sports fiesta sparked a desire in him to explore the sport more deeply. He is now pursuing basketball competitively. We want more students to benefit from this, so we will double and bring the school sports fiesta to 32 schools by 2027. Well, another platform is through CCAs, where students train together, forging bonds through sweat, blood, and tears. CCAs are where many of us made our closest friends, forged through hours of spent laughing and crying together and training. While the sustained interaction and tight bonds are precisely what we want to nurture. However, with schools taking in smaller cohorts and students having more diverse interests, some schools may not have enough students to start a CCA. Well, this is why MCCY and MOE introduced strategic partnership CCAs or SPCCAs, so that more students will get to participate in the CCA of their choice. We will launch more in the next few years. As a ground-up initiative, some schools have also come together to form multi-school CCA teams. For example, ACS Barker and Queensway Secondary came together to form a hockey team that trained together and competed at the National School Games, or NSG. To encourage more of such collaborations, we will launch a new $10 million grant for multi-school CCA teams. Each team will receive $200,000 over 4 years to be invested among the partner schools, which can be used to partially fund facility, transportation, or coaching costs. NSG participation has been increasing steadily. This year will see its highest participation to date, with around 69,000 student athletes from more than 300 schools competing across 29 sports. We want to expand this to provide more opportunities for our student athletes. MCCY and MOE will start a new initiative to work with ready, able, and willing national sports associations to introduce more sports into the NSG. The power of sport to unite and to build connections goes beyond schools. The friendships forged through playing together, the encouragement shared during a challenging game, and the growth that comes from pushing our limits. These are experiences that all Singaporeans, regardless of age and ability, should continue to have access to throughout their lives. Therefore, Sport SG will also step up our efforts to democratize sports in the community and ensure that everyone can continue to bond and to live better through sport. Ms. Gozuki will be glad to hear that we have been steadily expanding sports spaces, especially in the heartlands. We have renovated 4 sport facilities such as the Delta Sports Centre, the Active SG Sport Park at Tegi, and completed 15 development projects, including Bukit Canberra and the Active SG Sport Village at Jurong Town. Within a year, we'll be completing 3 facilities to provide more localized sport access. They are Queenstown, Hougang, and the new Punggol Regional Sports Centre. We have also completed 11 sport in precinct facilities, with another 11 undergoing construction in Tampines North, Keat Hong, Whampoa, and Kembangan, amongst others. Our facilities are well utilized and see over 20 million visitors annually. As more Singaporeans embrace active lifestyles, there's also a rise in demand for public facilities during peak hours, particularly for popular sports like badminton and pickleball. Therefore, I'm happy to announce that we will build 50 multipurpose courts for badminton and pickleball over the next 5 years. This includes the recently opened 8 dual-use pickleball courts at the Kallang, and we'll also soon complete another 8 pickleball courts at the Little India bus terminal. As we build these new courts, we are mindful of managing noise levels at residential estates. I commend Ms. Gozuki's efforts in arbitrating citizen considerations and pushing for foam balls to be quieter in her ward. Well, this is We First in action. Sport SG will work with community stakeholders on solutions. And where it meets space and height requirements, we'll also activate underutilized spaces such as spaces under viaducts in our neighborhoods so that these facilities are conveniently located closer to Singaporeans, but far away enough to manage noise levels. We can see an example like the Gali Batu flyover. So I hope this addresses Ms. Gozuki's concern, and I also hope that this is more than an 80% solution. And to Associate Professor James Lim, the issue with MND is not about revenue loss, but it's about whether residents are well served, especially noise, as many multi-story car parks are located very close to flats. I believe on the 4th November, there was also a PQ filed by member Mr. David Ho, which received a reply, a comprehensive reply from MND on what the considerations were. Perhaps I would point the member to look up that PQ reply. Sporting spaces are just the first step. It must follow with more programs for all ages and abilities. We have active SG academies and clubs that are open to children and youth to play the sport they like. Some go on to developmental programs in high-performance sport. We also have active SG interest groups and learn-to-play programs for adults who wish to pick up a new sport or just to play recreationally. And we are committed to offering more of such programs, and we'll study what Member Associate Professor Kenneth Goh has mentioned about the SG Sport Pass. Mr. Andre Loh asked about access to strength training and to combat aging-related frailty. So we have introduced the Frailty Prevention Program, or the FPP, for seniors, and this enables them to age healthily and to continue to build social connections through sport. Under the FPP, Sport SG rolled out the 8-week Combat Age-Related Loss of Muscle, or CALM, program at Active Aging Centers, or AACs, in 2024. And since then, CALM has yielded positive physical changes in our seniors. One of them is Ms. Florence Su. After experiencing a stroke in 2025, she joined CALM 1.0. Under the guidance of her trainer, Ms. Florence gradually regained her strength, mobility, and flexibility, including improvements in her breathing and mood. And this experience is not just unique to Ms. Florence. In fact, almost all CALM participants reported improved functional performance in at least one measure, such as hand grip strength or gait speed. Well, to date, CALM strengthening program has been implemented at 132 AACs, reaching about 4,000 seniors, and we target to reach 180 AACs and 5,500 seniors by the end of this year. Besides CALM, our seniors have also found adaptive sport attractive and useful in keeping them active, healthy, and socially connected, whether it's through seated floorball or disc golf. As part of the FPP, Sport SG has progressively equipped 200 AACs with adaptive sport equipment. By the end of 2026, we will target to equip all AACs so that more seniors can participate in adaptive sport. Mr. Loh will also be glad to know that at the end of the CALM program, participants are introduced to HUR machines. Almost all senior care centers and some AACs are equipped with these variable weight machines. Last year, we also launched the Seniors National Games, or SNG, where seniors represented their AACs to compete across 5 adaptive sport categories. Well, we are heartened by the turnout, over 4,500 seniors from 110 AACs and even more family, friends, and fans, and the positive feedback at how the SNG provided opportunities for seniors to not only keep active, but also build connections and have fun. We invite more seniors to take part this year. For persons with disabilities, we launched the Enabling Sports Fund, or ESF, last year, supported by the President's Challenge and as part of the refreshed Disability Sports Master Plan to support community-initiated projects. We received many good proposals. One of these is from Sundek, which created iBoccia, a modification of the Paralympic sport boccia. iBoccia is customized and is suitable for persons with intellectual or other disabilities and able-bodied teammates. Through the fund, Sundek will introduce iBoccia to more persons with disabilities. Altogether, the ESF will support 21 initiatives for more than 8,000 persons with different disabilities across more than 20 sports. Sport also opens doors for Singaporeans to chase their dreams. With the right support, we believe our athletes can realize their aspirations and their full potential. Dr. Kenneth Goh asked for an update on athlete support. We've put in place SPEC's potential to nurture athletes with potential for gold medal success at the SEA Games. We have increased stipends and introduced CPF top-ups for our SPEC scholars to make competitive sport more financially viable. Signed agreements with 6 autonomous universities to create more athlete-friendly environments, and launched the SPEC's Education undergraduate scholarships for athletes to pursue both education and competitive sport. So take, for example, Ryan Lowe, a gold medalist at the Asian Games 2023 and last year's SEA Games, and two-time Olympian sailor, for example. So the Specs Education Program Office worked closely with James Cook University to balance his academic commitments with training and competitions. He's on track to complete his business degree with a shorter duration, enabling him to both pursue his sporting ambitions and educational aspirations. Ryan will be also defending his title at this year's Asian Games, so let's cheer him on. We want to do more for athletes like Ryan. We are reorganizing ourselves to achieve this. This April, we will consolidate our key sports entities, the High Performance Sport Institute, HPSI, the Singapore Sports School, SSP, and Unleash the Raw, UTR, into a new identity that we call Sports Excellence Singapore, or Specs SG. I'd like to update Mr. Alex Yam that this consolidation will materially transform the sporting ecosystem for the better. First, we'll enhance the breadth and depth of our support to athletes by making our high-performance sports system more athlete-centric and whole of life. To enable more of our athletes to stay longer and to go further in sport, we will support them with specialist expertise and in managing sporting commitments and other demands of life. Under Specs SG, we'll expand our athlete life management capabilities to support athletes in a wide range of areas, like tertiary education, career development, family planning, financial literacy, and personal growth. Our athlete life performance managers have commenced personalized consultations with top athletes, co-developing plans to help them manage major life transitions. Dr. Kenneth Goh will also be glad to know we also run workshops. We also run workshops to equip our athletes with skills in areas like personal branding, entrepreneurship, mental wellness literacy, and media training. We'll also deepen and integrate sports science and sports medicine, or SSSM, support for our athletes. A key benefit of this consolidation is the pooling of our SSSM expertise and knowledge. This will increase our capacity and open more opportunities for cross-knowledge transfer and pathways for career progression. Our athletes will see more dedicated and consistent support across sports. And as a system, we reach synergies that we otherwise would not if the entities remain separated. Second, within Specs SG, we will strengthen SSP's role as our education concierge for all Team Singapore student athletes. Today, SSP provides a dedicated high-performance development pathway for young athletes at the secondary and post-secondary levels. With the consolidation, we'll capitalize on SSP's expertise and we'll offer this to all Team Singapore student athletes, regardless of age or school. SSP currently avails its annual university and scholarship fair and university advisory services to Team Singapore student athletes. Going ahead, it will support Team Singapore student athletes in all 6 of our local autonomous universities. SSP will also work with NSAs to allow talented student athletes to transfer to SSP whenever they are ready to commit, regardless of where they are at in their secondary or post-secondary journey. SSP is also developing capabilities to support overseas-based Team Singapore student athletes so that they can learn with their SSP classmates in Singapore for both the secondary and the International Baccalaureate Diploma Program, IBDP. SSP will further enhance its partnerships with NSAs and lean forward with boarding and facility support. One example is the Junior Performance Pathway Program, a collaboration between SSP and the Singapore Badminton Association. Under this program, student athletes who are not studying at SSP can access training sessions at SSP, and they can also board with SSP. SSP will continue to develop such partnerships with more NSAs. Altogether, these changes will enable our student athletes to pursue their aspirations and realize their full potential. Third, Specs SG will tighten integration with our NSAs, empowering them to develop their sport for excellence. Like Mr. Jackson Lam, I too hear from NSAs their aspirations and challenges. We'll strengthen our support for and partnerships with the NSAs. NSAs will now have a single point of contact to address their high-performance and pathway development needs, whether through a dedicated high-performance sport manager or shared service desk. For new and emerging NSAs, we'll also develop a playbook to guide them in achieving charity status. We'll also have media communication trainings for NSAs to enhance media management capabilities and athlete profiling efforts. Specs SG will also expand secondment opportunities for sport administrators to more NSAs. Today, Sport SG seconds CEOs, GMs, and high-performance managers to NSAs such as sailing, fencing, and badminton. I hope Mr. Jackson Lam and Ms. Valerie Lee will be happy with these changes. But above all, Specs SG will transform the end-to-end journey of our national athletes to be a lot more integrated and seamless. Well, let me just illustrate with basketball. 3x3 basketball is gaining popularity because of its high intensity and fast-paced gameplay. Our men's and women's team are both ranked top 6 in the Asia-Pacific. But we can do better. Previously, our young basketball athletes trained separately. The national youth teams come together for a few months before major competitions, and then they separate after that. This ad hoc training environment does not develop their technical skill, decision-making speed, and high-performance habits to their full potential. Neither does it build team chemistry. Sports science support is reactive at best. So we want to create a more integrated pathway that brings together our young athletes more consistently so that we can strengthen individual mastery and team cohesion. And that's why SSP, HPSI, and the Basketball Association of Singapore established a new Under-19 National Youth Development Program, or NYDP, at the Singapore Sports School. How does this look like for an athlete? Let me illustrate it with an athlete's story. Emily Alyssa is a high-potential talent in the national Under-16 girls team that won a silver medal in the Under-16 Southeast Asia Basketball Association qualifiers last year. Recently, she decided to transfer from her DSA school, Yishun Secondary School, to SSP to pursue her aspiration to represent Singapore at the senior level. Before, Emily trained twice a week in her secondary school, separately from her national teammates and under a different coach until competition period nears. Now, Emily trains up to 10 times per week for both the 3x3 national team and the NYDP under national coaches with a standardized coaching pedagogy. This consistency means that Emily is building the right technical, physical, and mental foundations for progression into the senior national team. Emily will also now have year-round sport science and sport medicine support. Beyond sport, Emily will also be able to build a strong academic foundation in SSP with all the flexibility that Team Singapore athletes need. She will also have access to the suite of athlete life management offerings where she can seek guidance for other life priorities so she can be ready for life. Specs SG will work with more NSAs so more of our national athletes can be supported like Emily. Mr. Chairman, let me conclude. After 60 years of nation building, we have bonded over our shared experience, built a strong multicultural community that will step up to drive positive change. And we forged a united society that identifies ourselves first as Singaporeans and not by our race, language, or religion. Faced again with the uncertainty of a changed world, let us stand on the shoulders of our pioneers and choose to build an even more cohesive and stronger Singapore. One where our ethnic and religious communities not only live in harmony, but share a deep appreciation for one another's culture. One where everyone contributes actively to care for and to uplift others in our community. One where everyone can fulfill their aspirations and reach their full potential. One that is truly a we first society. Mr. Mark Lee asked what success looks like. Mr. Chairman, I believe it is the Singapore that Mr. S. Rajaratnam envisioned as he wrote our pledge 60 years ago, where we come together to celebrate our diverse cultures and share the same we first values, where we choose to be united as one people, trust each other, uplift one another, give back to society, and where everyone can succeed on their own terms, where we cast aside our differences in race, language, or religion, and we contribute in our own way to build our nation, where every Singaporean, regardless of their starting point, can achieve their full potential. Let us come together and work towards this dream, just like how our forefathers did when Mr. S. Rajaratnam first wrote our pledge. Let us not be mere spectators, but pledge ourselves as one united people so that we can achieve happiness, prosperity, and progress for our nation. Thank you.
SMS Lo Yen Ling.
Mr. Chairman, I recently visited the Founders Memorial's Not Mere Spectators exhibition. Since 1959, Singapore's diversity has been built and held together our people's active participation. Throughout the years, Singaporeans stepped forward to care for one another and uphold our unity in diversity. One example is the People's Cultural Concerts. These were performances by the people for the people, nurturing a sense of belonging, mutual respect, and shared identity. Held in open spaces across Singapore, people come together to perform, watch, and learn together. Several pioneers in our art scene, like Dr. Umar Rajan and Madam Som Said, performed at these concerts and became lifelong friends. Their experiences at these concerts left them with a deep conviction that multiculturalism must be lived and not just be spoken about. Both, in fact, went on to shape Singapore's cultural landscape. Our nation's early years and journey reflects the seeds and the foundation of the We First society that we seek to forge. We see that this We First spirit at different levels of our society, where Singaporeans care, share, and uplift each other. At the individual level, we see it in volunteers like Madam Ratnam Periosami. She is 90 years old. At 90, she is the oldest volunteer at Care Corners Active Aging Center in Toa Payoh East. She goes door to door to check on seniors living alone and organizes activities for them. Her example shows us that you can contribute and care regardless of age. At the community level, groups like the Kampong Glam Association, in short, they are called KGA, came together to develop the Kampong Glam Place Plan to enhance the precinct's heritage and cultural importance. At the business level, we see the We First spirit in companies like A Advantage. About half of their 20 staff members receive time off to volunteer regularly at a nursing home. Mr. Chairman, the common thread that we shared earlier in the individual level, the community level, the business level, really shows that ordinary Singaporeans and groups stepping forward to make a difference, a big impact on our society. And this is the kind of the We First spirit that MCCY seeks to spark, spur, and strengthen. We will do so by, number one, creating common spaces through our heritage. We will bring people together, both physically and in spirit, to foster a stronger sense of community. Number two, by encouraging and enabling active citizenry to ensure that good ideas are turned into actions and no one is left behind. Chairman, when we speak about heritage as a common space, we are referring not only to our landmarks, but also to familiar places within our neighborhoods, places that hold meaning, memory, and shared experience among Singaporeans. Mr. Fu Zhexiang asked about MCCY's plan to allow more Singaporeans to play an active role in celebrating our neighborhood heritage. Through the National Heritage Board, NHB's Heritage Activation Notes, in short we call HANS, NHB partners, residents and stakeholders to co-create programs celebrating their neighborhood. Since 2 years ago, 2024, NHB has launched 3 HANS across Singapore that has drawn more than 30,000 visitors. They are in Katong Juchet, Clementi, and Punggol. In Katong Juchet, there is a mural of a mama shop about Lorong Stangi, created by a local artist, Mr. Elvin Mark Tan, based on his childhood memories. This mural has inspired passerby to contribute their stories and old photos of Juchet. Across the 3 HANS, more than 360 volunteers have stepped forward to deepen our local community heritage. Building on this momentum,
NHB will launch 2 new hunts in 2026. One will be in Telok Blangah, in partnership with Participate in Design. It will focus on uncovering hidden neighborhood gems and story. And the other hunt will be in Tiong Bahru, with Tiong Bahru Community Centre as our partner. It will celebrate public housing architecture, religious sites, as well as heritage businesses. In addition, we will continue to steward our landmarks and historic districts carefully so that they remain meaningful to all Singaporeans and are sensitively integrated into the everyday lives of surrounding communities. Ms. Joan Pereira asks for whole-of-government approach in assessing the future public use of 38 Oxley Road and to consult neighbouring residents throughout the decision-making process. As mentioned by Acting Minister David Neo in his previous ministerial statement, MCCY will certainly study possible options to make the site accessible to the public so that it can become part of our shared memory and a common space for all Singaporeans. The acquisition process for the site is ongoing. Once access is obtained, NHB will conduct a holistic study in consultation with the relevant agencies to assess how the public education value of the site can be optimized. We will work with the member as well as the relevant government agencies to engage residents staying nearby the site and consider ideas and feedback to minimize any potential disamenities. To enhance and protect our historic districts, NHB will establish a place-making project office under the Inter-Agency Task Force for Heritage Businesses, Traditional Trades and Cultural Life, which I co-chair with SMS Faisal Ibrahim. The project office will work closely with key district stakeholders like the KGA, Little India Shopkeepers and Heritage Association, and Chinatown Business Association to better understand their needs and empower them to enliven their precincts. In addition, the project office will provide seed funding, link groups to relevant agencies, and build capabilities to design, implement, and scale place-making initiatives. Heritage businesses play an important role in enhancing the unique character of our historic districts and serve as community anchors. Associate Professor Kenneth Goh asked whether more targeted succession planning support could be given to preserve heritage businesses and support their financial viability. We recognize that succession planning can be complex and deeply personal. Where heritage businesses are ready to pass down the reins, our agencies will certainly provide support. This includes business improvement initiatives such as the NHB's Organisation Transformation Grant. For example, Rumah Makan Minang, a third-generation family-run restaurant, tap on this grant to strengthen its long-term sustainability by reviewing and restructuring roles within the family business. NHB will also be working with citizen volunteers to document heritage businesses and their contributions as part of the Little India Citizen Engagement Project. Interested members of the community can look out for NHB's call for citizen volunteers for the exercise, which will be announced by May this year. These efforts remind us that heritage endures not only because it is preserved by institutions, but because it is kept alive by people. Chairman, besides strengthening our sense of community through heritage spaces, we will nurture the growth of the We First society by spurring active citizenry. We want to see everyone coming together to shape and take ownership of our shared future. To spark active citizenry, we will set up Singapore Government Partnership Office. We set up the SGPO 2 years ago in 2024. Last year, the government received more than 1,600 partnership proposals addressing a wide range of community needs. Let me cite 2 quick examples. Project Jalan Jalan. It is a youth-led performing arts ground up with the mission to connect people through performances in public spaces. During SG60, they staged more than 20 performances across 5 locations. Another project is Skill Seed, an established community builder that works with residents to uncover neighborhood stories and to strengthen local leadership. Skill Seed seeks to build trust, capability, and ownership within the community. Now, both projects had different starting points, but they have the same spirit of contribution. Such citizen-driven initiatives have immense potential to spread their impact and their outreach. That is where the new SG Partnership Fund, in short SGPF, announced by Prime Minister Lawrence Wong and just now by Acting Minister David Neo, will play a key role to spur and strengthen active citizenry. As requested by Ms. Haslina Abdul Halim, I will briefly share how the fund is tailored. It is tailored to empower different levels of ground-up ideas and activities through 3 tiers of support. First, the seed tier aims to grow a democracy of deeds by supporting citizen-led ideas, even nascent ones, with accessible and low-barrier funding up to a maximum of $5,000 a year. We hope that this tier, with its simple application process, will motivate more individuals and ground-ups to come forward with their ideas, no matter how small, to address community needs or to better the life of fellow Singaporeans. The next tier, the Sprout tier, aims to grow the circle of ground action by providing support for those with proven ideas to amplify their impact and outreach. It is also the next tier of funding that successful graduates of seed tier recipients could apply to grow their project ideas. To qualify for Sprout tier, individuals or ground-up need to demonstrate track record in implementing projects of a similar nature or have conducted successful pilots of the proposed idea. This tier provides up to 80% funding capped at $50,000 up to a period of 2 years. Finally, the Scale tier is for organizations that aim to deliver systemic or sector-wide social impact, or to foster cross-sector partnership with measurable outcomes. This can take the form of large-scale initiatives that grow civic participation or capacity. Similar to Sprout, applicants for this tier would need to demonstrate prior success in implementing projects of similar nature and that the proposed idea has achieved tangible results in pilots. Chairman, we recognize that implementing such programs would require greater capacity from the organizations. Therefore, we will work with successful skilled applicants to strengthen their capabilities to execute their projects more sustainably. The fund will provide up to 80% funding capped at $1 million over 3 years. The fund will also cover capacity costs such as manpower and training. Ms. Elisa Chen asked about ring-fencing SGPS funding to support youth or parent-led initiative, and if the fund should be increased to boost mutual support and neighborliness. I want to respond to her and assure her that currently the SGPF is sized at $50 million over 5 years. We want to ensure that it remains accessible to encourage a broad range of initiatives that leads to positive change for communities, certainly including youth, certainly including parents. The SGPF also complements existing schemes such as the NYC's Young Changemaker Grants and the NYF. I want to assure her that we will review the SGPF's impact on catalyzing projects that support active citizenry before we consider enlarging it. Applications will open from next month, April 2026, and more information will be released on the SGPO's website. We welcome and we invite all Singaporeans to step forward and make a difference. Your ideas and efforts matter, and we can create a We First Singapore where no one walks alone. Chairman, a We First society is built when people, communities, and businesses step forward to serve the collective good. Ms. Haslina Abdul Halim asked how we can rally more to do so. First, we will incentivize and actively support corporate volunteerism. As PM Lawrence Wong announced, the corporate volunteer scheme will be extended for 3 more years. This allows companies to enjoy 250% tax deduction on qualifying expenditure when employees volunteer with institution of public character, including employees' salary and volunteering supplies. Second, we will help companies build capability and confidence to contribute and shape our society for the better. For instance, the partnership between Singapore Business Federation, SBF, and Volunteer Inc. provides company with training, guidance, and connections to community organizations. And since the program was launched in July last year, more than 100 companies have stepped forward to partner Volunteer Inc. One of them is Coface, a multinational trade credit insurance company which launched a drive to develop adaptive floorball sessions for elderly persons. Last year, 52 Coface volunteers contributed 624 hours of their time over 8 floorball sessions. And this very meaningful initiative saw the seniors gain confidence through adaptive floorball, form friendships not just among the elderly, but also with the Coface employee, and rediscover the joy of staying active. Over the next 5 years, we aim to mobilize 600 companies and 6,000 employees to participate in similar projects. Third, we will continue to nurture a culture of giving back. In 2025, under the National Volunteer and Philanthropy Centre's Company of Good initiative, recognized 371 companies for their contributions. Then there is the Collective for a Stronger Society launch 2 years ago in 2024 and led by CFS, Community Foundation of Singapore, which brings together government agencies, donors and community partners to better support lower income families. To date, CSS has raised approximately $60 million, translating generosity into meaningful support for families who need it most. Ms. Elisa Chen asked whether government is considering alternative ways to encourage neighborliness and mutual help, for example, through time banking. While time banking is a good idea to increase neighborliness and foster mutual help, there may be practical implementation challenges. However, I want to assure her that there are community-led initiatives that have similar objectives to time banking. For example, Tai Hwa Kwan's Moral Charities implemented a program supported by the DBS Foundation, where active aging center participants take on short microtasks based on their abilities and schedules and receive small allowances upon completion. I want to assure her that MCCY will certainly be happy to support similar ground-up initiatives, including any time banking pilots under the just announced SGPF. Chairman, while corporate and organized giving matters greatly, a we for society is also expressed through everyday acts of care. Volunteerism, therefore, is vital to growing active citizenry. Our island-wide network of 24 SG Cares Volunteer Centre works closely with communities to identify and address their needs. More than 720 volunteers from semiconductor manufacturer Micron partnered with the SG Cares Volunteer Centre in Sembawang to run Micron Kampong, which befriends seniors and bring them on outings and festive visits. This year, we aim to engage 36,000 volunteers to benefit 180,000 service users. When corporates, community groups, and individuals choose to step forward to connect, to care, and to contribute, the foundations of active citizenry are built, and the seeds for a we first society are sown. Chairman, please allow me to say a few words in Mandarin.
Mr. Chairman, the foundation of Singapore's nation building is to establish a harmonious and prosperous, multiracial and multicultural society. We often say country first, then the family. First we, then I. Establishing values that prioritize we over I is the foundation upon which Singapore relies for survival and prosperity. On the other hand, as an open country, Singapore is deeply influenced by the changing international situation and various ideologies. Ensuring that Singapore continue to focus on the Singapore's national interests and care for the harmonious development of Singapore society is one of MCCY's primary tasks. To deepen the We First concept, we hope to adopt a three-pronged approach through business, community, and individuals to strengthen mutual care and build a We First society. Upon the three cultural, we will add 2 new initiatives, one in Teluk Blangah and one in Tiong Bahru. Now, these 2 areas have very rich cultural heritage, as mentioned by Prime Minister Wong and Acting Minister Neo SG Partnership Fund. We will provide a framework, a clear framework for committed projects at different stages to obtain funding. And this 5-year program, the budget is 50 million from the seed stage with an annual cap of 5,000 to the sprout stage with up to 50,000 over 2 years to the scale stage with up to $1 million over 3 years. The government hopes to encourage individuals and organizations to start small and share more creative, good ideas with more people to unite the community through progressive support. Enterprises, companies, and professional bodies can also establish mechanisms through the corporate volunteer scheme to encourage employees to give back to the community through volunteer service. A weaver society needs us to create and implement it together. When corporates, community groups, and individuals come together, we will be able to create a harmonious, united, and progressive home and society that belong to us. A country that really belongs to us is our Singapore. 主席，让我们
And no Singaporean walks alone, and where people of all races, backgrounds, and creeds are joined together by our common hope and vision of a caring and cohesive Singapore. We see the seeds of that weaver spirit blossoming in the examples that we share today, from 90-year-old Madam Periosami to the dedicated volunteers from COFACE and our many companies of good. MCCY will continue to partner Singaporeans to create the conditions for this spirit to grow. Let us shape a weaver Singapore, strong and resilient and stronger together. Thank you.
MOS Bae Yam Keng.
Mr. Chairman, Acting Minister spoke about how multiculturalism bridges communities and forms the core of who we are as Singaporeans. Multiculturalism is and will always and has always been the bedrock of the Singapore identity. For Singapore, a sense of shared identity is essential. It holds us together and gives us a sense of belonging. Our multicultural identity reminds us of what it means to be Singaporean. Today, we embrace it as a way of life. This was on display just recently when Chinese New Year coincided with the start of Ramadan. Last Saturday afternoon in my constituency, I saw Muslim residents doing the Lo Hei together with the community at the Chinese New Year celebration, and grassroots leaders tapaoing the buffet so that they can enjoy it after breaking fast. Even so, there's more that we can do and should do to deepen our multicultural DNA. Around the world, we see how social diversity leads to fragmentation. It is therefore critical that we strengthen our cross-cultural understanding and deepen our shared identity. This is where the arts can be a powerful catalyst. Through the arts, we get to know ourselves and where we came from. More importantly, arts encourage us to look beyond their differences and value our commonalities. It is encouraging that in the population survey on the arts conducted by the NAC, 8 in 10 Singaporeans agreed that the arts allow us to better understand people from different backgrounds and cultures. Over the years, the local art scene has developed generations of practitioners, groups, and platforms that embody Singapore's diverse cultural traditions. 2 weeks ago, I attended the spring reception held at the Singapore Chinese Cultural Centre. One of the performances was a multi-ethnic percussive showcase. Zhang Feng opened the performance with Chinese drums, which was then joined by Nadi Singapura's Kompang and Rubana drums, and Singapore Do Squad's Purai drums. These instruments from different cultures blended seamlessly to deliver a great performance. We will continue to support our traditional arts and culture so that this precious part of our cultural heritage is passed down to future generations. Various artists and arts groups whom we have consulted gave us this advice to develop multiculturalism through and in the arts. We must work harder to engage the young to understand and appreciate the cultural heritage within and across the various ethnic communities, and to expand the reach of monocultural traditional art forms within the general population. In particular, we should promote cross-cultural awareness and appreciation. By building these bridges, we learn to better appreciate the culture and art forms outside our own ethnic community. Upon this strong foundation, we can do more to support cross-cultural artistic creations that are sophisticated, innovative, high quality, and that are uniquely Singapore. To achieve this, we will provide more support to promote the development of multicultural art forms, whether through productions that infuse the influences of other cultures, creations and organizations that express our multiculturalism, or artists learning a new cultural art form from another ethnic community. This must start at a young age. As Ms. Eileen Chong spoke about, fostering greater participation among the young is important for the long-term sustainability of the arts sector. Early and meaningful engagement with our diverse arts traditions lays the foundation for our children and youth to appreciate one another's cultures. NAC is expanding opportunities for students to do so. At the preschool level, NAC will commission artists and arts groups to develop offerings that enable sustained access to arts experiences. One of the programs designed with the Art Ground focuses on multicultural arts. The program will feature Malay and Indian dance, Peranakan arts, traditional hand puppetry, and Chinese opera. NAC will pilot these programs with selected preschools. At the secondary school level, NAC will introduce a 2-year ethnic fusion dance program delivered by Old School Limited. This enrichment program will allow students from different schools to learn about various ethnic dance forms together, then apply them in contemporary dance. The students will have a chance to audition for a final showcase at Super 24, a regional competition featuring dance groups from across Asia. We will strengthen funding support for schools to bring in artists to deliver traditional and multicultural arts learning experiences. Currently, under the Artists in School scheme, or AISS, NAC funds 70% of supportable costs for schools to bring in artist-run programs up to $15,000 per year per school. NAC will increase support for artist-run traditional and multicultural programs under the AISS to fund 100% of supportable costs up to $25,000 per year per school. For 2026, NAC has curated close to 300 programs under the NAC Arts Education Program, working with MOE schools to nurture an appreciation of Singapore's multicultural identity among students across all levels. This is nearly a 35% increase from 2025, offering schools more choices to spark greater interest in multicultural arts. Beyond schools, we will increase the exposure of multicultural arts in the community. We have been doing this through Arts Everywhere at CDC, which brings arts and cultural performances to our everyday spaces. For example, Sri Warisam Som Syed Performing Arts presented a blend of traditional Malay art forms with musicians playing the ungklangs, dancers weaving melodies into stories, and intricate wayang kulit puppets. The initiative has reached audiences of more than 63,000 since its launch in 2024. Looking ahead, we will focus on showcasing Singapore's multiculturalism through Arts Everywhere at CDC in our heartlands. We will introduce more traditional arts and cross-cultural performances and programs. These will deepen Singaporeans' understanding and appreciation of the cultures and traditions of different ethnic communities. For instance, the Open Score project, co-founded by Gildan Chu, combines global ethnic musical cultures and pushes the boundaries of cross-cultural collaboration. As part of Arts Everywhere at CDC, the ensemble performed at Jurong Lake Gardens last year. Through such programs, we can grow a deeper appreciation for arts experiences that connect our cultures. We want to encourage even more arts practitioners and groups to nurture connections and collaborations that express who we are as a people. To support this, I'm happy to announce a new multicultural arts program grant seeded by the President Challenge and MCCY. $20 million will be available over the next 5 years to support practitioners and organizations developing traditional and multicultural art forms and promoting cross-cultural engagement through the arts. The grant will support artists and projects blending elements from different cultures, traditions, and disciplines. This could support artists who interweave elements from different cultures in a meaningful way, and those who wish to develop mastery in art forms beyond their own cultural traditions. It will also support ecosystem building activities that strengthen the multicultural arts landscape. The Multicultural Arts Program Grant will be launched in the coming months, and NDC will share more details then. Another initiative that expands access to local arts and culture offerings is the SG Culture Pass, launched in September 2025. Dr. Kenneth Goh had asked whether it is reaching new audiences. I'm pleased to share that over 1.2 million citizens have registered for the SG Culture Pass. Of these, 7 in 10 had not attended a local arts and culture program in the past 5 years. Among those who had used their credits, 9 in 10 expressed interest to attend another local program. Through the Culture Pass, Singaporeans have discovered more about different cultures in Singapore beyond their own. I thank Mr. Terence Ho for suggesting regular top-ups of the Culture Pass, first-timer discounts, and bonus credits. As the scheme was just launched recently, MCCY will monitor utilization trends before making adjustments. Nevertheless, we are encouraged by the statistics, which show that the Culture Pass has helped Singaporeans discover the diversity of our local cultural landscape. Mr. Terence Ho also asked whether more could be done to support our local publishers and bookstores. Since 1st March 2026, Singaporeans have been able to spend the Culture Pass credits on singlet books at participating bookstores. This strengthens our support of the local literary arts sector and directly benefits publishers and bookstores. Besides expanding access to the arts and developing audiences, we are exploring ways to harness the potential of the arts to generate positive social impact. One such area is in arts education research. Positive engagement with the arts from a young age supports holistic development. Through sustained and localized research, we can better determine how arts-based education can nurture the next generation of Singaporeans. MCCY has commissioned a 5-year research study on how arts engagement can boost creativity and strengthen the social-emotional well-being of our students. The study is led by the National Institute of Education in partnership with MCCY, NAC, and the Esplanade. Through this study, we hope to provide insights for schools and arts agencies that inform efforts to support youth development. Another emerging area that shows great promise is the nexus of arts and well-being. The National Gallery Singapore's Slow Art Guide is an example, delivered through a self-guided audio experience and reflection booklets. Through slow looking and mindfulness exercises, the initiative encourages visitors to engage mindfully with artworks. This evidence-based approach positively impacts mental health and cognitive function. As Singapore's population ages, the arts provide a platform for our seniors to live and age well. NAC has partnered SingHealth Community Hospitals and Agency for Integrated Care on a research study. The study aims to determine the impact of arts programs on senior well-being. The insights will help design effective interventions to support our seniors. NAC is also working with the arts community and healthcare and community care practitioners on a series of arts programs. These programs are designed to enhance the well-being of seniors at active aging centers or AACs. We aim to grow the pipeline of skilled practitioners who can deliver effective arts-based well-being programs. We have conducted these programs in 28 AACs and aim to reach a total of 110 centers by 2028. Dr. Kenneth Goh and Ms. Gozuki asked about how we are supporting our artists to build sustainable and resilient careers. We will continue to invest in the growth and development of our local arts and culture sector to support its ambitions. This includes encouraging and catalyzing private sector support through measures such as the Cultural Matching Fund, which provides matching grants for donations to arts and heritage charities, and to date, more than $450 million has been matched to around 130 unique charities. And we also have the Patrons of the Arts and Patron of Heritage Awards to recognize contributions to the local culture sector. Arts self-employed persons, or SEPs, form a significant segment of Singapore's arts workforce. We are committed to empowering them to build capabilities and forge meaningful careers. Since I launched the Arts Resource Hub, or ARH, back in 2019, more than 4,000 SEPs have subscribed to the ARH. This is around 2/3 of our arts SEPs in Singapore. Julian Low is one example. He went through ARH's Ignite program, which provided mentorship, networks, and guidance in building a brand identity. Julian established Wu Si Ren Theatre with his wife in 2024. Their debut production, I Am Finally in Love with the World, was successfully staged in 2025. We recognize that our arts SEPs face evolving challenges that require enhanced support. I'm happy to announce that NEC will enhance Arts Resource Hub to better address the challenges they face. Over the years, ARH has provided SEPs access to legal guidance through contract templates and peer learning opportunities. We are starting a partnership with Pro Bono SG this year. It will provide SEPs with education programs and tailored resources to strengthen the understanding of legal topics and empower them to capitalize on opportunities. SEPs can also tap on consultations with a dedicated on-site lawyer. NEC will also introduce a new creative entrepreneurship program to support SEPs in developing entrepreneurial skills and growing their portfolios for greater financial resilience. Both initiatives will be available in the second half of this year. These initiatives that I shared today ensure that we continue to have strong funding, talent, and domestic support pipelines for the arts, which Ms. Eileen Chong spoke about. As we support our artists and arts groups to thrive and express our cultural heritage, they serve as our ambassadors to the world. Dr. Kenneth Goh had asked about using cultural diplomacy to reinforce our Singapore identity. We will continue to support our practitioners to make their mark internationally and to showcase our Singapore identity beyond our shores. For instance, the Singapore Pavilion at the Osaka World Expo 2025 featured many local performing artists, including multicultural ensemble In Harmony, a cappella group, the Island Voices, and Bharatanatyam dancer Shruti Nai, showcasing Singapore's rich cultural diversity to global visitors. Mr. Chairman, as we look ahead, Singapore must prepare to face new waves of challenges for a changing world. Strengthening our shared identity will enable us to overcome these challenges with confidence. We must renew our commitment to multiculturalism. The arts have the unique power to deepen our distinctive brand of multiculturalism and build a more inclusive Singapore. We'll continue to invest in and grow the arts landscape to amplify its positive impact. Thank you.
MOS, Mr. Dinesh Vasu Dash.
Across Singapore, communities celebrate one another's cultures, from the multicultural floats at the Chingay Parade to the annual Iftar at Hatijah Mosque, where I sat alongside religious leaders from the Interreligious Organization, or IRO, to break fast. This is a rare sight in today's world, where trust is in short supply and where multiculturalism is in retreat. We have seen this in the years before independence, during the hardships of the Second World War, and when communal tensions were high. Yet, even when the odds were stacked against us, our pioneer religious leaders chose unity and harmony. Their commitment led to the formation of the IRO in 1949 to build trust and mutual respect between faiths. This exemplifies Singapore's approach to social cohesion, one where people from different backgrounds make an active effort to appreciate each other's cultures and traditions. The mission to build a strong, cohesive, and caring society is an ongoing one. Let me speak on 3 areas that MCCY will be focusing on. First, to build strong communities with a shared cultural identity. Second, to deepen the understanding between communities and to expand our common spaces. And third, to architect an ecosystem of care and mutual help so as to uplift all communities. Let me start with strong communities. Singapore is a nation of migrants. Early generations brought languages, traditions, and beliefs from their home countries. They provided mutual assistance as they settled in Singapore, forming associations and clans. Over time, new generations came of age and more took root here. While we have kept our racial and religious identities, our practices have evolved to become uniquely Singaporean. It is important that we steward our cultural heritage so that future generations can understand who we are and where we come from. I hope this is useful, especially to our youth, including those from the East Coast internship program who are joining us here today in the gallery. Professor Faisal spoke about the Malay Heritage Center earlier and SMS Law about enlivening our historic districts. As PM had mentioned during his budget speech this year, MCCY and the Indian Heritage Center, or IHC, will launch renewed efforts to activate Little India as a vibrant cultural district to celebrate the Singapore Indian arts and culture. We will engage community and precinct stakeholders to co-create a long-term vision for IHC and to enhance cultural placemaking in Little India as a historic district. This begins with a visioning exercise in 2026 to lay the foundation for a precinct-wide programming and activation efforts. Our goal is to help Singaporeans and international visitors understand and appreciate Singaporean Indian cultures and customs. Our efforts to build a strong Indian community will go beyond culture and heritage. Last year, Minister Shanmugam announced that SMS Murali Pillai and myself will lead a new committee to take the Indian community forward. Since then, we have engaged widely. More than 150 Singapore Indian organizations have shared their aspirations and ideas, particularly on how we could uplift members of our community together and to integrate more strongly as one united Indian community. Taking in the feedback we have received, we will call this the Indian Engagement and Development Initiative, or INE, which also means to be linked or connected in Tamil. This will be a committee by the community and for the community. Its aim is to build strong networks across the Indian community, bringing together partners who are already doing good work on the ground, including Sinda and Narpani. INE will start with 3 priorities. First, to improve socio-economic outcomes for the Indian community, particularly the vulnerable and the disadvantaged. Second, to champion integration and unity among the Indian community in Singapore. And third, through the initiatives under INE, we hope to create new avenues for our youth to contribute and to nurture the next generation of Indian community leaders. I'm glad to announce that together with the INE committee, we will establish an annual INE forum to collectively discuss our aspirations and concerns. We will have the first dialogue in April 2026 with the theme of building a strong and united Indian community. We will also configure subcommittees, and I invite members of the community to step forward, share your perspectives, and play an active role in shaping this important initiative. More details will be announced at the dialogue in April. Mr. Chairman, please allow me to say a few words in Tamil.
Last August, the Coordinating Minister for National Security and Minister for Home Affairs, Mr. Shanmugam, announced a new committee. This committee, which is co-chaired by Senior Minister of State, Mr. Murali Pillai, and myself, will take the Indian community forward over the next 5 years. Since the announcement, we have held discussions with members from various segments of our community. Participants shared their thoughts on the challenges faced by the Indian community. Their views are centered around the common themes of social cohesion and development. We have named this committee the INE Crew. This committee will take the excellent work being carried out by community organizations, including Sinda and Narpani, to the next level. We also believe in developing skills among the next generation of leaders and identifying new talents. Additionally, I am pleased to announce that we will hold an annual forum to discuss matters important to our community. We plan to hold the first dialogue in April 2026. Additional details about the INE committee will be shared then. I request members of the community to come forward and share their views.
Move to the second area of deepening understanding between communities and expanding on common spaces. I spoke earlier about global uncertainties, and Singapore is not immune to these developments. Last September, the Istiqamah Mosque received a parcel containing pork and an offensive note. And in December, a false bomb threat was made against the St. Joseph's Church. Community leaders responded quickly. The Serangoon and Cashew Harmony Circles rallied neighboring religious organizations to offer support and reassurance to the affected communities. Our Apex religious organizations put out public statements of solidarity. Their message to the public was clear. An attack on one community is an attack on all communities. Our responses matter. Each incident is an opportunity to build up our reservoirs of trust so that we can stand united in troubled times. That is why we continue to invest in our racial and religious harmony circles. Last year, more than 40 religious organizations partnered MCCY to co-organize interfaith events and contributed to the Crisis Preparedness for Religious Organizations program. During the Racial and Religious Harmony Month alone, more than 100,000 participants took part in over 70 events nationwide. This included the first youth-led intercultural showcase called Kaleidoscope, Harmony in Motion. This year, we will step up our efforts to engage religious organizations and build an even stronger interfaith network in our neighborhoods. Mr. Chairman, our ability to foster unity and inclusivity amidst diversity is Singapore's enduring competitive advantage to attract international businesses and talents here. But as I said earlier, our model of multiculturalism is unique, and some newcomers may take more time to adapt to it. After all, integration is a two-way street, which will require locals to be receptive and newcomers to make the effort to understand our culture, values, and norms. The workplace is a natural space for this interaction to take place meaningfully. As mentioned by Acting Minister David Neo, the Alliance for Action, or AFA, on the integration of foreign professionals had conducted extensive engagements to develop practical solutions that industry partners can adopt to integrate foreign professionals at the workplace. The AFA has put forward new upstream initiatives under two focus areas, which the government strongly supports. First, to help new EP holders understand the living and working norms in Singapore, and second, to support firms to adopt inclusive workplace practices. In the coming months, the government will roll out new orientation and onboarding programs for our EP holders, with a focus on workplace and living norms. This will complement existing programs for new citizens and for our permanent residents. SNAF and SBF will also launch new resources for firms, including a workplace integration playbook and a new cultural intelligence and sensitivity training course. I'm pleased to share that 5 trade associations and chambers have come on board to roll out an orientation day programs for new EP holders, which will introduce them to our workplace norms and provide them with opportunities to network with their Singaporean counterparts. This will be scaled up to more TACs over time. So I've spoken about building strong communities and deepening bonds between them. The third area I will speak on is on the architecting of an ecosystem of care that every community can tap on. Our cooperatives, or co-ops, are one of the oldest forms of community mutual help. They are defined not by identity, but by a common purpose. Since 1925, our co-ops have played a vital role to meet the evolving needs of our people. Some may be familiar with credit co-ops, which provide thrift and loan services. There are also consumer and services co-ops, like the Silver Caregivers Cooperative, which provides supportive community for caregivers and equips them with the skills such as managing palliative care. However, as Mr. Sanjeev Kumar Tiwari had earlier noted, our co-ops are facing growing challenges to renew their talent pipeline and to attract young members in a more competitive landscape. This is why MCCY announced the co-op 10-year transformation roadmap in 2025. This roadmap will nurture a forward-looking sector that is purposeful, professional, and trusted. I'm happy to share that MCCY will commit up to $30 million to support the co-op movement over the next 10 years. We will help co-ops stay relevant as they develop new capabilities to address emerging needs and transform for the future. Co-ops will receive support to invest in talent development, governance, and operational efficiency. As part of the roadmap, MCCY and the Singapore National Cooperative Federation will jointly introduce the Cooperative Leaders Program and Emerging Leaders Program from this year to develop the next generation of leaders. The roadmap also includes the Community Outreach and Impact Program, which will provide seed funding, incubation spaces, and mentorship for our youth to pilot innovative ideas. As to Mr. Tiwari's questions on allowing enterprises to form co-ops and reviewing the central co-op fund contribution rates, MCCY will assess these further in line with our objectives to sustain the relevance and competitiveness of the co-op sector. In conclusion, Chairman, the formation of the IRO in 1949 was an experiment in trust at a time when the idea of a formalized interfaith dialogue was unheard of. Our forefathers were bold and visionary in setting the building blocks of a multicultural society that we enjoy today. That same spirit must guide us as we strengthen these three areas of focus for MCCY that I had outlined: to build strong communities, to deepen understanding between communities, and to architect an ecosystem of care that uplifts all. However, this House cannot legislate social cohesion, nor can we mandate trust. But history and the example of the IRO shows us that if any society can achieve this and make it work, it has to be Singapore. Thank you, Mr. Chairman.
SPS Goh Han Yen.
What would you do if you were not afraid? I want to ask this of the young people watching the Committee of Supply today. But it's also a question for all of us. If fear was not holding you back, what would you try? For many young people today, fear doesn't come from the lack of ability. It comes from growing up in a world that's highly connected and where missteps and comparisons are amplified. But fear is an integral part of life. Our responsibility is therefore to ensure that our young people are equipped to meet it. And such courage does not happen in isolation. Courage grows when people feel supported, feel rooted, and feel like they're part of something larger than themselves. Across many societies, we're seeing signs of weakening relationships and commitments that once anchored people to their communities. Some observers describe this as a broad social drift towards detachment. Ultimately, young people, like us all, want connection and purpose. How can we empower our young people on their journey to find a sense of belonging, meaning, and a sense of self, even as social bonds seemingly wane around the world? To answer this question, we went to our young people directly. In fact, we collected over 350,000 responses from youths and stakeholders. We listened to your hopes, your dreams, your concerns. We heard you, and we will bring your views to life through the SG Youth Plan, which will launch later this year. This will be a 5-year action plan to empower you, our youths, to be the best version of yourself in Singapore. Mr. Alex Yam, Professor Kenneth Poon, Ms. Haslina Abdul Halim, and other members advocated for the need to be better engaged with our youths and to support them, and asked, what more can we do? Like members, MCCY strongly believes in this need. What I'll share today are some key areas we're developing under the SG Youth Plan to support different phases of a young person's life. When we listened carefully, what came through clearly was this. Early on, young people want the confidence to try, to test themselves, to fall, and to get back up. They understand that the world is full of uncertainty, but they do not want to be sheltered from these challenges. They want real experiences in the real world with real people. As young people grow older, the questions shift to finding direction and meaning in work. And later still, many want to step forward to contribute and shape the spaces and communities around them. But it all begins with the same question. Do I have the courage to try? This is where play matters. Play is often misunderstood here in Singapore. It's not about leisure or being frivolous. Young people, play is where you learn how to make mistakes, bounce back, and how to do it with friends and family beside you. When my daughter learned how to rollerblade, her first lesson was not how to go fast. It was how to fall safely. And she had the most fun when learning with her friends. Fumbling, laughing, getting back up together made it easier to keep going on. Today, young people are spending more time online, but many crave real-life connections. When you head outdoors, especially to new places with new people, you discover something important. You learn that pushing through tough moments is part of progress, and that companionship makes all the difference. This is why we'll progressively scale up the MOE Outward Bound Singapore Challenge MOC program to the entire Secondary 3 cohort by 2030. Last year, about 18,000 students went through the MOC, about 65% of the cohort. In time, all 15-year-olds in Singapore will get to experience OBS at least once in their lives. Each OBS watch comprises 12 students from different schools, strangers who will embark on the outdoors for 5 days. Through the shared experiences, they will learn life skills, gain confidence in tackling the unknown, and make lasting friendships. Like Ms. Valerie Lee, I'm sure OBS has left a lasting impact on some in this chamber. In fact, I was in the same watch as Valerie when we were 15. We went away sunburned with legs full of sandfly bites, but the core memories stayed with us even till today. The expansion of the MOC is made possible by the new OBS Coney campus. I'm glad to update that the campus will open its doors later this year. Now picture this. Teams of 4 students working together on advanced rope challenges instead of just pairs today. These expanded team activities will push more young people to rely on each other, building stronger bonds and greater resilience. What is particularly meaningful is that some of these challenges, including high elements, will be wheelchair accessible. This ensures that no student is left behind when acquiring and building these crucial life skills. As Mr. Darrell David reminded us, OBS was set up in 1967 by Dr. Goh Keng Swee to develop mentally and physically rugged youths to be active citizens inspired to serve the community. The words rugged and active citizens captures the evergreen spirit of Singapore, our eternal way of being, so that our nation endures. But the need has clearly changed. In 1967, we needed ruggedness as we struggled for nationhood. Today, we need resilience to navigate an uncertain world and maintain a strong sense of identity and belonging as one people, one nation. Mr. Darrell David and Ms. Valerie Lee asked about extending OBS to all ages and expanding the OBS overseas programs. I thank them for these valuable suggestions. Yet, with finite resources, our priority must be to get the MOC scale up right for our students first, before we consider other areas. Ms. Valerie Lee also talked about supporting the outdoor adventure education, OAE, sector. We have been doing so through the OAE Council, which was formed in 2022 to uplift the sector. The Council brings partners together to establish national standards and exchange best practices across the sector. Beyond organized activities such as OBS, friendships form in ordinary moments of just being together. Many young people feel that as years pass, there are fewer physical spaces where this can happen naturally. Dr. Saling Chen, Ms. Elisa Chen, and Ms. Eileen Chong therefore asked about creating more spaces for our youth. We are developing the Somerset Belt as a youth precinct. Somerset Belt is the area around Somerset MRT station, comprising Scape, the Somerset Youth Park, and Skate Park. We received over 16,500 responses on what youths and others hope to see. Our youths also worked alongside architects and planners on the design and program of Somerset Belt. We aim to start construction work later this year. Meanwhile, exciting programs and activities are already happening at the Belt. We relaunched Scape last November, and it's now a hive of activities centered on youth's interests. Anime, dance, art, tabletop games, music, the list goes on. I was at Scape on a Friday evening and spoke to some of the young people hanging out there. I asked what Scape meant to them. This is what they told me. It's a sandbox where I could quickly test my event concept. Separately, in other places, we might get stares. But here, there is no judgment. This is a place to just be. It gives us the time and space to pursue our ideas and passion. There was a palpable sense of hope and energy. And we're only 4 months into the relaunch. Now, Scape is just a start. We want to bring this movement closer to where our young people live. We will create more welcoming open spaces across Singapore where you can gather freely and form friendships. We will share more details at the launch of the SGU plan. As young people move into the next stage in life, the questions change. For students coming out of school, the next step is entering the workforce. Am I on the right path? Will I be employable? Over the past days, many in this chamber have highlighted youth anxieties about work, especially in the face of artificial intelligence. Indeed, it is daunting finding work now when you can barely imagine what jobs will exist tomorrow, let alone plan a career. Yet we cannot block these advances. What matters then is building the skills to thrive with technology. Our ministries are working hard at this, as shared by my colleagues over the past few days. For example, our institutes of higher learning will enhance their AI curriculum while emphasizing soft skills that will complement this use of AI. For working youths, we'll support them in learning AI-related skills, such as providing free access to premium AI tools for those who take up selected AI training courses. Fundamentally, the real power lies in how our young people choose to engage in these tools. Your generation, the digital, or even the AI native generation, knows how to use these tools instinctively. As much as it has the potential to replace some junior level tasks, it can equip you with the power to compress traditional learning curves. Your generation will teach us many things about AI and its possibilities. But we are also here for you with our experiences and memories of navigating change. We need to tap on each other's strengths. This shared learning is precisely what young people have told us matters. Someone walking alongside them, someone to help them make sense of all this uncertainty and find their inner strength. Someone to remind them that life doesn't follow a straight line, but there always are ways to find solid ground beneath your feet. This is why we will grow mentorship opportunities so that our youth will have someone to journey with them through the big and small leaps in life. Ms. Haslina Abdul Halim would be glad to know that since 2022, we have created over 20,000 mentoring opportunities through the Mentoring SG movement. We know that finding a mentor isn't easy when there's so much to keep up with life. As such, we want to lower the barriers and make professional connections more accessible for you. We are bringing mentorships directly to schools where you are. We recently partnered 3 polytechnics to create mentoring programs under Mentoring SG. By 2030, these programs will serve up to 11,000 students annually. More partnerships are on the way. Just imagine if we all step up to contribute our experience, lend a listening ear, and journey together with our young people through their life transitions. This is the culture that we can only create if we set aside time for our young people. This is what we want to do under Mentoring SG. After navigating the next leap in life, something shifts yet again for many young people. They don't just ask, what should I do? But also start asking, what can I change? Young people told us clearly that being heard is not the same as being trusted. Real responsibility and agency build confidence. Professor Kenneth Poon and Dr. Charlene Chen, as well as Ms. Eliza Chen, asked about how we are supporting youth participation to create a sense of belonging. We have been creating many such opportunities. Take the National Youth Council's Young Changemakers Grant. This seed funding program puts youth in charge from start to finish. Young people do not just receive funding and mentorship, they are fully responsible for evaluating each other's proposals and giving advice. For impactful proposals, we are prepared to support them further. There are different programs that youths can access, such as the National Youth Fund and the new SG Partnerships Fund that SMS Low just touched on. In his budget speech, the Prime Minister also mentioned the youth panels. Youth panels work differently, but with the same spirit. Young people partner directly with government agencies to shape policies they care about. In the first run, 120 youths rolled up their sleeves to tackle topics like financial resilience and environmental sustainability. The next run of the youth panels launches later this year, and we will share more details when ready. We want to create even more opportunities for young people to contribute. I'm glad to announce that we will form the Somerset Belt Youth Collab, a group of 15 youths who will drive, own, and lead the spaces and activities within the Somerset Belt. The collab will take control of the Somerset Belt's programming and activities. They will decide which spaces serve what purpose. Simply put, they will create the vibe that defines the Somerset Belt. When I spoke to some members, they were clear about what they needed the most: space, funding, and agency to make their vision happen. We are therefore backing the collab with a dedicated space to activate and a 300,000 annual budget to bring their ideas to life across Somerset Belt. This way, youths can transform Somerset Belt into a place that's truly, boldly theirs. Let's envision a space that breathes with youthful life, a place they have built and filled with their energy. We are putting our belief in our young people into action. Real investment, real decision, real responsibility. This is us saying, we trust you to lead, show us the way. Now that is what ownership looks like. Mr. Chairman, please let me say a few lines in Mandarin.
The government places great importance on youth development. They are the future leaders of our nation and our country's hope. We sometimes inadvertently compare youth with the previous generation. However, each generation of Singaporeans faces their own challenges. Our current generation of youth has their aspirations and possesses a strong sense of social mission. This is their strength. Rather than comparing them with the previous generation, we should give them space to express themselves freely, find their own path, and discover their own strengths. We should also give them opportunities to develop interpersonal skills through play or to grow from failure. Over the next year, the government will collaborate with various social institutions to formulate a 5-year SG Youth Plan aimed at nurturing a generation that is ambitious, resilient, and has a strong sense of national belonging. We welcome suggestions from all sectors of the society and encourage active participation from all levels.
Growing up is not a straight line. It begins with learning you are tougher than you think. It continues with you finding your way without losing who you are. And it grows into stepping forward to shape what comes next. As I shared at the beginning of my speech, around the world, many societies are grappling with weakening bonds. But will that be our future? Surely, we must do all we can to avoid that. If we put the right pieces in place, can we move in the right direction? Can we build a generation that feels deeply connected to society? A generation that feels that Singapore is theirs and that they are Singapore's. The SGU plan will be our commitment to build that generation of young people who are confident to try, connected to one another, and ready to contribute. We will keep listening, we will keep building the right support around you, and we will keep creating spaces for you to lead. Thank you.
We have some time for clarifications. We were not able to finish all the clarifications for Acting Minister Faisha, so I'm going to do that first. And I'll have a hard stop at 6 p.m., and then we will have clarifications for the rest of the POHs for MCCY. Dr. Hamid Razak.
Thank you, Chairman. I'd like to clarify with the Acting Minister. On the ground, I've interacted with many of the MMOs and IMOs who are keen to actually tackle some of the issues within the Malay Muslim community. I really welcome the idea of a MQ Plus network. I'd like to ask how that will actually look like on the ground, how it will be operationalized, and what the opportunities and resources will be available for our MMOs and IMOs who are keen to contribute to tackling some of these problems in the community. Thank you.
Acting Minister Faisha.
So I thank the member for the SQ. I'm happy to share with you that in the last few months, many of the MMOs have come forward. They have, in fact, organized among themselves to see how they can work together and collaborate with the MQ agencies. And on the other hand, the MQ agencies are also looking at how the ways where can work better. As I shared in my speech, we have some collaborations, especially in some of the areas. And in fact, with MQ Plus, so it will be, it signifies a greater emphasis on more intentional collaborations between the MQ agencies and the MMOs, IMOs, and informal groups. So we have the MQ focus areas, 5 focus areas. Among the areas we look at how to strengthen marriages, youth development, healthcare, and supporting workers. So we will see how some of these areas where the MMOs, IMOs, as well as informal groups can play a part. I'll give you an example. We have the Malay Muslim Organization Rehabilitation Network, where we see many of the MMOs, IMOs coming together to support. And this is an example of how we can make MQ Plus a reality. So we will, depending on the areas of topics that we're looking at, there will be opportunities to do so. And another one will be the MQ at towns, where every town has been which has a MCube, will be able to work with the MMOs and IMOs and the informal groups. So we want to see how we can navigate this together. So we will discuss further during the networking session, and I look forward to significant enhancement in collaborations among between the MQ agencies and the MMOs, IMOs, and informal groups.
Mr. Fadli Fauzi.
Thank you, Chair. I have two questions for Minister Faisal. The first is that can the Minister share the specific ratio of mosques to Muslim residents that have been used in the mosque construction planning? And secondly, does MUIS have any plans to evacuate madrasa students who were studying in the Middle East, Muslim students who were studying in the Middle East and currently stuck there? Thank you.
Acting Minister Faisal.
So I thank the member for the SQ. Our priority is ensuring that there are sufficient prayer spaces for all Muslims in Singapore. So simply using a ratio of Muslim population to mosques is insufficient, as worship patterns, resident concentrations, and mosque sizes vary across Singapore. So instead, MUIS monitor worship patterns closely on the ground, including me. We go on the ground, we feel what it is like, and introduce measures to address the demand and increase the capacity. This includes multiple prayer sessions and expanding or upgrading current mosques. So where there are shortages, we will make some adjustment and see whether there are opportunities to do so. And as I mentioned in my speech, if there are changes to the population patterns or new housing estate coming up, we will explore building new mosques, like what we have done we are doing in Tampines and Tengah. And for your second question, I have actually answered the SQ. We work closely with MFA, and also we also listen on the ground. So yesterday when I spoke to the students, I shared with them, anything that you know, please let us know, because they are there and they may know more information and better, I would say more accurate information than us. So this, when I told them, they felt so happy that we are very serious to know what's happening there, and they feel that we really care for them. So I assure the member, while the situation is uncertain, we'll do our best to look after our people.
Mr. Azhar Othman.
Thank you, Chairman. I will allow me to address my question in Malay. Kita sedar bahawa kecerdasan buatan atau AI
will go into all kinds of education, knowledge, and jobs. I have a question for the acting minister. Firstly, do we have courses in the Islamic, the College of Islamic Islamic Studies will have AI-related courses? And secondly, can we have financial system to allow them to be exposed to AI? Thank you.
Saya ingin mengucapkan terima kasih.
Thank you to Mr. Azhar for the question. This is a good proposal. AI is a national level initiative. So SCIS and the madrasa will work together so that we can gain the benefit from AI and see how our students can not just gain the benefits, but also to go deeper into it in the process of learning. So I will bring this proposal to MUIS, and we will share with the madrasa, because as this is an important platform where we can open the avenues for development for our students, so that they remain relevant, no matter what discipline they are in. Saya rasa semua penjelasan sudah.
To MCCY now, Mr. Lexiam.
Thank you, Chairman. For the Minister, on the consolidation under SPECS SG, I might have missed it, but could the Minister share the expected timeline for the new structure to be fully operational so that we can quickly address the myriad of needs that our Team SG athletes have on their life journey? The second question is for MOS Dinesh, who earlier spoke about importance of unity and togetherness. We see a lot of collaboration at the apex leadership level for our ethnic and religious communities, but does the ministry have an assessment of how much of these permeates down to the level of congregants and community members, and what more we can do in this area? Lastly, for SPS Go, she mentioned the youth panels and the partnering with government agencies to allow youths to shape policy. Could she elaborate on how the ministry will be ensuring that these ideas from the panels are meaningfully introduced and go towards influencing policy outcomes? One last one. Overarching all of that, a lot of announcements today, a lot of emphasis on building a We First society. But could I also ask the ministry, how would be the measure of success beyond participation in all that we have announced? How do we assess that social trust has been enhanced?
Acting Minister Neo.
So I thank the member for his clarification. So from 1st April, the CLG called SPECS SG will be in effect, but because the entities are currently present, but we anticipate will take some time, for them to come together to. And to be fair, a lot of the things that I said we were doing are already a work in progress. It is stuff that things that have really been going on. So, but we do expect to take the better of the next year or two before we can fully reap a lot of the benefits of the consolidation that I talked about earlier.
MOS Dinesh.
I thank the member for his question. Indeed, the level of integration and the discussions that happen at the Harmony Circle pretty much sometimes depends on the type of religious institutions that might be available at the particular constituency. But we have been trying to expand that to include, exchanges across different constituencies as well. And we constantly review how we want to advance and to strengthen the harmony circles that we have. In fact, we are reviewing what else we can do and how best we can then allow for that integration to take place. Understandably, there is some degree of variation among the various constituencies. Some are a lot more integrated, and they have a lot more programs than others. But what we are trying to do is to allow for that even balance across all. Thank you.
SPS Go.
So on the youth panels, agree that it's very important for it to be brought into fruition and to show up in policy. So MCCY and NYC does manage this very closely to ensure that the recommendations are then pulled through the policy pipeline. So for example, one of the topics was called Life Hacks, but essentially it's around financial resilience. And this led to idea of having a youth-centric guide that consolidates financial information for youth. So now MCCY is working closely with the relevant agencies to bring it to pass. But I also wanted to highlight that apart from looking at policy outcomes, what we also wanted to improve was the experience of the youth. So what they said as well is that they appreciated the interaction, but they also wanted to have some skills to help them with policy making. So that's what we'll do in the next run, to equip them with policy making skills so they can better appreciate the process.
Associate Professor Kenneth Goh.
Thank you, Chair. I just have three quick questions. First, on programs to support career transitions for athletes. While I understand that these services are available while they are carded, could MCCY consider extending these services beyond the carding window, since many athletes may only fully utilize them after their competitive careers end? Perhaps setting up a Team Singapore alumni type of association. Second, I applaud the initiative for MOE to work together with NSAs to introduce new sports for the National School Games. Related to that, could MCCY facilitate closer coordination between the NSAs and MOE on DSA admission criteria so that school pathways are better aligned with long-term athlete development frameworks? My final question has to do with the SG Partnerships Fund. It was mentioned that the Sprout tier is expected for the Sprout tier, 20%, there's a 20% co-funding requirement. And I was wondering if the Minister could elaborate on whether donations would qualify for the 250% tax deduction, or whether this could be funded through earned revenue, and whether there is flexibility in how this contribution could be structured. And whether MCCY could provide support to help organizations or to help these initiatives secure these funds, particularly in the area of fundraising and partnership development. Thank you.
Acting Minister Neo.
So I will address the first two clarifications, and then SMS Lu will address the third one. So on the first question about athlete life management beyond carding, sir, it has always been our approach that we will meet the athlete where they are. And it is our commitment to support our Think Singapore athletes as best as we can. And in instances where actually they require athlete life services or other services after they cease being carded, actually, it's not a problem. They can just step forward. It's a tight community. We all know each other, and we'll be happy to support them. And on the second question about the DSA admission criteria, whether MCCY can help the NSAs work more closely with MOE. When I meet up with all the NSA presidents and vice presidents, my commitment to all the NSAs is that MCCY will be the government conduit upon which we will help them navigate any and all difficulties or issues that they encounter with any government agency. So I think that's our commitment to the NSAs. And then when it comes to, if it's specifically on DSA with MOE, likewise, we will do that for them as well.
SMS Lu.
Thank you, Chairman. Very quickly, I just want to respond to the third clarification from Associate Professor Kenneth Goh with regards to the 20% co-funding. So to recap, the 80% co-funding is for the Sprout tier and the Scale tier. And the Sprout tier is $50,000 over 2 years, and for the Scale tier is $1 million over 3 years. Allow me to assure him that the 20% to be co-funded doesn't have to be done upfront. And the source of funding that he mentioned, whether it's donation or the earned revenue, are allowable. Now, as to the tax rebate, it depends on which is the organization that's leading the project and whether this organization has the IPC status. The last part of the question, he asked whether there's any fundraising support, etc. SGPO stands ready to support to work with the sector partners as well as the applicants to really realize their project. So we will support them in really boosting their capabilities in operations as well as fundraising. And happy to also update him that after the evaluation of the project, in fact, upon approval of the project, up to 40% of the grant will be dispersed. I think that goes some way to support them in realizing the project. Thank you.
Ms. Elisa Chen.
Thank you, Chairman. I wanted to ask the Ministry of Culture, Community and Youth, given the encouraging utilization of the Culture Pass and the good outcomes that we have achieved thus far, whether the Ministry has considered extending the Culture Pass to every child rather than limiting eligibility to those aged 18 and above, given that early exposure to the arts and heritage can play an important role in shaping cultural appreciation and developing creativity. I also wanted to check if there are plans to introduce a youth or family component to the Culture Pass so that parents can utilize it together with their children for arts, heritage, and cultural activities. My next clarification, I'm also very glad to hear that every 15-year-old will now be able to experience the OBS program. I wanted to ask whether we can consider extending it to the cohorts who are affected by COVID.
MOSP.
Yeah, on the use of Culture Pass right now, we have a certain 18 and above. I think it is also to respect that the individual has to exercise their own decision to purchase things, whether books or other cultural offerings. So as for the younger Singaporeans, they are also supported for their consumption of arts offerings in schools, because under 18, most of them will be in our education institutions. And we shared there are various arts programming that we are working with MOE, with the arts ecosystem to provide these offerings. And a lot of these are heavily subsidized or even free of charge to help us develop a generation of Singaporeans who are exposed to and can appreciate the arts. So, so for Culture Pass is for those who are much older, but as I said, it's just about half a year that we have launched a Culture Pass. We will look at how it's utilized, and we will definitely look at ways to further enhance this or to make it more accessible to Singaporeans. Thank you.
Mr. Jackson Lam. I'm sorry, SPS go first.
Thank you, Chairman. So I appreciate the members' consideration and concern for the cohorts affected by COVID. So as I mentioned in my main speech, our priority for the OBS is the MOC scale up for the secondary 3 students up to 2030. So that will be our priority, to get it right, to make sure we do it well. And further, also, if you look back at the cohorts impacted by COVID, we also recognize that many of them are at different phases of life. They may be in very different places, NS, working, so on and so forth. So bringing them back together again for a common single experience would be a lot more operationally challenging.
Mr. Jackson Lam.
I would like to ask the Minister, will the shared services by Sports SG have sufficient capacity to meet the needs of all NSAs? Second, if the demand exceeds capacity, what framework will Sports SG use to prioritize requests? Thank you.
Acting Minister Neo.
So I thank the member for his question. So in sizing up the support for the NSAs, actually we'll work quite closely with all the NSAs to understand what their needs and requests are. So it's our assessment that we should be okay. But beyond that, I think our approach to supporting the NSAs is always one whereby we want to make the NSAs better. So a lot of the initiatives that I mentioned in my speech about seconding people to NSA and all that, it's about building up their capability. And beyond that, we also get our NSAs to work together to share best practices. For example, one of our NSAs has had good success in digitalizing their operations, and we're getting them to share that across the NSAs. So the approach really is about making them better, and then also working very closely to understand their demands, and then we will. My assessment is that we should have enough resource to support them. Yeah.
Associate Professor James Lim.
So I appreciate the referral by the Minister to the PQ filed by member David Ho in November last year on considerations that HDB makes on MSCP repurposing. I'm also keenly aware of the noise considerations that are associated with pickleball play in the multi-purpose, multi-story car park. That's why in my cut I had actually taken pains to explain why noise disamenities could be mitigated with sound curtains and the presence of a ceiling. So I'm wondering if the Minister has a response to whether such mitigation mechanisms is indeed infeasible, and if not, then perhaps we can get some reassurance by HDB that we will indeed be able to proceed with such repurposing requests. Now, I understand that this is actually an infrastructure matter that may be better directed to the Minister of National Development, but I had originally filed my cut for MND but was redirected, and hence I'm directing it to you.
Acting Minister Neo.
So I thank the member for his clarification. Well, like Sport SG, I think we adopt a very practical lens to this. So it, as I said in my speech, it comes down to whether the location is suitable, it meets the specifications. And if it comes to having to do a lot of mitigation just to make it work, we have to ask ourselves whether this is the best use of government funds. So I think that will be it.
Mr. Andre Elo.
Thank you, Chairman. My clarification is to Acting Minister. I thank him for his comprehensive overview of the measures we're taking to help our elderly Singaporeans combat aging-related frailty. There was also another thrust to my cut, which is about making strength training more accessible to Singaporeans at large. And I wonder if the Minister has a response to my suggestion to leverage our existing fitness corners as a means of providing easy access to strength training for the rest of Singaporeans.
Acting Minister Neo.
So I thank the member for his clarification. I was under the impression that his original suggestion was meant for seniors, which is why the reply that actually, for seniors, they require quite different machines. They require machines that ideally have pneumatic weights, so they can be increased at small increments as opposed to the standard kind of weight machines that we have, and therefore the HUR machines that are available at majority of our senior care centers. Now, when it comes to like general weight training for Singaporeans, Sport SG offers wide, as well as not just Sport SG, there's still a private gym landscape in Singapore as well. But taken together, I think Singaporeans have a lot of different possibilities and accesses to whether it's gym weight machines or otherwise. Now, to the specific suggestion about weight machines in, our constituencies, as well as HDB fitness corners and all that. I think that's something that we have provision for in some areas. It's also something we are looking at. For example, there is a trial, I think, in Woodlands, if I'm not wrong, where we are also looking at adjustable weights for outdoor machines. But these are all things we are looking at. And when we have sufficient data and confidence that some of these things work well in an outdoor setting, and we will proceed to roll them out. Thank you.
Mr. Mark Lee.
Thank you, Chairman. Acting Minister have actually mentioned about the IPS survey, and the survey actually indicates that younger Singaporeans are more likely to report feelings of social isolation, and more than half actually say that they find it easier to interact online than face-to-face. But at the same time, museums around the world are evolving beyond quiet exhibition spaces into social venues, right? Hosting after-hours programs that combine arts, music, and interactive activities to attract younger audiences. So we'd like to ask the Minister whether MCCY and NHB would actually consider piloting Museum After Dark programs designed for young adults, perhaps working with the National Youth Council to design formats that actually resonate with how young people actually socialize today. Thank you.
Acting Minister Neo.
So I thank the member for his clarification. Well, we'll certainly be very keen to study as well as pilot possible programs after dark, whether is it in our museums or otherwise. And certainly, National Youth Council want to have a big role to play in this, and I think also want to assure the member that this is something that we are continually looking at. So instead of after dark, NYC has also done programs overnight. Right, they've brought youths to stay overnight at National Museum of Singapore, National Gallery of Singapore, Changi Airport. So the short answer is yes, we are open to study and considering it, and especially in the context that we have an existential problem. Maybe this will help bring up our TFR.
Mr. Tsai Eng-Zo, although you didn't file a card, you can also have clarification.
Thank you, Chairman. I am still a youth.
So thank you. First, I'd like to declare my interest as Executive Director for Chinatown Heritage Centre. I understand that MCCY is developing placemaking initiatives in the locale of Kampong Glam and Little India with the hopes to activate spaces and support heritage businesses. I would like to highlight that Chinatown should also be considered appropriately a historic district with culturally rich, including SG Heritage Business Scheme awardees like Se Tian Heng Buddha Shop, who started in 1896, and Pek Sin Chun, who celebrates its 101 years this year. I would also like to ask if the ministry will therefore consider expanding the coordination and support to Chinatown. My second SQ is for SMS Go. With the MOE OBS challenge be only implemented in OBS-only campsites, I ask this because there are other campsites like Changi Coast and Dairy Farm, Jalan Bahtera. So I'm wondering if those other campsites will be utilized, and whether OBS will be the only operator for the OBS challenge, or will there be other private outdoor adventure companies be operating it as well? Thank you.
SMS Law.
I want to thank the member, Mr. Tsai Ing-zhou, for the clarification. As far as the historic district is concerned, I want to assure him that the new placemaking project office that comes under the interagency task force does indeed not only serve Kampong Glam, Little India, but also Chinatown. In fact, the team is not confined only to MCCY, NHB, but also work across the whole of government, including the economic agencies under MTI, for example, Enterprise Singapore, STB, to come together to support the businesses in the historic districts to strengthen their capabilities in placemaking, number one, to design, to implement, and to scale up the placemaking so that we can boost their vibrancy as well as to drive footfall to the three historic districts, including Chinatown. And we're working very closely with Chinatown Business Association on that. Thank you.
SPS Go.
To the members' questions on sites, for the MOC, yes, it will primarily be OBS sites, so the Pulau Ubin and also the Coney Island campus that will be coming up. But also we want to highlight that the program is also expeditionary in nature, so there would be certain locations that make use of nature and surroundings, so it will be beyond those two campuses. In terms of the operators, OBS will be the main operator or the only operator for MOC. There are other operators out there that conduct camps, but these would be more of your school-run specific camps.
As there are no further clarifications, can I invite Mr. Alex Yam if you'd like to withdraw your amendment?
Thank you, Chairman. 41 questions and 330 minutes later. I certainly think the ministry deserves the $100 back, so I beg leave to withdraw my amendment.
Is the honourable member given leave to withdraw the amendment? I think leave of the majority is given and the amendment is withdrawn. The question is that the sum of $2,407,711,100 for head X stand part of the main estimates. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. The question is that the sum of $677,912,500 for head X stand part of the development estimates. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. Head I, Ministry of Social and Family Development, Mr. Xiao Chen.
Chairman, I move that the total sum allocated to head I of the estimates be reduced by $100. Members on both sides of the House have spoken passionately in this House about social mobility in Singapore. So there's no monopoly on compassion for the least amongst us and no monopoly on ideas to uplift them. Social mobility is one center of gravity in MSF's work. So as GPC chair, I thought to use this speech to contribute to the conversation. And here, I'd like to declare that I am also working in a foundation focused on mobility. But first, let's frame the challenge of social mobility in Singapore precisely. And let me start with this point. Singapore has uplifted lower-income households significantly over the decades. There has been broad-based progress for all. In technical terms, Singapore has kept absolute social mobility very much alive. Each generation has, on the whole, including those in the lowest income segment, been able to achieve much better life outcomes than the previous generation. Yet, between households, higher income households are accumulating advantages even more quickly than lower income households, and therefore, within each generation, the starting points in life between children from higher and lower income families are moving further apart, and the opportunities gap throughout life between children from higher and lower income families is widening, resulting in larger inequalities in outcomes much later in life. In technical terms, therefore, relative social mobility in Singapore is slowing, even as we have kept absolute mobility very much alive. And MOF's occasional papers in both 2015 and 25 bear this out. The key measure for relative mobility is the income distribution of children in their 30s born to fathers who were in the bottom 20% of earners in their 40s. In other words, the starting condition for these children was being born into the bottom 20% by income, and the measure is where these children ended up by income in their adult lives. And in an ideal world, 20% of these children would themselves end up in the top 20% of earners in their cohorts. 20% would end up being in the bottom 20% of earners, like their fathers, and so on. There would be an equal chance, basically, of moving up to the top, or anywhere in between, or remaining at the bottom in an ideal world. But the world is obviously not ideal. So in Singapore, 13.8% of those born into the bottom 20% in the 1985 to 89 cohorts made it to the top 20% of earners, while 25.3% ended up in the bottom 20% of earners like their fathers. So there's an overrepresentation. And compared to the 1978 to 82 cohorts, in other words, those born just 7 years earlier, the 85 to 89 cohorts have almost 1 full percentage point less that made it to the top 20% of earners, and 1 full percentage point more that ended up in the same bottom 20% like their fathers. So relative mobility in Singapore has been slowing, even as we sustained broad-based progress for all. And the natural tendency will be for relative mobility to continue slowing, as it has in many other advanced economies. I must point out, though, that we have been doing better than other advanced economies in relative mobility. In France, less than 10% of those born into the bottom 20% ended up in the top 20%. And even in a Nordic society like Denmark, the figure is at 11.7%. We are at 13.8%, so we are not doing badly at all. But Singapore has never been one to define our values and ideals solely on how we outperform other societies. We chart our own path and we set our own values and ideals. I think we must continue to be a society where relative mobility is alive as much as possible and indeed strengthened if at all possible. Keep the measure as close to 20% as possible and lean against the natural pressures of slowing relative mobility with time. In concrete terms, this means pushing against the natural pressures of ever further starting points in life and the pressures of an ever-widening opportunities gap that compounds through life for our children of today. Our families at the bottom are not stuck, far from it, but we must help their children keep up with families at the top who are pulling away faster. Help children at the bottom keep up from the start of their lives and through life. Or, as Ms. Sylvia Lim said in this House back in 2018, children impacted by their parents' circumstances must be, I quote, supported or facilitated to break out, unquote. However, while we can look to the government with its policy levers to secure broad-based progress for all. In other words, to deliver absolute mobility, it is quite a different story for relative mobility. Keeping relative social mobility alive, essentially containing that opportunities gap between your children and mine, almost by definition cannot be left to the government or, for that matter, the social sector alone. It takes all of us. Those who have done well and can provide the most to their children must play an active role and become part of the solution to create opportunities for those children who start off with less. Indeed, well-known researchers like Raj Chetty and Matt Jackson are showing that in America at least, children from low-income families have a better chance to become high-income as adults if they get opportunities to interact with peers from higher-income families. This likely holds true in Singapore too, so it takes all of us. And indeed, as Teo Yo Yen puts it in her book, this is what inequality looks like. Inequality in opportunities through life is not just the result of policies, but also how everyone at the top and bottom and in between interact and choose to interact with these policies, interact with one another within a social context, and do and don't do certain things. So again, it takes all of us. So those who have done well must play an active role to create opportunities for those children who start off with much less. This is what a We First and mobile society in Singapore can look like. And I think becoming such a society and keeping relative mobility alive in this way will be a defining challenge of our times. So what do we need to get there? First, I think we need scientific knowledge and understanding. Ms. Lim, in the same speech in 2018, called for longitudinal studies that will, quote, track the fate of families at the bottom over time, unquote, and indeed go, and I quote again, beyond numbers to dig deep into the daily lives and evaluate the reasons why they do not seem to be able to catch up with the rest of society, unquote. Now, MOF's occasional papers in 2015 and 25 do provide a longitudinal view on how families at the bottom are doing. They are a very good start. But I agree with Ms. Lim, and today I want to build on her call to really help us in our work to close the opportunities gap throughout life and keep relative mobility alive in Singapore. I think we need longitudinal research in Singapore that goes beyond descriptive correlations amongst group averages to mechanisms that elucidate what actually drives social mobility at the individual level, and models that can predict and simulate how social mobility might change with certain shifts to the drivers of mobility, again, at the individual level. In very technical and academic terms, we can use theoretical networking games and micro-founded structural approaches that overcome the reflection problem arising in reduced form, peer effects analysis in econometrics to achieve this. But in simple terms, we should be aiming for models that show how individuals make decisions and assume certain trajectories in life based on intrinsic factors, extrinsic factors, and the influence of peers on one another. And all this is possible only if we have the right data set. So we must start with data, the right type of data collected to the right fidelity. We need data on the social networks of Singaporeans at the bottom. We need data on cognitive and behavioral traits, on their participation in the economy, not only in the formal sector, but also, and perhaps especially, in the informal sector. We need data on participation in credit facilities, again, both formal and informal, and we will need such data over a long period of time. To my knowledge, there is no such data set in Singapore, perhaps precisely because it is very challenging to collect such data to high fidelity. It requires extensive and deep fieldwork, over a long period of time, and first, building strong relationships of trust. It requires adherence to high ethical standards, including privacy standards that will do no harm to the vulnerable that we are seeking to understand and ultimately uplift. And all these mean it will require considerable and sustained funding. And by the way, such a data set goes well beyond administrative data. Admin data is still critical, but the kind of research being contemplated will need much more than admin data. I urge the government to consider constructing such a data set, investing in such a longitudinal data set with a view to enabling models that will truly transform our understanding of what drives social mobility, what interventions targeting what drivers may work, and work to what extent. But even with such research, by definition, we will only truly know the outcomes of what we do today, 35 to 40 years later. Social mobility is that longitudinal by its very nature. Put another way, we cannot wait for longitudinal research to conclude to tell us what we should do now to close the opportunities gap for our children of today. Deciding what to do now to close that opportunities gap will thus be as much art as it is science. We will need to look to whatever evidence base is available and apply judgment. Consider ideas thoroughly, try to do no harm if at all possible, but act now. And then in 35 to 40 years down the road, we will truly find out how we have done. But so, what do we need to do now, systemically, to close the opportunities gap from the start of life and through life? Let me suggest 3 key principles. First, there is no magic bullet solution. Instead, we need a system of interlocking solutions across multiple domains: academic, non-academic, social capital formation, financial stability, housing, health. Each solution working alongside the others to collectively close the opportunities gap. Second, we need good solutions at scale, more than excellent pilots that remain as pilots. The hardest work is often in scaling and sustaining at scale. And it is this harder work that we need to do to have a chance to meaningfully close the opportunities gap. And third, we need solutions throughout life, not just at any one life stage, but across various life stages to overcome the opportunities gap that compounds through life. Early life matters, and we must intervene heavily in the early years, but we cannot stop there. We need interventions beyond, well into adulthood, to close the opportunities gap throughout life. So on that note, I urge community partners, funders, citizens to all come together to create interventions across domains, at scale, and through life to close the opportunities gap for our children. And the government can play a leadership role here to signpost, coordinate, support, resource, and galvanize. Thank you, Chairman.
The question is that the total sum to be allocated for head I of the estimates be reduced by $100. Mr. Kenneth Tiong.
Sir, there is a gap in how we administer LPAs and deputyship under the Medical Capacity Act. The professional donee framework is too limited, relying too much on named individuals. Section 12(1)(b) requires personal welfare donees be individuals. Organizations are allowed only for property and affairs. The OPG's own list of registered professional deputies illustrates the consequence. 6 social workers and 1 accountant from Touch Community Services are listed individually. Same address at Bukit Merah Central, same email, same phone number. They function as an organization, but the law forces the appointment to be personal. When that social worker leaves, the donor must pay to appoint a replacement. In deputyship cases, the cost comes from the incapacitated person's owned assets. It seems wrong to make the donor pay for a gap in the law. There is also a practical issue with personal appointments. LPAs are made years or decades before activation, meaning individual donees may have retired, emigrated, or died. There is considerable uncertainty whether donees appointed years ago can take up the appointment. Australia's states have addressed this through public guardian offices, providing continuity for personal welfare decisions regardless of staff changes. They charge modest fees and provide the option of being donees of last resort. I ask, Will MSF consider amending Section 12 to allow accredited organizations to serve as personal welfare donees? Beyond that, could Singapore's public guardian serve as donee of last resort, as Australian states have done? Will OPG also issue guidance on what happens when a professional donee falls off the register? And will OPG consider prescribed fee guidelines for professional donee services, given this is a fiduciary service for the most vulnerable and not a competitive market?
Ms. Sylvia Lim.
Sir, as of January this year, there were 410,000 lasting powers of attorney registered by the ministry. Momentum has built up as the benefits of making LPAs become more widely understood. My purpose today is to highlight two groups of people who may not be benefiting from the LPA regime for different reasons. They are first, those without any relative or friend to appoint, and secondly, our low-wage foreign workers. First, those without any relative or friend to appoint. My party colleague Kenneth Tiong has elaborated on why the current LPA regime is not adequate in requiring named individuals and not organizations to take on professional doneeship to manage one's personal welfare. I agree with him that we should consider enabling a donor to appoint the public guardian or the public trustee as donee, as we see in jurisdictions such as Australia. Such an option will assist those donors, as the appointment will withstand the passage of time. The second group who currently have difficulties with LPAs are foreign workers in Singapore under work permits. Though they are relatively young, some of them work under conditions where the risk of serious injury, including mental incapacity, is ever present. Examples include those in physically demanding industries, such as the construction and marine sectors. These migrant workers do not have next of kin in Singapore, and their friends may not be conversant with navigating Singapore's systems and services. Should they suddenly lose mental capacity, they would benefit if a donee could assist them to make decisions about their personal welfare or manage their funds, for example, to send money back to their loved ones at home. So it is heartening to know that Singaporeans are on standby to help. These include volunteers who care deeply about migrant worker welfare and wish to contribute. There are also lawyers who are willing to issue LPAs without charge or take on the role of a volunteer donee if needed. However, the issue the workers face is the high cost of registration of LPAs for foreigners. The registration fee for non-citizens and non-permanent residents is currently fixed at $230. For our low-wage migrant workers, this fee is prohibitive, accounting for a significant portion of their monthly salary. To them, it is simply unaffordable. The public guardian should not have a blanket registration fee for all foreigners, which applies to our high-wage employment pass holders and low-wage foreign work permit holders alike. Our low-wage foreign workers work under tough physical conditions, and we rely on them to do much of the work that Singaporeans are not inclined to do. The least we can do is to make it practical for them to make their LPAs either without charge or at a nominal fee. Such a gesture would go a long way to showing that we really care.
Mr. Gabriel Lam.
Mr. Chairman, MSF has consistently emphasized the importance of strong families, and I support that objective. However, when we speak about strong families, we must ask, what families are we speaking about? And our policies fully align with the lived realities of Singaporean households today. Let me begin with single-parent families. Single parents face a distinct and compounding set of pressures: financial strain, time scarcity, caregiving burden, housing constraints, and in some cases, social stigma. Unlike dual-income households, single parents must shoulder both breadwinning and caregiving responsibilities without internal household support. While MSF provides assistance schemes, much of the framework remains largely designed around a dual family baseline. Single parents often qualify for support only after meeting strict income thresholds, and many fall into a financially squeezed middle, earning too much for sustained assistance, yet too little to comfortably manage rising costs. These are parents who work full-time, care for their children alone, and yet live one unexpected bill away from financial instability. I therefore ask the Minister, does MSF track long-term economic mobility outcomes specifically for single-parent households? Are there plans to recalibrate housing, childcare, and work support schemes to better reflect the time and income constraints unique to single parents? Has the Ministry conducted a comprehensive review of whether current family policies inadvertently assume a nuclear dual-parent model? Mr. Chairman, this leads to a broader question. Much of MSF's effort to encourage strong families appears centered on public education campaigns, promoting marriage, parenting, and shared norms. While public messaging has its place, many families today are struggling not because of a lack of awareness. They are struggling because of cumulative pressures, cost of living, housing affordability, expensive childcare, enrichment expectations, and long working hours. At the national level, we rightly prioritize workforce development and economic competitiveness. But do our family policies receive the same systemic priority? Or have we unintentionally reduced family stability to a messaging exercise, rather than treating it as an economic and cross-ministerial design issue? Is the tradition of nuclear family still the dominant policy reference point? And if so, does that sufficiently reflect current realities, including single-parent households, blended families, delayed marriages, and dual career pressures? I would therefore like the Minister to clarify whether MSF intends to undertake a broader review of family policy design assumptions, whether outcome metrics for family strength go beyond program uptake to measure stability, financial resilience, and child well-being across diverse household types, and whether inter-ministry coordination, particularly with MOM, MND, and MOE, is being strengthened to address root pressures embedded in our housing, labor, and education systems, rather than relying primarily on awareness campaigns. Mr. Chairman, this policy cut is not intended to diminish support for families. Rather, it signals the need to reassess whether our frameworks have kept pace with social change. If we are serious about building strong families, then our policies must be designed not around idealized models, but around the realities Singaporean households actually live with today. Thank you.
Mr. Melvin Yong.
Mr. Chairman, families in Singapore face considerable pressures in our fast-paced and competitive society. Many must manage the cost of housing, education, healthcare, and daily living. For lower-income households, these demands can be especially heavy. At the same time, long working hours in pursuit of job security and career progression often reduce the time parents spend with their children, placing strain on family relationships. Strong and resilient families therefore require sustained support. The Strengthening Families program plays an important role through counseling, parenting workshops, and family bonding activities. As family needs grow more complex, how does MSF intend to further enhance and scale up the program to better support families with facing multiple stresses? Mr. Chairman, I would also like to raise a related issue. Overseas research has observed intergenerational patterns of children being born out of wedlock, often influenced by socio-economic factors. We should be mindful to prevent such cycles from taking root in Singapore. While upholding the importance of marriage and stable families, we must also ensure that children are not disadvantaged by their circumstances of birth. Currently, unwed parents do not receive the baby bonus cash gift, and they are not eligible for tax benefits such as the Working Mother's Child Relief and the Parenthood Tax Rebate. These differences can have a real impact, especially for lower-income single-parent households. Can MSF review how we can better support unwed parents in meeting their children's needs, and whether more local research can be conducted to better understand and prevent potential intergenerational cycles?
Mr. Kenneth Tiong.
Sir, Ms. Loy Wee Mee runs preschool by the park in my ward. EGDA awarded her centre's Make Believe program the Innovation Award in 2023. The NIEC featured her as the expert voice on play-based learning. In January this year, her Li Huan Center announced closure. 52 parents rallied to save it. 2 of them, Nicole and Jasmine, believed enough in the school to take it over themselves. We wish them the best. But the structural challenge remains. Full day fees are $1,655 a month, no government funding. The POP center nearby charges $650. That is a $1,000 gap. Passion alone cannot close it. Sir, this gap is not market created, it is policy created. When government subsidy prices 80% of the market at $610 to $650, that is what becomes what preschool should cost. Parents are not choosing AOP pedagogy over play-based learning. They are choosing AOP prices. At a $1,000 differential, there is no real choice. The squeeze hits labor too. AOP and POP salary targets funded by subsidy becomes a sector-wide wage benchmark. Independents must match or lose teachers, not to better pedagogy, but to better subsidized pay. Every time salary targets rise, independence costs rise with them, but revenue does not. The 20% is expected to innovate, but with what? The differential treatment extends beyond fees. I thank EGDA for extending the manpower hiring grant to independents this January, but it took 2 years. From 2024 to 26, only AOPs and POPs had subsidized talent development. Independents competed for the same shrinking pool of educators at full cost. This is the same regulator funding one team's player development budget and asking the other why they cannot keep up. The end state, 2 tiers and nothing in between. Mass market government preschools on one side, ultra-premium international schools on the other. The mid-tier, where Montessori, Reggio, play-based and inclusive programs for children with diverse needs actually live, is collapsing. Middle-class families lose meaningful choice. Progress is when what was once a boutique pedagogy becomes the base we build for the next generation. Malaysia is doing this. In December 2025, its government revamped the national preschool curriculum to prioritize play-based, child-centered learning. In April, KL hosts the World Forum on Early Care and Education. 500 participants from over 40 countries. Malaysian educators invite Singapore operators to speak at their forums on play and project-based learning. They plan study tours here. Their government is actively driving these reforms. Our neighbors are investing in what our funding model makes unviable. If they are right about early childhood, and I believe they are, the pedagogy gap will open across the causeway as we drive out the very educators they want to learn from. I have 2 asks. First, fund the child, not the school. If the subsidy follows a child to any licensed, quality-assured center, all parents can choose the pedagogy the government's own agency says works. When the gap is $80, parents can weigh the differences. Second, operator-independent teacher funding. If a teacher is L2 certified, why should their salary support depend on which operator employs them? The expertise is here. Our own agency agrees the pedagogy works. What is missing is a funding structure that lets parents act on the agreement. I ask that we let parents choose.
Mr. Melvin Yong.
Mr. Chairman, accessible, affordable, and quality preschools are fundamental to giving every child a strong start in life. First, accessibility means ensuring that preschool places are available and conveniently located across our neighborhoods, so families can enroll their children without undue difficulty. Second, affordability ensures that families from all income levels can access early childhood education without financial strain. And third, quality remains critical. A nurturing and stimulating environment supported by well-trained educators, age-appropriate curricula, and safe facilities enables children's holistic development. A strong core of early childhood educator lays the foundation for our children's cognitive, social, emotional, and physical growth, preparing them well for primary school and beyond. Sir, can the ministry therefore provide an update on the progress made in strengthening the accessibility, affordability, and quality of our preschool sector? At the same time, our early childhood educators are taking on increasing responsibilities. With smaller families and rising parental expectations, educators are expected to do more than ever before. This is further compounded by manpower challenges and the time required to fill vacancies. In this regard, can MSF consider expanding the roles and capabilities of learning support educators beyond special needs support so that they can help augment and relieve pressures on our stretched early childhood workforce?
Ms. Eileen Chong.
Sir, my generation is simultaneously asked to have more children and to support our aging parents so they can age in place, often at the same time and often with the same leave pool. In my maiden speech, I said that caregiving is work and we can and should do more to support our caregivers. Today, childcare and extended childcare leave remains the only legislated form of ongoing paid caregiving leave. Each parent receives 2 to 6 days a year, regardless of how many children they have. Yet we know that caregiving demands multiply with each child and does not divide neatly between siblings. Our leave framework should reflect this reality. The Workers' Party recommends extending childcare leave on a per-child basis up to age 12. We also propose establishing paid family care leave for Singaporeans with primary caregiving responsibilities for elderly parents or family members with severe disabilities. There is the tripartite standard on unpaid caregiving leave, but it is voluntary, only covers hospitalization events, and has only been adopted by a relatively small fraction of employers. It also encourages employees to first use their paid annual leave. So we are back to the same challenge which I raised in my maiden speech. Caregivers burning annual leave time meant for their own rest with no income protection. Singaporeans should not have to choose between caring for their loved ones and taking care of themselves. I call on MSF to seriously consider these recommendations. Thank you.
Ms. Sylvia Lim.
Sir, there are annually around 400 adoption applications in Singapore. Adoptions should be encouraged, not just for the wholehearted act of love that it embodies, but also to mitigate our dismal total fertility rate. It is thus very concerning to receive news of investigations by Indonesia into an alleged baby trafficking ring supplying babies to Singapore for adoption. This raises questions about regional efforts to curb child trafficking. In November 2025, Workers' Party NCMP Andre Loh filed a parliamentary question about regional cooperation among ASEAN countries to protect against child trafficking in inter-country adoptions. In answer, MSF Minister Masagos mentioned the ASEAN Regional Plan of Action on the Elimination of Violence Against Children from 2016 to 2025. Domestically, he highlighted that child trafficking was criminalized under the Adoption of Children Act. He further stressed the robustness of the adoption process, which included the verification of the child's identity papers, travel documents, and conducting checks with birth parents to ensure they had given valid consent and had not offered the child for adoption for improper financial or material gain. In 2022, MSF tabled the Adoption of Children Bill to introduce a specific regulatory framework governing adoption. The framework includes a requirement for adoptive parents to disclose to the court the payments they have made to the birth parents and others in the process and to seek the court's sanctions for these payments. It would also be an offence to obtain the birth parents' consent by fraud, duress, or undue influence. The question is, when it comes to children sourced from overseas, how effective are these provisions? Finally, the ongoing Indonesian investigations have led to delays in adoptive parents applying for Singapore citizenship for their children. In the meantime, adoptive parents would have to pay higher childcare-related expenses without a clear endpoint, which has been straining and demoralizing. I would like to repeat my call to MSF to extend citizen rates to those children, especially when both parents are Singaporeans.
Daniel Cockbig.
Mr. Chairman, I would like to state that I'm a foster parent registered with MSF. I have 3 foster kids with me, including 1 toddler. So there's a real shortage of foster parents. There are about 500 plus child under fostering and the 500 plus under institutions, which is really not a good place to be. But there are about 600 plus foster parents. So I think we should put more efforts into generating awareness and community, amongst the communities, working with the fostering agencies such as Edwards Boys Town, Grace Haven, Muhammadiyah Association, and PPIS Home for Good. The other thing is the foster parents, that they are 24/7. Actually, it's not foster parents, it's really the foster families. So they really have to look after the kids, stabilize them, and nurture them. But there are really issues over the guidance over information's right. So they cannot access the school portals, they cannot access book online medical. So those are the issues that maybe you want to consider really to do a design thinking project, go through the full journey for the foster parent and the foster kids and see where are the pain points and give them the full access as the kids is the primary person that we are looking for after. The other thing is a much more holistic way of looking at fostering. I think currently it's the triad systems where you have the biological parents, the foster parents, they don't really talk to each other, and then you have the caseworkers serving the in-betweens. Well, it has its positive, and there's the reason for it being so they don't sort of interact too much or have conflicts with each other. Now, however, I think we can explore much more intensive co-parenting scheme where in situations that it's possible to bring both foster parents and the biological parents together with the kids as the central of our attention. The whole idea for us is foster parents is to stabilize the kid, gain trust, build bonds, and then interact or integrate them back with the biological parents. That is our mission, and we want to make sure that the bonds continue with rather than disrupted halfway. Thank you, sir.
Mr. Anupang.
Chairman, I rise to speak on the topic of divorcing couples. But let me start with a quick clarification. I'm married, I'm happily married, but I'm speaking about divorce today because divorce in Singapore has been going on an upward trend. In particular, I wish to address the support the MSF provides to help parents transition from being spouses to co-parents. Divorce is not merely the end of a marriage. For many families, it is the beginning of a long co-parenting journey. And for people who pay the highest price when a journey is poorly managed are the children. In that regard, I support the policy intent behind the mandatory co-parenting programs for divorcing couples with children under 21 years old. The structure is good, it is sound. The online e-learning component to set a baseline understanding, followed by physical counseling session to discuss practical co-parenting arrangement after divorce is good. It rightly treats co-parenting as a public good. But if we accept that, then the support must be timely, accessible, and directed to the parent who need it most. Chairman, I make 2 observations about how MSF can improve this in a practical way. I was informed the physical counseling session takes weeks to book, longer waits during festival period, and at more heavily subsidized FSC locations. I urge MSF to strengthen delivery of the program in 3 ways. First, increase the counselor capacity and appointment slots, including weekends and weekdays. Second, expand the schemes to more locations, which includes increasing FSC's capacity where demand is persistently high. Third, use video sessions in suitable cases so physical capacity constraints do not become a bottleneck. Next, Chairman, if the program purpose is to protect children but improving co-parenting readiness, there appears to be a gap in requiring who is required to attend. Currently, only parents initiating or consenting to divorce are required to attend. However, parents contesting the divorce or ancillary matters who may be the one who need it most are exempted. If such parents are outside the program, the intervention only reaches one side of the co-parenting, which undermines the policy purpose. I therefore urge MSF to consider applying the program more equally to all parents undergoing divorce with children under 21 years old. Chairman, this connects to a second issue that often arises in higher conflict divorces. And this is the one that's particularly acute during festival periods, when children access to their family time became more emotionally charged. During the Lunar New Year period, many families were reuniting, celebrating, but for some parents, this is the toughest time of the year because their child has been unilaterally taken away or withheld by the other parent without any court order, contact is cut off, and they're simply told, go to court. The cruelty is that legal processes takes time, and in these cases, time matters most. Because the first days and weeks of separation can disrupt the child's routine, allow untruth narratives to take hold, erode the child's bond with the left-behind parent. In other words, justice delayed is justice denied. While international child adoption triggers urgent return mechanism under the Hague Convention, domestic removals within Singapore do not have equivalent rapid response track, leaving left-behind parents to wait for months while the applications are being resolved in court. Yet the child
The harm caused by sudden separation can be just as real and just as lasting. I therefore urge that we treat domestic child adoption as time-critical child welfare issue by tracking, publishing core indicators, and by creating an expedite judicial pathway with early neutral review, swift restoration of safe interim contact where appropriate, proportionate deterrence against bad faith conduct by one parent, and all-round operational support for parents, so that we protect genuine safety cases while preventing abuse of a remove first, explain later policy tactics, and safeguarding the child's best interests. So I ask MSF, what more can be done? Together with wider families' justice system to ensure that children are not left to bear the consequences of time delay in high conflict cases where contact is abruptly cut off. Chairman, these are practical refinements to existing problems, but they go to the heart of what MSF stands for. Strong families are not only built before a crisis, they are also protected through a crisis. I hope the ministry will consider this improvement so that the system achieves what it's meant to achieve. Better co-parenting, less conflict, better outcome for children. Thank you.
Ms. Rachel Ong.
Chairman, the misuse of AI, particularly through sexually abusive deepfake content, is creating new risks. Children and vulnerable persons, including persons with disabilities, may face impersonation, coercion, and greater difficulty reporting harm. May I ask the Minister what safeguards are in place to protect families, especially children and vulnerable persons, from harmful uses of AI? How is MSF working with other government agencies to strengthen digital literacy among parents and caregivers? Are there specialized support services for victims of AI-enabled exploitation, particularly children and persons with disabilities?
Mr. Sanjeev Kumar Tiwari.
Mr. Chairman, the call to build a we-first society reminds us that growth must uplift every family and that care cannot be left to individuals alone. A society that puts we first must recognize caregiving as real work, whether it is a single parent balancing work and childcare, families raising children with special needs who juggle between therapy appointments and education, or mid-career workers caring for elderly parents while trying to remain economically active. Caregivers embody this spirit every day. They shoulder responsibilities not just for themselves, but for families and loved ones, often while continuing to work and contribute in society. For many caregivers, the challenge is not only financial support, but having the confidence that help will be there in a timely and predictable way, as care needs evolve unpredictably over time. As such, can the Minister share how MSF is strengthening integrated support services for caregivers? How are social, employment and healthcare touchpoints being better aligned to provide caregivers and their families with continuity, assurance and sustained support across different stages of their caregiving journey, so that they can continue caring, working and contributing with confidence? With that, it also brings us as a we-first society. We must also care for those who serve others. Social service professionals and MSF officers operate in a high-tech, emotionally demanding environment, often under manpower constraints. As the Ministry advances digitalization and service transformation, how is it ensuring caseload sustainability, safeguarding officers' career development, upskilling, mental well-being, and mitigating risk of burnout, so that social services sector remains a rewarding and sustainable career for officers? If we truly believe in a we first, then caregivers and the officers who walk alongside them must feel that the system stands firmly with them. Thank you.
Mr. Melvin Yong.
Mr. Chairman, some lower-income families face layered and persistent challenges that cannot be resolved quickly, even with well-designed incentives. They may be coping with unstable employment, caregiving responsibilities, debt, housing constraints, or children with additional developmental needs. These challenges often interact and compound one another. Even when families are making sincere efforts, attending coaching, enrolling in programs, seeking employment, or upgrading skills, progress can be gradual and uneven. Milestones such as clearing debt, sustaining employment, or ensuring consistent preschool attendance take time, especially when setbacks occur. In such circumstances, achievement-based progress package, though well-intentioned, may feel distant and difficult to attain. When goals seem too ambitious, families may feel discouraged despite genuine effort. This can dampen motivation and affect take-up, particularly among those who already find the journey daunting. I therefore welcome this year's enhancements to Comlink Plus, including new payouts, smaller but more achievable milestones, and cash incentives. Recognizing incremental progress and celebrating step-by-step gains will better support families on a realistic and dignified path towards stability and upward mobility. Could the Ministry share more details on how these new milestones will be calibrated and how the enhanced payouts will better reflect sustained efforts? How does MSF plan to strengthen the Comlink Plus ecosystem, including both employers and community partners, to better recruit, support, and retain beneficiaries in sustained employment?
Mr. Chai Ing-zhou, you can take your 2 cards together.
Thank you, Chairman. My both cards will address guardrails for protecting our children in low-income families. In the book Alone Together, the author Turkel examines the increasing reliance on digital devices and social media and the paradox of being alone together, feeling both connected and disconnected in an increasingly digital world. Apart from loneliness, academic studies show how technology addiction leads to anxiety, depression, even aggression, attention deficit, and hyperactivity disorder symptoms. While the government has banned smartphone usage in secondary school, excessive screen time outside school hours remain a challenge, especially for children from low-income families. In my house visits to rental blocks, I often see parents occupying children and even infants with screens, smartphones, tablets, and TVs. Parents share their struggles and challenges of being busy at work, health, or other caregiving responsibility. Therefore, children are often left to their own devices, literally. In this case, the ones occupied with digital screens are unsupervised and without parental restriction guardrails. It is crucial that while we push nationwide for a reduction of our child's and children's exposure to screens in schools and age-appropriate content, our home environments are not left behind. I would like to ask the Ministry how it specifically considers the needs and context of lower-income families and work with agencies to provide additional support when developing screen time policies in schools, after schools, and at home. Mr. Speaker, while Budget 2026 rightly strengthens supports for Comlink Plus families, the effectiveness of this support relies entirely on successful engagement. In my interactions with families, I've observed recurring challenges: families who remain uncooperative or deeply disengaged. This is often driven by the exhaustion of juggling multiple commitments, personal crisis, or lack of trust in the Comlink system. This lack of engagement creates a critical blind spot. It makes it difficult for family coaches to assess genuine needs, maintain continuity of care, or escalate cases where serious concerns such as family violence or child safety may be involved. When engagement is inconsistent, the human touch and the trust built by a dedicated coach is easily lost. We must recognize that unresponsiveness itself is often a signal of deeper and more complex challenges. We cannot allow these families, especially for their children, to fall through the cracks. I have 2 clarifications on this front. First, what are the specific protocols for engaging within the Comlink Plus Alliance Working Group and its partner agencies to re-engage families who have become unresponsive? Second, would the Ministry consider a formal escalation pathway for such cases to Family Service Centre for deeper social work interventions when initial coaching efforts fail to gain traction? Ensuring the safety and well-being of these children in these households must remain our absolute priority. Thank you.
Ms. Mariam Jaffer.
Earlier this term, I spoke of the need for joined-up longitudinal pathways in education, health, and careers that follow a family across life transitions so that no one is left to fall through the cracks. Budget 2026 takes a meaningful step in this direction through the enhanced Comlink Plus framework. Comlink Plus is not just short-term relief. It is a mobility platform. Its strength lies in its progression engine. When support is integrated, milestones are clear, and progress is sustained. Families do not only cope, they move forward. I welcome the enhancements in Budget 2026, higher cash payouts tied to stable employment and preschool attendance, intermediate milestones, higher caps, and a new $500 quarterly partnership payout. These strengthen the incentive structure. But if Comlink Plus is to become the architecture of modern social mobility, 5 shifts matter. First, integration must be structural, not best effort. A family may juggle a family coach, a healthcare team, an employment officer, a school rep. That's a lot of people. Could we move towards one shared progression plan across agencies, one dashboard, one set of goals, one coordinated journey? I asked the Minister if MSF is moving in this direction so families experience genuine integrated support rather than parallel case files. Second, design for fragility. Progress is rarely linear. A contract job ends. A grandparent falls ill. A small shock can reverse months of work. We must recognize momentum, not just milestones. As Comlink Plus scales, how will MSF ensure temporary setbacks beyond a family's control do not permanently disqualify them from progression payouts? Third, scale must not dilute trust. Trust is the foundation of transformation. One trusted person who knows their story, who checks in, who believes in them, and they do not believe in themselves can make all the difference. As we scale, how do we protect that relational core as numbers grow? Fourth, measure transformation, not transactions. Not just payouts issued, but jobs retained, sustained preschool attendance, debt reduced, stress stabilized. The coaches have the capacity and tools to anchor this deeper work. Fifth, mobility must include future readiness. With AI reshaping our economy, digital literacy, AI familiarity, and tech-enabled income pathways must be part of progression goals. If we do not equip families for the economy of tomorrow, we're stabilizing them for yesterday. If we get this right, Comlink Plus do more than support families in difficulty, it will restore belief. And in a society facing inequality and technological disruption, belief may be our most precious asset. Let us design Comlink Plus not only as a ladder out of hardship, but as a national statement that in Singapore, mobility is never accidental.
Ms. Denise Phua.
Mr. Chairman, I thank the government for appointing the task force on assurance for families with persons with disabilities, chaired by MOS Mr. Goh Pei Min. This task force is timely. Singapore already has a strong national roadmap in the Enabling Master Plan 2030, but there are pressing key concerns of families, particularly about adult life after school. The task force cannot give assurance to these families without addressing these key concerns. Let me focus on 4 persistent gaps that the task force should address decisively. 1, on funding reform. Mr. Chairman, disability spending today is front-loaded toward childhood, while adult services operate under very tight margins, even though adulthood can last 60 years or more. We therefore need funding reforms based on a lifespan approach. One way forward is a 2-tier structure. Let's start with the obvious Day Activity Center, DAC, and residential home models for adults with moderate to high support needs. First, provide a universal base funding component for every client served by a DAC or residential home. This base amount should be calculated using a realistic norm cost of care, reflecting staffing ratios, program costs, and operational realities. Second, on top of this base, apply a means-tested subsidy to ensure affordability for families who need them. Service providers such as the social service agencies are not naive. If every additional client requires more fundraising, the system becomes unsustainable. Eventually, service providers will withdraw, and government may have to operate these services directly, which could cost even more. Funding reform must align care complexity, workforce reality, and sustainability. Gap 2, disability employment resilience in an AI economy. Sir, many traditional entry-level roles for persons with disabilities in both blue and white-collar jobs, such as packing, sorting, basic admin work, and even coding, are replaced by AI-driven automation. If we do nothing, then inclusive higher gains that have been made in our last decade will reverse. We must therefore shift from protecting old jobs to designing new work. The task force should consider a national disability job redesign fund to support the identification of jobs at risk, surface new jobs in the new economy, redesign workflows to allow PWDs who can contribute, and strengthen job coach capability. Failure to do so intentionally, effectively risks reversing the years of good work that SG and ABLE, disability partners, and inclusive employers had already put in. Gap 3, life planning and post-parental assurance. The most common question families ask is this: what happens when parents lose capacity or die? We therefore should institutionalize life planning and continuity protocols and encourage families to be part of the solution instead of worrying. Planning should be supported, subsidized, and normalized. When death or incapacity occurs, the system must respond with speed, coordination, and stability. For families with higher needs, introduce a family life navigator model, similar to the family coach approach in Comlink Plus. Just as Comlink Plus supports vulnerable families with a dedicated guide across life transitions, a life navigator could help disability families plan school-to-work transitions, housing options, caregiver aging, long-term care arrangements. A resilient system empowers and supports families to act early instead of relying solely on government. Lastly, on a thoughtful convergence with mainstream elderly services. So as Singapore ages, disability and aging will increasingly overlap. The line between disability services and elder care services will blur. Many adults with disabilities face similar challenges as seniors in varying degrees, but at a younger age. Singapore has built strong foundations, infrastructure for aging, active aging centers, community care apartments, home and community-based care services, even silver generation ambassadors, healthy SG. If we design a support architecture that connects disability and aging systems more intelligently and thoughtfully, we reduce duplication, improve outreach, and enhance social compact. This is the assurance that families are asking for, and the post-school cliff we must level. So let us be visionary and bold, and I wish the task force all its very best.
Ms. Kua Boon Teng.
"21 years ago, I was blessed with my youngest child. My son has autism and is nonverbal. Being his mom has been a joy, but it's also the biggest challenge in my life. In the short time I've been in NMP, I've had the opportunity to learn more about the ministry's plans to support families navigating the complex journey of raising and caring for loved ones with special needs. I'm grateful for the assurances that this is an area of priority and a key aspect of our plan to become a more inclusive society. I know that the government's heart is in the right place, but the key in ensuring that we actually deliver on the stated mission of becoming a more inclusive society is in how we execute our plans. For this, we must listen to the families we seek to serve, which is why I'm going to share my perspective as a parent and a caregiver. Number one, we must provide a stable and secure care environment. If you care for someone with special needs, you will know how long it can take to get them acclimatized to a new environment. This is why the transition periods are the hardest. All we want is for them to adjust to a school, vocational institute, or DAC that can support their needs as soon as possible. Waiting months or years for placement isn't just a logistical delay. It results in regression in skills, desocialization, and isolation, and shifts the full burden of care back onto families, often leading to chronic stress, physical exhaustion, and even anxiety and depression among caregivers. Upheaval and change is especially traumatic for this vulnerable group. The shortage of places for those graduating from SPED education has been a problem for years. Imagine an ASD child who has adjusted to the routine of school, graduates only to find that there is no ready place for him or her to go to. It would be unthinkable if this happened to our normal school-going students, and yet we expect families with special needs children to wait. When we know that the need for predictable schedules predictable schedules is especially important in this group. We will soon be adding another 3,000 SPED school places by 2030. We would not be doing so if the demand was not there. So while it's been announced that another 500 DAC places will be available by 2030, I firmly believe that this will not even come close to fulfilling the actual demand. It seems like we are perpetually trying to play catch-up to a gap in services that's only getting wider. We can and must do better. We need an aggressive expansion of facilities and a commitment to eliminate waiting times altogether. Those who graduate from SPED school should have ready and available placement options for them to ensure seamless transition. For this to happen, we need a lot more funding to DAC providers who have to meet the high cost of delivering such services so that they're able to confidently expand their offerings, recruit more trained staff, and maintain high-quality care. Number two, we must make such care affordable to those who need it. The high cost of DAC fees may be resulting in underrepresentation of the actual demand. For DACs who cater to those with high support needs, even with present means-tested subsidies, the current fees will still be unaffordable to many in the sandwich class. This must be reviewed. There is nothing more painful or emasculating to a parent than knowing that they cannot afford to get their child more help, or they have to sacrifice the needs of their other children to meet the expenses of the special needs kid. Number three, we need to give parents the peace of mind that there is a long-term plan for the continued learning and enhanced meaningful engagement of their special needs adult children. The biggest fear of parents is who's going to look after my child when I'm gone. We need to support the entire family unit, including siblings and extended family members, so that they feel ready to shoulder the responsibility of continuing care. And in this respect, I support Ms. Denise Pua's suggestions. The true measure of our society is in how we treat our most vulnerable and those who care for them. We must commit to a future where no family is left to struggle in the shadows of a wait list. By providing prompt, guaranteed access to vital services, we are not just helping individual families, we strengthen the very fabric of our community. Thank you.
Professor Kenneth Poon.
Mr. Chairman, I declare my interest in this area as the past president of Rainbow Centre, Singapore, a social service agency serving persons with disabilities, and as a researcher examining the life course of persons with neurodevelopmental conditions. Now, in a study I conducted about 2 decades ago examining the futures of persons with autism in Singapore, what must have been the most difficult question I asked parents was, and that was raised just earlier, what are the plans for your child when you are no longer able to care for him or her? Most parents shared their worries and concerns. Some parents described plans, often involving siblings or relatives. For others, the response was silence, and many conversations were accompanied by tears. In a related work, parents of persons with disabilities consistently ranked outcomes linked to safety, stability, and personal satisfaction as their top priorities for their child. Yet many remain uncertain about how those outcomes will be attained. There is now greater urgency for 3 reasons. First, persons with disabilities are living significantly longer due to advances in medical care. For example, a local report by Child in 2024 indicates that individuals with Down syndrome now have a life expectancy of about 60 years. Second, while caregivers are living longer, the gap between lifespan and health span means that many parents anticipate a period where they may still be alive, yet no longer physically or cognitively able to provide the sustained care. Third, families are smaller. This means fewer siblings and extended kin available to assume long-term caregiving responsibilities. Taken together, these trends suggest that families of persons with disabilities can no longer, as in the past, rely primarily on informal family support. Future support, therefore, needs to be anticipated, structured, and supported. So during the budget debate, I introduced 4 questions as a lens for considering how initiatives strengthen Singapore's social foundations. I would like to apply them to the present context of what happens to persons with disabilities when parental caregiving is no longer available. I think it's important to acknowledge that Singapore has made important progress in adult disability services through successive enabling master plans. And I acknowledge the recent establishment of the multi-agency task force on assurance for families with persons with disabilities chaired by Mr. Goh Pei Ming. Adult disability support often extends across several decades. So this raises for us a broader systems consideration. Do we have a consistent anticipatory framework for planning the continual care and participation of persons with disabilities? In particular, I'll be grateful if the Minister can clarify the issue raised also earlier by my honourable colleagues, Ms. Denise Phua and Ms. Kwa Boon Teng. First, whether structured family care pathways are initiated well before caregivers are unable to provide support. Second, on how siblings and other potential caregivers are systematically engaged in transition planning. And third, how the voices of persons with disabilities themselves are meaningfully incorporated into decisions about their future arrangements, support structures, and participation in community life. Sir, the issue before us is not simply provision of services. It is an assurance that our citizens with disability will continue to live lives of dignity, stability, and participation even when parental care is no longer available. Thank you.
Mr. Tsai Ing-tou, not here. Ms. Rachel Ong.
Chairman, many persons with disabilities and employers remain unaware of available support for inclusive employment and daily living. A recent SMU survey found that 8 in 10 PWDs have never heard of employability training programs, and fewer than half of employers were aware of workplace grants and hiring incentives. While portals such as SG Enabling Guide provide useful resources, information is spread across multiple platforms, making it difficult for PWDs and caregivers to navigate support. May I ask MSF, how will we communicate on employment, living, and community support for PWDs be improved so individuals and employers are better informed? Will the government consider a single centralized portal that brings together training, employment, housing, social activities, and financial assistance so PWDs and caregivers can more easily access support? Thank you.
Mr. Ng Chee Meng.
Chairman, I thank the MSF, especially SG Enable, for the good work in uplifting persons with disabilities. Today, more than 30% of PWDs are in employment, with a roadmap to move up to 40% by 2030. The task force on assurance for families with persons with disabilities will also be doing more in 3 key areas: employment, community living, and affordability. I have families in Jalan Kayu with special needs children. Key concerns of these families include the availability of education and support services, financial support, whether they can help their children find employment or remain engaged, and what will happen to their children when they pass on. In one particular case, I met a pair of aged parents last year caring for their 30-plus-year-old autistic son. He is on the severe spectrum side of the needs. Since then, the father has passed on, and the mother now cares for the son alone. I would like to ask the ministry what practical strategies will be looked into to better support our families with PWDs, especially those who have graduated from the schooling system, and what more can be done to improve their employment prospects or remain engaged and cared for during their lifetime.
Ms. Rachel Ong.
Chairman, today, very few counsellors are trained in Singapore Sign Language. Thus, deaf clients often rely on interpreters from an already small community. This often limits privacy and discourages self and help seeking. One deaf individual received counselling only after a very long search. In countries such as Canada, sign language counselling is provided as a standard service. May I ask the Minister, how can we expand the pool of Singapore Sign Language trained counsellors and integrate sign language competence support into mainstream mental health services? Will MSF review funding and support schemes to ensure Singapore Sign Language interpretation is systematically available across counselling, social support centres, crisis response services, so deaf Singaporeans can access help confidentially and equitably? Thank you.
Minister Masagos Zulkifli.
Chairman, I thank members for the views. MSF aims to foster a Singapore society where all families are supported at every stage of their life to thrive on their terms. Before I elaborate on our approach, let me outline what my colleagues will share. MOS Zulkarnain Abdul Rahim will detail enhancements to support lower-income families. SPS Eric Chua will elaborate on our efforts for families with persons with disabilities. And MOS Goh Pei Ming will touch on how we will strengthen support for our families. At MSF, our policies are anchored on 4 core principles: family centricity, proactive and upstream intervention, strengths-based approach, and whole of society partnership. These principles are enduring, even as we face increasingly complex issues. First, we prioritize family centricity because the family is the basic unit of our society that provides emotional support and imparts values. Working with individuals may address immediate symptoms, but it does not tackle issues at its roots. We must build strong family relationships in order to bring about sustainable change. This is why, for all children, we seek to set good foundations for optimal health and development within family relationships and environments. For ComLink Plus families, we develop a holistic action plan with the family after assessing their needs. For persons with disabilities, we do not neglect the well-being of caregivers and family members. Our second principle is proactive and upstream intervention. We strive to provide early support to build strong foundations and address root causes before they escalate. Third, we focus on the strength of our clients rather than their deficits. By harnessing their strengths and assets, individuals and families are and can be empowered to achieve good outcomes. Fourth, we work with the whole of society to weave a strong ecosystem of support. MSF has been working alongside our social service agencies, or SSAs, corporates, institutes of higher learnings, IHLs, and the community to better understand clients' needs, fine-tune our policies and programs, and to journey with our clients. Such strong partnership is key. When we work together, we unlock new synergies, spark innovation, and build better solutions for our clients. To build a better tomorrow for all families, we will further strengthen these partnerships. We will do this through the following 3 Cs: collaborating with our partners, cooperating with regional and international counterparts in shared priority areas, and co-creating to develop innovations of tomorrow. Let me elaborate. The first C refers to working collaboratively with partners to better serve families and individuals. In recent years, we have stepped up collaboration with sector partners to make a greater impact. We'll continue to invest in such collaborations, and especially with 4 key groups: government agencies, SSAs, corporates, and IHLs. First, we are collaborating with government agencies to better support lower-income families and improve social mobility, a key concern raised by Mr. Xie Yao-Chuan. In 2025, MSF trialed the social health integration model with MOH for Comlink Plus families to ensure that health challenges do not hinder their social mobility. Under this model, family coaches and healthcare staff came together to support families to adopt healthy lifestyles and to access suitable services. Later this year, we'll bring more Comlink Plus families on board this trial. Today, only residents above 40 and above can enroll in Healthier SG. From 2027, MOH will extend Healthier SG enrollment to eligible Comlink Plus residents aged 25 to 39. With this, more Comlink Plus residents can benefit from personalized care from a trusted family doctor, subsidies for screening tests, as well as vaccinations. They will also be able to access Health Promotion Board programs via the Health 365 app. We'll share more details in due course. Second, we are collaborating with SSAs to support families. Families may require support in navigating conflict. For example, MSF works closely with SSAs under the Strengthening Family Program, or FAM, which provides counseling support for them. Over the past decade, we have worked closely with the Family Justice Courts, FJC, to adopt a therapeutic justice model in resolving familial disputes so that the family can benefit from a restorative, holistic, and forward-looking approach. We have expanded our support for couples going through divorce, which Ms. Diana Pang spoke about. Since July 2024, all couples with minor children must go through the co-parenting program run by FAM centers. And that's before they file for divorce. We hope this will prevent disagreements later over child access. But if such disagreements arise, couples can still approach the FJC for mediation or apply for a child access order or to enforce an access order. We want to encourage more couples to seek help early and not only at the point of divorce. Therefore, MSF will work with FAM centers to ramp up family counseling capacity. By 2030, we'll be able to see and serve, 12,000 cases, double of today's caseload. Members of the public will be able to access both in-person and online counseling services. In the meantime, we'll make and continue to make family counseling more accessible and provide self-help resources online to better support families. Third, we are collaborating with corporates for more impactful philanthropy. In 2024, MSF and NCSS launched the Sustainable Philanthropy Framework to encourage corporates to integrate social impact with their business goals and engage in more consistent giving and volunteering. I'm heartened that many corporates have adopted this framework. For instance, DBS has pledged up to $1 billion and 1.5 million employee volunteer hours over the next decade to better support those with less means, including $6.5 million to Kickstart and $30 million to the Comlink Plus Progress Package. DBS has also embedded giving into their corporate culture, and we hope more organizations will do the same. fourth, we are collaborating on research and program evaluation to build a strong evidence base for tomorrow's solutions. We work with various IHLs to build up our knowledge base of what works best in Singapore. Mr. Seah called for longitudinal research to understand better the drivers of social mobility. We agree, which is why we have collaborated with the Institute of Policy Studies, IPS, on a longitudinal study called PATH, or Pathways and Trajectories of Households in Singapore, to better understand this. Other partnerships include effectiveness of Comlink Plus progress packages with IPS and SUSS. Through these collaborations, we hope that our IHLs will produce renowned experts and build an impactful body of knowledge on support for families and thereby lead in this field. The second C stands for cooperate, and in this context, cooperating with regional and international partners. Because we need to work together with others beyond our shores in strengthening families, early childhood education, development, and social mobility. We seek to do this at the government level, academia, as well as practitioners. This is because challenges confronting Singapore are not unique. By cooperating with like-minded partners, we can exchange ideas and evolve best practices to better serve our respective clients. One initiative involves our regional neighbors, Cambodia, the Philippines, and Thailand, who have been keen to learn from our experience in setting up EGDA and the Kickstart program. Last month, we launched the Capability Exchange Program to create opportunities for learning and exchanges among government officials and practitioners from these countries. This program will establish a strong network and foster cross-sharing of evidence-based approaches to benefit young children and families. Other platforms include conferences where researchers and policymakers can interact and germinate ideas and relationships. Last year, MSF and IPS co-organized the inaugural International Conference on Societies of Opportunity, or ICSO, bringing together local and international thought leaders to discuss how we can better create opportunities and strengthen social mobility for our people. We will further such collaboration at ICSO in 2027. We also organized the biennial Asian Family Conference, a dedicated regional policy practice research platform to discuss emerging family needs, policies, and practices. Later this year, we will share findings of the inaugural regional collaboration between Singapore and ASEAN member states that will enable us and our regional partners to better support families in our respective countries. I'm excited by the new opportunities that such partnerships bring so that we can do better by and for our people. Before I go to the third C, let me touch on our professionals. Professionals are the backbone of our sector. To enable them to deliver their best, we must first ensure that they are well supported and cared for. Mr. Sanjeev Kumar Tiwari asked about support for professionals' development and well-being. SSAs can leverage training subsidies and sponsorships under the Professional Capability Grant to support staff development and upskilling. Recently, we enhanced the schemes to benefit more professionals to support their development and retention. Eligible social service professionals may also tap on the sabbatical leave scheme, which gives them 10 weeks of paid leave to recharge and refresh. For protection practitioners, we launched the Protection Practitioners Care Fund to enable SSAs to implement well-being initiatives and practices to support them even better. Officers at MSF can access Wellbeing at Gov, which provides well-being resources, coaching, and counseling services. Those in the protective services receive additional support, including clinical supervision and peer support groups. But support for professionals does not stop here. We will leverage AI and technology tools to enhance their quality of life and work while making work more impactful. This is how the third C comes in, co-creation. Co-creating innovation of tomorrow that will improve the quality of life, not only for the social sector staff, but also for their clients. As the sector developer, NCSS is working closely with public and private sector agencies to develop and drive adoption of AI and technology solutions across the sector. One such example is Scribe, a tool developed by Open Government Products that translates and summarizes conversations in multiple languages and transforms transcripts into structured notes. Just over the past year, over 100 SSAs have adopted Scribe. We have heard from many social workers that Scribe has saved a lot of time and allowed them to focus on what they care most, their clients. For the early childhood sector, Mr. Melvin Yong will be pleased to know that under the Refresh Industry Digital Plan, ECDA will be supporting preschools to adopt AI-enabled tools, including AI video and analytics solutions. Specifically, these tools will support preschool educators and leaders in tasks such as curriculum planning, portfolio management, and reviewing CCTV footages. Ultimately, our goal is to ease our professionals' workload, enhance their well-being, and improve care and education of our children. At MSF, we have also similarly incorporated AI and technology solutions to support our officers in their work. For example, in our youth homes, time-consuming processes such as filling out paperwork and cross-referencing files are now digitalized under the Home Central Information System. Officers also use AI tools such as PAIR and AI bots that generate first drafts to help officers work more efficiently. Taken together, youth guidance officers such as Mr. Rainer Ho now have more bandwidth to engage with youth, which is the most fulfilling part of his job. Beyond these examples, there's still more potential for technology to be harnessed to improve the quality of life of our professionals. But I will now turn to our clients. In the past few years, MSF has worked closely with the sector to co-create innovative solutions to make our services more client-centric. One example would be the Family Services Landscape Review, which we announced in 2024. We have been engaging SSAs, practitioners, and other stakeholders to reimagine how we can better support our clients where they are. One-stop shop, something Ms. Mariam advocated for. Another example would be Enable Living Program, where we work with our partners to pilot innovative approaches to empower persons with disabilities to live independently, build meaningful connections, and enhance their overall well-being. In addition, we want to push the envelope and co-create AI and technology solutions that directly enhance the quality of life of our clients. In my work trips to China and Qatar last year, I was deeply impressed by the adoption of innovative AI solutions and the possibilities they presented to enable persons with disabilities to work, live, and play. For hearing-impaired individuals like Mr. Remy, he's a desktop engineer at NCS. New technologies coming on stream can be very empowering socially. For instance, with the real-time transcription and translation capabilities of the LL Vision's AI-powered classes, Remy is able to converse better at home with his mom, whom he lip-reads in Malay. And of course, the AI machine needs to learn Malay better. And also with his daughter's Mandarin teacher, which he doesn't need translation because the AI will do it for him. In Qatar, hologram assistants that can respond to hearing-impaired persons via sign language are installed in public spaces, including public transportation sites. These technologies may only impact a small proportion of our society, but the impact is profound on the beneficiaries in the family and their families. And when we collaborate and cooperate with regional partners, it allows us to have greater scale that will attract support for the development and adoption of such technology. For persons with disabilities, SG Enable will continue to champion the responsible use of AI and technology solutions, a topic that is close to Ms. Rachel Ong's heart. Subsidies are provided to persons with disabilities under the Assistive Technology Fund to purchase assistive technology devices to enable independent living. SG Enable will curate more devices and continue to curate more devices for persons with disabilities, including those enhanced by AI capabilities. Under the Enabling Lives Initiative grants, funding is also provided to support AI solutions that improve independence and expand employment opportunities for persons with disabilities. One example would be IC, AISEE, an AI-powered wearable device that enables persons with visual impairment to better understand their surroundings through voice prompts. Beyond the belief that AI and technology take away jobs, they can, in fact, be a force for good. Enablers that allow us to break new ground, both in how we support our professionals and clients. I'm excited by its potential and possibilities. Chairman, I will now conclude. Our goal is clear. We want better for our clients and families we support. Better outcomes, better opportunities, better lives. This is what drives our work at MSF. The way to achieve this is through all of us working together and staying united amidst global uncertainties. At MSF, we are making progress with our partners across the social service sector, with corporates, with IHLs, with volunteers, and with the community. Together, we have been able to make strides in nurturing resilient individuals, strong families, and a caring society. I'm heartened that since the launch of SG Gives last year, we have seen over $100 million in donations made to the Community Chest, President's Challenge, and the Collective for Stronger Society. The government will match these donations to amplify our collective impact and support communities in need. But there is more we can do. I call on all Singaporeans to join us in this endeavor. When we work together, we unlock new possibilities and achieve far better outcomes than what we can accomplish alone. It is this collective spirit and the willingness of Singaporeans to support and empower one another that drives real and lasting change. Which is why MSF will soon launch a campaign, Better Starts With Us. Because at MSF we believe it is through this shared commitment that each of us, we are not just building a strong and united society, but a Singapore that is a great place for all families to achieve their goals and aspirations. Thank you, Chairman.
MOS Zulkarnain Abdul Rahim.
Chairman, may I seek your consent to move that progress be reported and leave be asked to sit again?
I give my consent.
Chairman, I move that progress be reported and leave be asked to sit again.
Question is that progress be reported and leave be asked to sit again. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it. MOS Zulkarnain Abdul Rahim.
Mr. Speaker, I'm glad to report that the Committee of Supply has made progress on the estimates of expenditure for the financial year of 2026-2027 and ask leave to sit again tomorrow.
So be it. Leader.
Mr. Speaker, I move that Parliament do now adjourn.
The question is that Parliament do now adjourn. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it. Order, order.